So let's start out with the neurological system. Can you tell me again, just remind me who you are, what's your name?
My name is Jeremy.
Okay, and where are you today?
At the hospital.
Okay, and about what time of day is it?
It's about 11.
Okay, so oriented to person, place, and time. And do you know what you're doing here?
Yes.
Okay, so what brought you in? Just remind me why you're here in this situation.
I had shortness of breath.
Okay, so you came into the hospital.
Yeah.
Okay, so you seem like you know what's going on. Do you know what year it is?
2023.
All right, wonderful. Just testing a little bit of memory. What's the last place you traveled or visited?
California.
Okay, so that's all good. And then who was the first president of the United States?
George Washington.
Okay, all the thinking looks intact there. So I'm going to give you this board here to test some of your cognitive abilities. And the first thing I have you do is just draw me a square. Okay, and I'm going to put some numbers on here, and I want you to just do a little bit of math. Okay, can you write out what that is? Very good. 4 plus 2 equals 6. And I'll do one more that's a little bit more complex. Good. 6 times 5 equals 30. I'm going to write a sentence here. First, can you just read that for me, please?
The boy jumped into the pool.
Okay, and I want you to circle the subject of the sentence. So very good, the boy, and then the verb, correct, jumped, and then the noun where he jumped into the pool. All right, very good. All right, repeat after me. No ifs, ands, or buts.
No ifs, ands, or buts.
Okay, so all of that's intact as well. So far I'm not seeing any deficit in the neurological systems, but let's go ahead and continue with the cranial nerves. So first thing is just, could you make a couple of faces for me? I want to test the strength in their face. Could you raise your eyebrows up really high? Okay. And can you close them really, really tight? Okay. And puff out your cheeks for me. Good. And just for symmetry, relax and stick out your tongue. And move it side to side for me. Very good. Good symmetry there. I'm just going to take a look, and I want you to do that all again against just some resistance. Test those facial nerves, so up against my hand. Good. And close your eyes nice and tight, and don't let me open them. Good. Puff those cheeks out. Good. And just push your tongue into my finger here and into my finger there. Okay, good strength there. I want you to open and close your jaw for me, testing the trigeminal nerve, and clench your teeth. One more time. One more time. Good. All right, I'm going to test your ability to smell and taste, and we'll go ahead and we'll check the nose and the mouth a little bit later with a different system. But for right now, are you having any difficulties with smell or taste?
No.
So I want you to close your eyes, and I've got 2 smells here. I want you to just close one of your nostrils for me, please, and just breathe in. Okay, so that's patent and clear, so go ahead and keep that closed and tell me what this smells like. Take a big breath.
Garlic, maybe?
That's correct. Okay, now please cover the other nostril, and breathe in. And okay, relax. Now I'm going to have you take another deep breath in and tell me what that smells like.
Coffee?
Yep, that's perfect. That's excellent. And now I'm going to give you something to taste, and I just want you to taste just a little bit of it. Again, close your eyes and just let a little bit of it hit your lips. Are you able to get that taste there?
Mm-hmm.
Okay, what does that taste to you? Like
Lemon?
Yep, lemon or sour. Very good. And would you like a little drink of water to wash that out of your mouth?
Sure.
Okay, there you go. Okay. I'm going to move on to your hearing now. Just checking the ears. Any pain when I touch you on the ears?
No.
Okay, look inside. Okay. All right. So the ears do look fine. Just checking the outside. Same thing here. Got a glove here, okay? And do you hear that little sound?
Mm-hmm.
All right, close your eyes. Just tell me which side you hear it on.
Left. Right. Right. Left.
Okay? And make a little bit of a soft noise, and I just want you to tell me when it goes away.
It's gone.
Okay, same thing here.
It's gone.
Okay. I'm going to whisper something into your ear, and I just want you to repeat after me. I'm going to hold the other ear down so you can't hear it with that ear.
4, 5, 6.
Very good. Same thing on this side.
D, E, F.
All right. I just want you to tell me if you hear it left, right, or equally on both sides, okay?
Equal.
Very good. And do you hear this here behind your ear?
Mm-hmm.
Tell me when it goes away.
It's gone.
Can you still hear that there?
Mm-hmm.
Tell me when that goes away.
It's gone.
Okay. I'm going to do the same thing on the other side. Again. Do you hear this?
Mm-hmm.
Tell me when it stops.
It's gone.
What about? Tell me when it goes away.
Oh, it's gone.
Okay. So hearing is fully intact. No loss of high or low frequencies. All right, and lastly for the cranial nerves, I want to check your vision. So I'm going to have you just look straight ahead for me, and I am going to shine a bright light, so I apologize, it will be bright. Okay, let your eyes get back to normal. Got just a little bit of a cotton here. I'm going to move it into close to your eyes, and I just want you to try and ignore it and relax, react comfortably, okay? Okay, good. Good. So that reflex is intact there in the eye. Can you see my pen here?
Mm-hmm.
Any double vision with that?
No.
It looks clear?
Mm-hmm.
Okay, so just keep your head still and follow it everywhere it goes. Any double vision?
No.
Alright, that looks great. I want you to stare straight at that wall over there. Ignore my pen. And now look at the pen. Very good. And back to the wall. And back to the pen. Alright, excellent. I'm going to look just into the back of your eye now. So just relax and look straight ahead for me. All right. I'm just going to put on some gloves now to touch your eyes. I'm going to be pulling down on the conjunctiva, so just open your eyes for me and look up. Okay, and can you do the same thing but look down for me? Okay, any pain here when I touch those tear glands?
No.
Okay, just palpating the eyes themselves. Any pain with that?
No.
Okay. All right, so the cranial nerves and cognition are intact, but I do want to do a full sensory exam. I'll start out with your face, and then I'll have you change into a gown for the rest of your body, okay?
Okay.
So first thing, I just want to know if you feel this sensation. So keep your eyes closed. I'm going to be touching you on different parts of your face, and just say yes if you feel it.
Yes. 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 Yes.
Okay, and does this feel the same as that?
Yes.
Here and here,
Yes.
here and here.
Yes.
Next, I want to test your differentiation between a sharp stimulus like that and a soft like that. Do you feel a difference between this and that?
Yes.
Okay, so just say sharp or dull.
Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull.
Very good. I'm going to hit this tuning fork again. You're going to feel a little bit of a vibration. Let me show you how it's going to feel. Do you feel that vibration there? Okay, and I just want you to tell me if it's vibration like that or pressure, just like that.
Okay.
Feel the difference? Okay.
Vibration. Pressure.
Good.
Vibration. Pressure. Vibration.
Very good.
Vibration. Pressure.
Very good. And what's colder, 1 or 2?
1,
1 or 2?
2.
Okay. So that's all the sensory in your face. I think everything looks fine, but I do want to go ahead and check the entire body, so I'll have you change into your gown now, okay?
Okay.
Okay, Jeremy, now that you're in your gown, we'll continue with the sensory on the upper body and the chest. And it does seem like one of our hospital therapy dogs has come in for the exam. Is that all right with you?
Definitely.
All right, so we'll just move him around as needed, but people do find him very comforting. So especially if you have a little bit of white coat syndrome, a little anxiety at the doctors, that can be very helpful. Right. So I'm just going to roll up the sleeves here. So I'm going to do those same sensory tests on the arms themselves. So again, close your eyes. I'm just going to touch different parts of your arm, and I want you to say yes when you feel it.
Yes. 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 Yes.
Could you just put your arms, open them like that, and lay them like that? Perfect.
Yes. 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 Yes.
Okay, very good. Any difference side to side?
No.
Same here and here,
Yes.
and here and here.
Yes.
Right. Next up is the sharp or dull. So again, you feel the difference between this and this?
Mm-hmm.
All right, so just tell me what you feel.
Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. 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 Dull.
Okay, and I want you to tell me if it feels sharp all the way down. Any difference in the sharpness, or is it the same?
The same.
Okay, and on this arm?
Same.
Okay. Again, vibration or pressure, so just tell me what you feel.
Vibration. 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 Pressure.
Okay. Try that again. Do you feel the difference between this? What does that feel like?
Vibration.
About now.
Pressure.
Okay.
Vibration. Pressure. Vibration. Pressure. Pressure.
Good.
Vibration. 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 Pressure.
Okay. Again, what's colder, 1 or 2? You feel 2 bits of pressure, and I want you to tell me which one is colder.
2. 1. 2.
Good.
1.
It's a bit of a trick one. They're both cold. So you feel how that feels the same?
Mm-hmm.
Okay.
1. 2.
All right. So the arm sensory is intact just for extra fun because you were feeling a little bit lightheaded and weak. I just want to make sure with this pinwheel here that feels the same all the way down. Okay, that's going to stimulate the nerves specifically, and it's going to be pretty light but pretty sharp. You can keep your eyes open and just tell me if there's any change when I come down here. Any change
No.
to the fingertips here? All sharp?
Mm-hmm.
Okay, good. And same thing on this side. Any difference coming down
No.
to the fingers? Okay. While I have this, I want you to flip your hands and just relax them down. And I'm going to be drawing a number in your hand, and I want you to tell me what number that is. Again, close your eyes.
3.
Okay, and on this side?
1.
Okay, and add those together.
4.
Very good. I'm going to keep your eyes closed. I'm going to place an object in your hand. I want you to tell me what that object is. Just in the one hand. Keep it in that hand.
Key.
Okay, very good. And I'm going to place something in the other hand now. And I want you to just tell me what this feels like.
A pen.
Yep, very good. Now with this hand, I'm going to move the joint up or down. So up is like this and down is like that. Just say up or down.
Up. Up. Down. Down.
Okay, and I do the same thing on this side.
Down. Up. 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 Down.
All right. The last thing I want to do with the neurological in your hand is just poke you here with 1 point or 2 points, okay?
1, 2, 1, 1, 2.
All right, and on this side.
1, 2, 1, 2, 2.
All right. So I just want to do a quick sensation on the legs. You were fully intact on the arms and the face, so I'm not super worried, but we'll just run that sharp pinwheel down the leg and just touch you side to side and make sure that there's nothing we've missed, okay? And no numbness or tingling in the feet, toes, feet, anything like that?
No.
I'm just going to work around our therapy dog here. So close your eyes and tell me left or right.
Right. Both.
Good.
Left. Right. Left.
Okay. I've got this sharp tool here. Again, I'm just going to run it down the pant leg. Do you feel the sharp there through the pants?
Mm-hmm.
Okay, tell me if you feel any changes. Sharp all the way down?
Mm-hmm.
Same thing here. Sharp all the way?
Mm-hmm.
And what about the bottom of the foot?
Yep.
Okay. I'm not too concerned about testing the sensation any more in depth down there, just because we already have it pretty well mapped out on the top. But if anything changes, come back in and we can do a more thorough assessment down on the lower body, okay?
Okay.
Just making a note of that. All right, let's move on to the cardiovascular system. We'll start out with getting your blood pressure. Do you have an arm preference?
No.
Okay, let's go ahead and do this side here. Does that feel okay?
Mm-hmm.
Okay, just relax the arm there. I'm going to have you hold onto this for me, just sort of facing out with the other hand, this hand here. Yeah, perfect. Exactly. And just relax. You're going to feel a little bit of pressure, okay, Jeremy?
Mm-hmm.
Okay. That's a 110/72, so that's very good. I want to make sure it's not too low without feeling lightheadedness. We'll check your temperature as well. So I'm just going to place this here. And we have 97.6. So it's a little bit low, but is that normal for you to run a little low?
I think so, yeah.
I'm going to listen to your heart now, Jeremy. So I'm just going to drop my stethoscope down your gown, okay? So just relax. I'm going to breathe normally. That's all fine. going to look at the chest wall. If you don't mind, I'm just going to move this down for just a second. That's good. You can relax. No heaving. Just going to have you put your neck back for a second. I'm just going to check a vein here in your neck. Looking for any pulsation. And that looks fine. I'm just going to feel here. Alright, not feeling anything out of the norm. I'm going to be feeling your pulses in your neck, so first I'm going to listen to the one in the neck. Just one at a time here. Good, no worries. I'm just feeling. Good. Feel the temples here. Okay. Just checking the arm pulses. Good. The wrist here. That's the top of the hands. This pulse here right in the stomach, okay? Okay. Check your ankles. There's just one here under the knee, okay? And that's all fine. So all pulses are 2+ and equal bilaterally. Move on to the respiratory system here. Cardiac system looks fine. Did you feel any fluttering in your chest when you had that lightheadedness?
Maybe a little.
Maybe a little? Okay. It seems to be okay today, but we may want to do an EKG just to make sure that there's nothing going on. Let's listen to the lungs now. So I want you to just take a little breath every time I touch you. You don't have to go too deep. I just want to be able to hear it breathing in and out. Okay. Just going to go underneath here. All right, lung sounds are clear. I know you were having just a little bit trouble breathing the other day. Sounds like that feels better today, right?
It does, yeah.
Okay, I'm just going to palpate the chest wall. Any pain when I press on you here?
No.
What about here on the sides? Any pain there?
Maybe a little tenderness.
Just a little tenderness. Is it more in the muscle or in the ribs?
I think the ribs.
Okay. So you could have a little bit of a strain there. I'm going to just tap on each lung here, and I want you to tell me if it feels worse in anywhere than the other, okay? Feel
Down
okay?
on the lower feels a little worse.
A little bit more here?
Mm-hmm.
Okay. How about this side? That side's okay? Same on this side? So it's really here.
Mm-hmm.
I'll make a note of that. So we've got a little bit of tenderness, the oblique side of the lungs. And does it hurt to take a deep breath? I want you to take a deep breath in for me. Expand. Is that pain on that side there at all?
No, not really.
Okay, so lung expansion is normal. I'm going to put my hands on your chest here, and I want you to say 99 when you feel me touch you, okay?
99. 99. 99. 99.
Okay, very good. That's all fine. And let's just make sure that you're fully getting enough oxygen here. I'm going to place that on your finger and just relax. It takes about 15 seconds. And 98%. So that's very normal. You should be getting full oxygen to the body. Again, no lightheadedness now. Okay. I'm going to have you just sit up for me. I'm just going to listen on the back. Okay. You're just feeling. Is that tenderness on the back here at all?
Not really.
Okay. All right, let me take a listen. And again, just take a little breath for me every time I touch you. Same thing on this side. Okay. Still sounds clear to me. I'm just going to tap on your back a little. Okay, and say 99 for me.
99. 99. 99.
While I'm back here, I'm just going to feel the spine. Any tenderness there? Okay, relax for me, please. And just open your mouth for me. I'm just going to check the back of your throat. Can you say ah? Okay, that's fine. And again, just breathe in and out for me. Okay. So it doesn't look like there's any sort of deviation in the septum. You're able to breathe in and out without obstruction, correct?
Mm-hmm.
Right. So I do want to definitely maybe just get an x-ray of those lungs to make sure. It could be a muscular thing, the oblique muscle right there along the ribs, or it could be a bit of bruising to the ribs. Have you had any impacts or anything lately?
Not that I can think of.
All right, so we'll check on that. I'm going to give you a little bit of water. Just going to check the thyroid here. I want you to take a sip of it, but keep it in your mouth. Okay, and then go ahead and swallow for me. Good. Lymphatic system's next, so let's feel the lymph nodes. Any issues with swelling in your neck or any pain, lumps, bumps that you felt?
No.
And I'm just going to feel under here. Just relax into my arm here. I'm just going to be getting up into the underarm. Okay, and same thing on the other side. Okay, relax. And that's fine. Okay. didn't feel any sort of swelling. I'm just going to check for the pancreas. Any pain when I do this?
No.
Okay. Alright, moving on to the next system, I'm going to check all the skin on your face and arms. In fact, go ahead and just look with my magnifying light here. And I'm just going to be looking for any scrapes, bruises, moles, nevi, anything that needs attention. So just close your eyes for me and I'll just be checking the skin. And you are quite fair, so I'm just going to look relatively thoroughly. And just relax. I do just see one little slightly asymmetrical nevi here, so let me write that down. And that's on the right upper arm, shoulder. We'll just watch that. Also feeling the temperature of the skin as I do this. Everything feels warm and dry. Okay, good. Just going to check the lower legs here. And do you mind if I remove the socks? I'll definitely check the bottom of the feet and in between the toes for anything that might be hiding. That all looks great. While we're down here, I'll check your nails. The capillary refill. Okay, good. Less than 2 seconds. Put that back on for you. Is that okay?
Mm-hmm.
Check the other side now. Okay, no problems there. Cap refill is good and brisk. Alright, so the skin looks fine for me. I did check out the skin in the back when I was back there and I didn't see any issues. Let's check the nails here. I want you to just check for clubbing for me. Just each finger like this. Good. And then I just want to check the capillary refill. Very brisk. Okay, that's fine. Take a look at the scalp and the head. Again, I'm going to put some gloves on for that. Any tenderness here on the scalp?
No.
This side?
No.
Hair is nice and thick, no thinning. Strong hairline. You notice any changes to the hair lately?
No.
Color is consistent.
Mm-hmm.
Okay, checking the beard. Same thing with the beard. Is the same texture and color as your normal used to?
Yeah.
Okay. Just gonna run the brush here through. Just looking for any infestation or anything that shouldn't be there. looks fine. Scalp looks healthy. And just check for, make sure there's no sun spots or moles, anything that I missed. I don't think so. So again, you said no pain or discomfort here.
No.
Okay, I'm just gonna. All right, moving on to the skeletal system. I'm going to be doing a range of motion for the body. And that's going to just have you make a bunch of movements by yourself from head to toe, okay? So I want you to just put your head to forward all the way it can go and back all the way it can go. Obviously, I know there's a pillow, but I'm just looking for general range. All right, and turn to your left and to your right. Any pain with that?
No.
Can you shrug your shoulders up? Okay, and out like this. Very good. Can you go up like this? Very good. Any pain with that?
No.
Hands up and down. Good. Fingers outwards and inwards. Make a fist for me. All right, no problems there. I'm just going to have you sort of twist as best you can to your right with your back and then the other way. Any discomfort with that?
No.
Okay. I know that you have our lovely little emotional support dog on your legs, so I'll just have you put your ankles up and push down. Okay. And can you just slide your leg out this way for me? And back in. And same thing on that side, just testing that hip out and back in. Okay, so any problems sitting, standing, anything like that?
No.
Okay, can you put your arms all the way out for me and just keep them there? Close your eyes. Okay, and now the little carpal tunnel test, so like this. Any tingling in here?
No.
What about, keep them like that for me, please? What about when I tap you here?
No.
Okay, go the other way, into hands into prayer. Any pain here?
No.
Okay, relax for me. I'm going to have you do that all again, just against resistance to test the muscular strength of your body, okay?
Okay.
So I want you to push forward for me and back into my hand. Turn here and the other way. Good. Shrug your shoulders. Good. I want you to put your arms up and try and push me away and pull me towards you. Okay, wrists down. Don't let me pull you. Good. Push me away with your hands. Okay. I just want you to push me side to side. So push there and there. Good. Here and here. Very good. And you can relax your hands. Just fingers out nice and wide. Don't let me close them. Good. And put them together nice and tight. And don't let me open them. Very good. Same thing. Push out against my hand here. Good. And can you go up? Okay, nice and strong. Up, out, down here, and back. All right, good. Strength is all 5 out of 5. And as is movement. Let's go ahead and get your reflexes now. Checking the tendons and just give me all the weight in your arm. Just completely relax. Perfect. Okay. Same thing here, just completely relax. Okay. I'm going to scrape the palm, just look away. Good. I'll come around, do the same thing on the other side. Okay. And just stare away. Good. I come down here, I'm going to slide my hand under your knee, and I just want you to fully relax on the weight of my hand. Good. And I will get the ankles first. Good. Good. Same thing here. Okay. good. Just underneath here, again, just give me all your weight. Good. Just going to check the reflex in your jaw, so let it hang for me, please. Okay. Getting very close there, Jeremy. Thank you for bearing with me. Everything looks great there. I'm just going to finish up with your stomach, okay? So start out by having a listen. Put your arms to the side for me, please. There we go. And I'm just going to be listening. Okay. Hearing sounds in all quadrants. I'm going to be tapping a little bit here. I'm just listening for the resonance. Okay, and just a little bit of palpation. Let me know if there's anything that hurts. Any of that painful or tender?
No.
I'm going to go a little bit deeper. No pain or tenderness there. I have you sit up for just a second. I want to just hit the kidneys here. Any pain there?
No.
What about there?
No.
Okay, relax for me. So I think that that's all fine. See your finger, your index finger for me, please, this one.
Mm-hmm.
Just going to put that here and relax. At the same time, I'm going to take your temperature. Temperature's just a little high, not feverish, but 99.1 on that side. So it's a little bit higher than the typical, not a feverish range, not considered a fever, but a little bit higher than the 98.6, which is average. Do you tend to run average, cool, warm?
I tend to be cool,
Okay.
so that's a bit concerning for me.
It's certainly not within a concerning range. Our body can sometimes work a little harder when it's feeling a little bit less down, so that lack of sleep could definitely be contributing. But I will make a note of it. I'm not concerned, but I'll make a note. And we've got here, pulse is 71, very good, and 98% oxygen levels. So that's wonderful. Take your blood pressure. Do you have an arm preference? That one? Okay. Just hold your arm for me, please. Thank you. And relax it down. I'm going to feel just a slight pressure here. All right. So blood pressure is 110/70, so that's very healthy. So going head to toe, starting with the neurological function here. So I'm going to ask you just a couple of questions. I'm going to be testing your memory and your thinking, okay? So can you tell me what you had for breakfast this morning?
I had a bowl of cereal with milk.
Okay, good. And can you tell me your favorite subject in school growing up?
Drama.
Okay, so that's the long-term memories intact. You're able to remember your school days, and the short-term for breakfast. I'm going to ask you some math questions now. If you have 100 and you minus 7 from that, what will you have?
93.
Okay, and minus 5 from that?
88.
Perfect, so that thinking is intact. Okay. Can you repeat after me? No ifs, ands, or buts?
No ifs, ands, or buts.
Okay, good. Movement in the face. I'm going to point to a couple things. I want you to tell me what they are. You tell me what this is.
It's a clipboard.
Okay, and what color is that?
Green.
Okay. If I were to say to you, the boy jumped over the hill, who is the subject in that line?
The boy.
Perfect. All right, so all of that sounds good. Let's move on to inspection now. I'm just going to put on some gloves. You said no issues with thinking or fogginess of the brain with the insomnia? Anything besides just feeling tired?
There's tiredness for sure. I have a lot of racing thoughts.
I think that's a little bit of anxiety, anxious.
Yes.
Okay. Any pain or tenderness in the head?
Not that I know of.
Okay, I'm gonna just feel. Let me know if anything hurts. Any pain with this?
No.
Okay, good. Go underneath here.
No.
How on the temples right there?
No.
Okay. Check the scalp and the hair. Try just sitting up just a little bit for me. Thank you. That's perfect. That's just weight to the back. Checking with my light for any swelling, bruising. That looks fine. So look at the neck here. Just breathe normally. No pulsations. Keep the eyes closed. I'm going to be looking at the face. Any pain when I press here?
No.
And what about here?
No.
Just going to gently touch the to your glands here, looking for any swelling, pain. That's fine. Check the lymph nodes. Okay, not feeling any swelling. Check the ones in the arms. Any pain when I did that?
No.
Okay, good. So I'm not feeling anything obvious. Let's go ahead and check some of the movement of your face now. Check some of the cranial nerves. So can you do a big smile for me? Good, nice symmetry. And lift your eyebrows up. And don't let me push them down. Keep them up, nice and strong. Good. Puff the cheeks out. And don't let me push them in. Very good. I'm going to have you just clench your jaw for me. One more time. Okay, can you open and close the jaw? Just a little bit of clicking there. Is that normal for you?
Yeah.
Okay. Is that terribly bothersome or is it manageable?
It's manageable at the moment.
Okay, good. I'm going to have you push down against my hand with your jaw, just for some strength. Very good. Relax. Push forward on my hand.
Like this?
Yep, and back into my hand. Very good. Can you turn to the side? Very good. And this side. Okay. So strength is all there. Do a little bit of sensation testing in the face. So I've just got a really light cotton piece here, and it's going to feel right on your chest, just like that. Feel that?
Yeah.
Okay. So just close your eyes and say yes when you feel it.
Yes. 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 Yes.
Okay. Does that feel the same side to side?
Yes.
There and there.
Mm.
There and there. Okay. And let's do a quick little sharp or dull. So I've got a little bit more of a point here. So you feel the difference between that and that?
Can you do it again?
Yep. So that and that.
Mm-hmm.
Okay. So just say if it feels sharper or dull. So sharp or dull.
Dull. Sharp.
Good.
Sharp. Dull.
Mm-hmm.
Dull. Sharp. Sharp.
Very good. All right, so all of that's intact. Just do a couple more for fun here. Does this feel cold?
Yes.
Same there.
Mm-hmm.
Here and here.
Cold.
And what do you feel here?
Vibration.
Very good. What about here?
Nothing.
Just some pressure. Okay. So just tell me pressure or vibration.
Okay. Vibration. Not just pressure.
Same thing, pressure.
Pressure.
What about now?
It's hard to feel.
Hard to feel right there? Okay. It's not too abnormal, but we'll just take a note of it. Keep an eye on that. And take a look into your eyes now. So again, I just have you look just straight up for me and ignore my light the best you can. It is going to be a little bright. Very good. I'm shine this right in the middle. Good. Can you see my pen here okay?
Yes.
Is it blurry at all?
No.
All right, follow it everywhere it goes, just moving your eyes. Any double vision there?
No.
Okay, good. No nystagmus. Check the pupils. That's normal. Okay, I'm going to do a couple more vision tests. First I'm going to do is look really closely into the eye. To the back of the eye. And I'm going to get close here, so again, just ignore me. Okay, I'm going to come around to the other side. Same thing here, I'm just going to pull the eye up a little. Good. Got a little bit of a test here, an eye chart test. Can you see this here okay?
Yes.
Okay, can you go ahead and read this line for me, please?
CFDHJ.
Good. Using this card, cover up one of your eyes. I want you to read that same line for me, just backwards.
JHDFC.
Okay, and switch eyes. And forward for me, please.
CFDHJ.
All right, very good. Keep that eye closed there. I'm going to come right around here. I want you to look straight at my nose. And just tell me when you see my fingers wiggling.
See him.
Okay,
See him.
good.
See him.
Can you switch eyes for me?
I see them. I see them. I see them.
Okay, very good. Got some colors here for you. I just want to test your ability to perceive color. What color-ish does that look like?
Blue.
Okay. What about that?
Green. It's like a pink purple.
Very good. What about that one?
Orange brown.
Perfect. Let's take a look into the nose. Just gonna place my hand gently on your face. Any changes in your smell issue?
You know what, actually, last week I've been having, I don't know if it's a smell issue or a taste bud issue, but everything's been tasting bland.
Tasting bland, okay. Do you ever have seasonal allergies at all? Any sort of congestion?
Not that I know of.
Okay. Take a look just inside with the light here a little bit. Just checking the bridge of the nose. No impacts or anything that would cause swelling, right? Any pain when I press on it?
No.
Do you have some taste or just feels more bland, but you're able to perceive it some taste?
I am able to perceive some taste, but it's not as distinct. Like I can't, sweetness and sour and salty, I can make it out, but nothing tastes good to me.
Interesting. Okay, so we definitely do a little bit more in-depth testing. I'm going to do some smell tests, have you smell some things with your eyes closed to see if you can figure out what they are.
Okay.
So close your eyes for me. I've got 3 different scents. So first, breathe in here. Okay, good patency, same thing. All right. And I just want you to take a deep breath in. Can you tell me what that smells like?
Smells like coffee.
Perfect. Okay, so definitely some sensory intact there. Do another one here.
I can't smell that.
Let me try just bringing out the item here. Can you smell that? What does that smell like to you?
Cinnamon.
Okay. And last one here.
Garlic.
Yep. Okay, so you definitely can sense smells. Did have to move the one that was probably the most mild out for you to smell. So I do sense that there's a little bit of perhaps a little loss there, but you're certainly smelling traditional scents.
I have noticed that my appetite is reduced as well.
Interesting. I wonder if that is because things don't taste good to you or if because of a common denominator, but we'll do a little more testing. Any pain in the stomach? Any issues with digestion?
It's not pain, it's more so just
It's that
feeling of-
fluttering.
Yeah,
And how long? You said a week? About a week?
about a week.
Okay. Any changes in the bowel movements or any upset stomach or acid reflux with that?
No changes in my bowel movements. No acid reflux.
Okay. So it could just be, oftentimes when we are experiencing insomnia, our appetite does go down. We, aren't using that energy as much or feeling as up to ourselves. But let's go ahead and continue with the exam. I want to test the taste. So let me look in your mouth next.
Okay.
So first, just say "ah" for me. Okay, very good. Any issues with the teeth or anything like that?
No.
Do you go to the dentist regularly?
Yes.
Okay, good. How often would you say? At least once a year?
At least once a year.
Okay. So I've got something for you. Again, keep your eyes closed. And you can just put that here, put it in your hand, and you can put it to your mouth. Just take a little bit of it out of the tube. Try not to smell it. Perfect. Taste that.
Lemon?
Yes, it's sour to you. It tastes sour to you.
Sour.
Okay. Do you feel like that tastes less sour than it should?
No, I could taste that.
Okay, good. So here, go ahead and you can rinse the mouth out now with a little bit of water. So, with those really potent, concentrated tastes and smells, you were able to do that. So I'm not worried about the senses not being intact. That being said, with more muted tastes and smells, if you're having that trouble, there could be another reason. So we will continue to investigate. Let's move on to your ears. Finish up with the head and neck. Any pain when I press here?
No.
How about right here?
No.
Just gonna take a look inside of them. They look clear, no redness or anything. I'm gonna make some noises next to your ear. I want you to tell me left, right, or both.
Left. Right. Both.
Okay, you hear this here?
Yes.
Tell me when it goes away.
Goes away.
Okay?
Gone.
Okay. Just gonna remove my gloves now. I'm gonna hit this tuning fork, place it right here on the top of your head. Tell me if you hear it on one side or the other, or if it's equal.
Equal.
Good. Do you, I'm having you just sit up just a little bit here, just so I can get to the back of your ears. Very good. And placing this here, can you hear that? Tell me when that goes away. Can you still hear a little bit here?
Yes.
Very good. On this side, you hear that there?
Yes.
Tell me when it goes away.
It's gone.
You still hear anything?
Yes.
All right. So hearing is good. No any issues with your hearing or different
No.
changes in hearing? Okay. So I'm going to move now to your chest. Let me just sanitize my hands. I'm just going to, do you mind if I undo this really?
Go ahead.
Take a look at the chest wall. Just going to watch your breathing for a second and take your pulse here. Okay, breathing looks normal. I'm going to tap on the chest here. I'm just listening for the resonance. Any pain with that?
No.
Just feeling for the heart. Now you said that you've been feeling a little fluttering in your stomach. Any fluttering in the chest at all?
Not in the chest.
Okay, let's take a listen. Just breathe normally for me. I'm just going to listen to the heart first. I think sounds okay. I'm just going to have you say 99 when I touch you, okay?
99. 99. 99.
Okay. And I'm going to put to the lungs, so just take a regular breath every time you feel my stethoscope. That sounds clear to me. You said no coughing, anything like that?
No coughing.
Right, so respiratory-wise, that's good news, especially if you have a little bit of a sensory loss in the nose and the taste. Sometimes that can be a respiratory issue, but there's no buildup in the nose and the lungs sound clear, so it seems okay. Move on to the stomach now. If you just release your arms and just relax back. First, I'm just going to feel a little bit here. Any pain or tenderness with this discomfort?
No.
Okay, I'm going to go a little bit deeper. Any pain there?
It does make the fluttering feel worse.
Feel worse, okay. All right, so I won't push too much harder, but let's go ahead and take a listen. I'm just going to undo this here. Just really open to your tape top, all right? I am hearing movement. It doesn't seem overtly active. Just going to do one reflex here. Just across the stomach. Okay, very good. Yeah, I know that one's not the most comfortable, but it's intact, and that's good news. So we can go ahead and hold it up. We'll look at the back in just a little bit. I'll finish with the front, and then I'll have you sit up. I don't hear anything that's particularly concerning to me. I'm thinking perhaps the fluttering feeling is actually coming from the anxiety that's sort of shooting down the body. Do you ever feel it kind of like shoot down the body?
Yeah.
So that to me is actually, I think, something more related to the insomnia, the sleep deprivation. The sleep
Right.
deprivation does have real physical effects. It's not just it's not just in your head, right? It's not just, oh, I'm tired. It will have effects throughout the whole body. But the stomach is behaving as normal. It's having the movements in all four quadrants, and I didn't hear anything specific that would concern me, unless you're having pains, which you said you're not.
No.
Okay. I'm just going to take a look at the arms now. They look super smooth, dry to touch. No cuts or bruising. Here. You don't really have any freckling or moles. That's very good. Do you wear sun protection when you go out, when you spend time outside?
Not much.
Not much? Okay, definitely consider incorporating at least a 30 SPF into your routine, even if you're not showing signs of immediate like moles or freckles that are coming up. It's still getting the UV exposure, and that can lead to melanomas later in life. So definitely encourage wearing your sunscreen.
Okay.
Taking a look at the hands. Fingers, can you do this for me, please, with each finger? Okay, good. No clubbing. I'm going to test a little bit of strength. Have you noticed any weakness with that tiredness?
No.
Okay, so can you put your arms up like this and push me away and pull me towards you? Very good. Same thing with the wrists, like that. Push me away and push down. Very good. Fingers spread apart. Don't let me push you in. Okay, and relax. We've got that same little cloth. Just close your eyes and say yes when you feel it.
Yes. 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 Yes.
Okay. Sharp or dull. It's going to be the same thing as before.
Dull. Sharp.
Good.
Dull. Sharp. Sharp. Dull.
Good.
Sharp. Sharp. Dull.
All right. Does this feel cold here
Yes.
and here?
Yes.
What does this feel like
Vibration.
in here?
Vibration.
I'm going to move the finger up or down here. I just want you to tell me this is down, this is up. Tell me which way I'm going.
Up. Down.
Okay, same thing on this side.
Down. Up. Down.
All right. I want you to keep your eyes closed. I'm just going to give you something to hold in your hand. I want you to tell me what it is. So, what is, you can use both hands. What does this feel like?
A pen.
Okay, very good. With the back of this pen, I'm going to draw a number in this hand. I want you to tell me what it is.
A 3.
Okay, and then on this side, I'm going to draw a letter.
Do that again.
Mm-hmm.
H.
Yep. Okay. So that's all good. Now let's move down to the legs. I'm just going to move this blanket up for me. And cover up that way. Is that all right?
Yes.
So I'm feeling the temperature of the legs. I'm just going to push this up just a smidge and pull the socks down. Let's go ahead and start out with that strength. So push up on me with this leg. Yeah. Yep, very good. And down. Very good. And same thing, whole leg on this side. Perfect. And down. Good strength. Just push down against my hands. And up, back. And strength is good. Just going to feel the joints. Any pain in the knees?
Well, I did kind of wounded my knee.
Oh.
I don't know if you can see it, but
Oh, yep. Okay. I'll be careful there, but it looks like it's healing well.
yeah, it's healing pretty well.
Okay. So we'll just avoid that spot there when we do the sensation. But otherwise, skin looks intact. Again, no real blemishes or nevi on the bottom of the legs, but if they're going to be exposed to the sun, SPF. Close your eyes. Tell me yes when you feel it.
Yes. 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 Yes.
All right. And sharp or dull.
Sure. Sure. Dull. Dull. Sharp.
Good.
Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull.
Good.
Dull.
Very good. Take a quick look at the feet here. Mind if I just remove your socks for a second? Just checking in between. Alright, that looks fine. These socks are very cute. Put that down now. Try to be careful with that injury. When did that happen?
My first day out to Vancouver.
Oh, okay. So it's been about a week then.
Mm-hmm.
Okay, so healing is good. Looks like it's scabbed up nicely. I'm gonna do your reflexes down here, okay? So you can just bend this leg for me, just sort of rest it. Rest it on the bed, actually. Just like that, yes, exactly. Good. Same thing on this side. Okay. Scraping the bottom. Okay. Give me all the weight. Very good, just relax fully.
That reflex one's
Not too reactive there? Okay. Let me try it again. I'm actually gonna, you know what, because of that injury, I won't do it on this side. You're not having any problems with reflexes in general or strength or anything like that?
No.
Okay, so we'll go ahead and leave that there. There's no indication that there be issues. All right, so the last thing I want you to do is just swing your legs around here for me. I'm gonna take a look at the back.
Okay.
All right, starting out, just taking a look at the back here. Any pain on the spine?
No.
Okay. Can you tilt your head downwards as if you were going to dive in, sort of lean forward, and come up really slowly, one vertebrae at a time. All right, that sounds good. Looks good. Tip your head back as far as it can go. Okay. Oh, wow, you're very flexible. All right, and back. And can you turn your butt, twist your body this way for me? And the other way? And sort of side to side, down like this. Very good. And the other side. Good flexibility. You're getting exercise, I can tell. Definitely getting a lot of physical exercise. Let's take, listen to the back. First, just doing that percussion again on the lungs. You say 99 for me?
99, 99, 99.
All right, that's good. Let me have a listen again. Just take a normal breath every time you feel me touch you.
Okay.
Getting clear in the back, which is good. Just take a nice deep breath in and relax. Okay, that's good expansion as well. And I'm just going to smack back here a little bit. Any pain with that?
No.
Good there? Okay. Kidneys then, no inflammation. I'll have you just lay back and we'll take some final notes, okay? I'm going to start by just looking through your hair. And I'm just going to give it a little bit of a feel here. I want you to tell me if there's any pain when I touch.
Mm-hmm.
Do you ever get headaches?
Not often, no.
Okay, good. I'm just going to be checking through it as well, looking at the scalp, the hair consistency. It does look very healthy, fresh. How often are you washing the hair?
Once every 4 to 5 days.
Okay, perfect. We just want to make sure you're not overwashing that scalp, causing dryness and irritation. So it looks like you're doing that, everything right there. Any itchiness within the scalp?
Mm-mm.
Roots look nice and healthy. I'm not seeing any bumps or lumps on the scalp itself. Sorry about that. Any contact with wooded areas where you might have picked up a tick or anything like that?
Not too recently.
Okay. One place they sometimes like to hide is in the hair, and then it's harder to catch those bullseye symptoms. So just going to check the back here a little. Other side. Okay, that looks fine. I'll let you put your head back up now, and you can just fix your hair if you'd like. Sorry, I messed it up a little. I'm going to be touching your face now, so I'm going to put on some gloves so I don't transfer any of the oils on my skin. Any issues with your face? Any dripping or tingling in your face?
Not my face, no.
I'm just going to move this back here if you don't mind, so I can take a full look. I'm looking at symmetry. Eyebrows look nice and symmetrical. Hair distribution is good. I'm going to be feeling around your head. Just any pain right here?
Mm-mm.
Okay, what about right here?
No.
That's okay?
Mm-hmm.
Okay, great. Just taking a look. I'm going to have you make some faces for me. So I want you to smile. And can you puff out your cheeks and hold them? Okay, good. Nice and strong. Can you lift your eyebrows up? Okay. And close your eyes as tight as you can, and don't let me open them. Perfect. Skin looks good. I'm just going to look a little closer with my light. Very clear, though. You do have some freckles. Is that typical for you? You've had those a long time?
Mm-hmm.
Okay. Are you wearing sun protection?
70 SPF.
Okay, perfect. Perfect. Yeah, you are fair skinned, so we just want to make sure that you're not getting too much sun exposure. But the skin looks really healthy, moisturized. Close your eyes for me. It looks great. I'm going to be feeling your lymph nodes in your neck now. So I'm just going to be feeling for any lumps or enlargements. Show your shoulders for me. Feeling in there. Okay, and relax. Any pain while I'm doing this?
Mm-mm.
I'm going to do a little bit of sensation on your face. So what I'm looking for is to see if you can feel it on both sides equally, as well as differentiate between some different sensations. So I'll have you close your eyes while I do this, and just say yes when you feel it.
Yes. 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 Yes.
Okay, so that felt the same on side to side.
Mm-hmm.
This feels like that.
Mm-hmm.
Okay. Next, we're going to test your sharp and dull sensation. So we want to see if you can tell the difference between a light touch. So I'm going to test it on your chest here. You feel that?
Mm-hmm.
And then the difference between that and this. It's a little sharp, but it won't break the skin. Okay?
Mm-hmm.
So keep your eyes closed and just tell me sharp or dull.
Dull.
Mm-hmm.
Dull.
Good.
Sharp.
Okay.
Sharp.
Good.
Dull. 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 Sharp.
Good. One more time.
Dull. Sharp. Dull. Dull. Dull.
Perfect. Last thing I had for you is a bit of cool metal. You can feel it. It's quite cold.
Mm.
Okay, close your eyes and just tell me when you feel the cold.
Cold. Yes.
Is this cold or warm?
Warm.
Cold or warm?
Cold.
Cold or warm?
Warm. Cold.
All right, I'm going to have you keep your eyes closed. I'm going to hit the tuning fork and tell me what you feel.
Ooh, vibrations.
Mm-hmm. Have it on this side.
Yeah.
Okay, perfect. Fully intact there. So no problem with sensation. I'm going to have you open and close your jaw for me. A little bit of clicking there. Is that normal for you?
Mm-hmm.
Does that bother you a lot?
No.
Okay. If that gets worse or if you're having trouble eating, we can definitely take a deeper look at that. But feeling just that masseter muscle there. Can you do it one more time? Just clench your teeth. Okay, the muscle's strong. Can you push against me? Okay, yeah. So no pain while you're doing that push there? No shooting pains up in there? Okay. I want to take a look into your ears. So I'm going to have you turn your head that way. Just going to touch it here. Any pain there
Mm-mm.
or there?
No.
Okay. All right, it looks nice and clear. Can you hear this noise here?
Yeah.
Okay. Turn to the other side. And again, any pain? Touch that?
No.
Okay. Great. A little bit of earwax, but nothing major. Do you have ear infections ever? Do you ever get congested?
When I was a child, a lot.
Okay, yeah, so there's definitely a little bit of scarring, a little bit of swelling in there, but you hear that too?
Yeah.
All right, let's do a little bit of a finer hearing test just because there is some of that swelling and scarring there. So close your eyes for me. I'm going to make a sound and I just want you to say left or right.
Okay.
whatever side you hear it on.
Left. Left. Right. Right. Left.
Okay. Same thing, just a little bit softer, a little finer. So say left, right, or both.
Both. Left. Above. Both. Right.
Perfect. So your hearing seems completely intact. You don't have any trouble hearing generally. Listening and hearing are different, of course, but as long as you don't have any trouble hearing, we're good. All right, let's take a look into those eyes. So just look straight ahead for me, ignore my light. I'm going to shine it in your eyes, and it might be a little bit uncomfortable, but I'll try and be quick, okay? I'm just checking for the pupillary reaction here. Good. Okay, I'm going to stare right in the middle there. Just want to see where it's reflecting. Okay. Just taking a look at the eyes. You close them for me and open them. Any issues with tearing or dryness?
No.
Okay, look up for me. And look down for me. All right. I'm going to have you follow my pen. So can you see it here? Is it blurry at all?
Mm-mm.
Okay. Follow it everywhere it goes, just moving your eyes, not your head. Let me know if you have any double vision or blurriness when I do this. Everything look clear still?
Mm-hmm.
Okay. I want you to stare straight out there. Ignore my pen. Now look at the pen. And follow it out. And follow it in. Okay. Obviously you'll get a little bit of double vision as I get closer, but I didn't see any nystagmus or pupils reacted appropriately. Okay.
Mm-hmm.
I'll have you read my chart here. And do you wear any glasses or contacts on a regular basis?
No.
So I want you to go ahead and read this line forwards for me.
EPTZO.
Okay. I want you to cover one eye. And I want you to read it backwards for me.
OZTPE.
Okay. Can you cover the other eye? And can you read this line?
CFDHJ.
Okay. No vision problems there. What color is this?
Red.
And what color is that?
Green.
The pupils. And we're at about a 3 to 4, which is perfectly normal for this level of light. Okay. I want you to stare straight at my nose. I'm going to check your peripheral vision. So I'm going to move my fingers in, and I want you to tell me when you see them wiggling. Just say yes.
Yes. Yes. Yes.
Okay, same thing, just with this chart. Cover one of your eyes. Keep staring at my nose. Say yes when you see it.
Yes. 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 Yes.
Okay, switch eyes.
Yes. 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 Yes.
Very good. No problems with that? Dizziness, blurriness? Okay. Okay, so the eyes look good. Let me take a look into the mouth. So just open up and say ah. Okay, palate rises. Looks good, nice and healthy. How often are you seeing the dentist?
Often.
Every year at least?
Yeah.
Okay, perfect. And as long as they're doing regular checkups, then you should be fine there. Can you stick your tongue out for me and move it that way and that way? And then back in your mouth, push it into my hand here, checking the strength. And on this side. Okay, very good. I'm going to look at your nose now. Just dip back here. Any stuffiness, trouble breathing?
Mm-mm.
Just going to inspect the outside. You do have a nose ring there.
Mm-hmm.
Do you have any issues with infection or irritation?
No.
I'm going to give you a couple of things to smell. So close your eyes for me and just tell me what you smell.
Is that mint?
Mm-hmm. Perfect. And give you one more. Just take a deep breath and tell me generally what you smell here.
Is Is that lavender?
Yep, perfect. All right, so since the smell is completely intact, just going to do a couple of hearing tests that I missed on the first time. So I'm going to hit this, put it in the center of your head, tell me which side you hear it more on or if it's equal.
The right side.
Hear it more on the right side? Okay, we'll do one more time. Right side, left side, or equal?
Equal.
Okay, perfect. I'm going to hit it again, put it on the back of your ear right here. Tell me when it goes away.
Okay. Okay.
Can you hear it here?
Mm-hmm.
Same thing.
Okay. Mm-hmm.
Alright, I'm going to move down to your neck and your chest now. Just going to feel here and check your pulse. Nice and strong, 2+. And take a listen. Just breathe normally, right, please. While I have this out, I'm going to move down to your chest. I'm just going to listen in about 4 spots in the lungs here. Take a breath for me and out. Breathe in for me. One more time. And last one. Any trouble breathing, issues with asthma, catching your breath? I'm just going to tap on your chest in a couple places here. I'm listening for the sound of the lungs, make sure everything's clear. Okay. Can you take a big breath in for me and out? I'm just looking at the chest expansion. And that looks normal to me. Now listen to your heart. Any problems with pounding of the heart, feeling lightheaded, anything like that?
No.
Okay. You can breathe normally here. Just going to listen to a couple of the quadrants here. Very good. Didn't hear any murmurs or irregular heartbeat there. Okay. I'm going to have you turn around, and I'm going to do a little bit of work on your back now.
Okay.
All right, Veronica. So again, I'm just going to do very similar things on your back here. I'm just going to listen to your lungs. So again, in 4 places, just take a big breath when you feel my stethoscope. Good. Doing the same tapping again. Any pain when I hit you here? What about there? Can you take a nice deep breath for me? And relax. Very good. I'm going to put my hands on your back. I want you to say 99 when you feel my hands.
99. 99. 99. 99.
Very good. Taking a look at your spine now. Lungs look clear, sound good. I'm going to be pressing on just the spine here itself. Let me know if anything's painful or tender when I do this.
Okay.
Checking for any scoliosis or bends in the spine. Feels pretty straight. Have you ever had any problem with spinal pain or tenderness? Okay. Can you tuck your head forward for me as if you were going to roll down? Just sort of curl your body over, curl your shoulders over, and come up straight for me. Okay. Can you turn to your right? Okay, and to your left. Good. No pain there. And just feeling the muscles on either side as well for tightness. I think that's fine. So you can turn back around now, Veronica. I'm going to have you lay back. So let me just grab you a pillow.
Thank you.
All right, go ahead and lay your head down this way and your legs out that way for me, please.
Okay.
All right, Veronica, I'm going to have you put your arms to the side. I'm just going to take a listen to your stomach. How is your diet generally? Do you eat a lot of fruits and vegetables, or what would be a normal, typical day for you?
It's mostly vegetable based. Chickpeas and different vegetable based proteins. I do eat meat sometimes, but it's not normal.
Okay. And do you feel like you have enough energy throughout the day? Do you take any vitamin supplements, vitamin D, vitamin E, that kind of thing?
I do take vitamin supplements, yes.
Okay, perfect. So let me take a listen here. I do hear bowel movements in all 4 quadrants. So that's very good. And do some gentle pressing on your stomach here. Let me know if there's any pain. Any pain when I press in like that?
No.
Okay. About right here. Everything's okay. All right. While I have you here, I'm going to do a little bit of range of motion with your legs. So I want you to pull this knee up to your chest and back down. Any pain with that?
No.
All right. Can you put it up again for me, like this? Put it down. Put your foot down, and just keep it there. Don't let me pull it out. Okay. And now try and push me away. Good. I'm going to just do a little bit of range of motion with your knee here. Any pain in the hip when I do this? Okay. You can go ahead and put that down. Same thing on the other side. Bring your knee up to your chest and back down. Up for me to do the strength. So let me push you down. Push me away. There you go. A little cracking there. Is that painful when that happened? Okay. And pull me towards you. Pull me towards you. There you go. And just set that down. I just want to feel the knee, because that was a bit of a pop. Feel for any swelling. Do you ever get soreness in your knees after exercise?
No.
Okay. So it just seems like you have a bit of a space in that joint, and you get that gas popping between the joints relatively often, it seems.
Yeah.
Okay, just feeling the other side just to be sure. Can you push up on my hands? Good. And on this side. Good. I'm going to just pull these up to the knee, if that's okay. I'm going to do that same sensation testing that we did before.
Okay.
I'm going to start with just telling me if you can feel it, and just say yes.
Yes. Yes. Yes. Yes.
Next is the sharp or dull. So again, just say sharp or dull, and you remember what that feels like? Okay.
Dull. Dull. Sharp. 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 Dull. 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 Sharp.
Okay.
Dull or sharp.
Mhm.
Dull. Dull. Sharp. Sharp. Dull.
Very good. I'm going to run my fingers on either your leg, and I want you to tell me left, right, or both.
Right. Both. Left.
Okay.
Right. Both.
Perfect. And last thing is that sensation, or that vibration testing again. So I'm going to hit this, and I want you to tell me the difference between vibration, which feels like that, and pressure, like that. Okay?
Okay.
So close your eyes and tell me vibration or pressure.
Pressure.
Okay, and that again.
Vibration. Vibration. Pressure.
Just want to test some of the reflexes while you're laying down, and then we'll have you sit up to finish out the exam.
Okay.
So just relax completely in my arms. Just go completely loose. There you go. Okay, perfect. Same thing on the other side. I want you to clench your teeth on the count of 3. 1, 2, 3, clench. Okay. Same thing on your ankles here, so I'm just going to bend this like that and just completely relax on the table. Same thing on the other side. Just completely relax. I'm going to scrape this on the bottom of your foot. It's going to be a little uncomfortable. Okay, good. And we're just looking to make sure the toes don't flare out and they went down, so that's perfect. All right, swing your legs around for me, Veronica. We're going to finish up just doing some range of motion and strengthen those arms. So I'm just going to have you lift your arms up all the way. Any pain in the shoulders when you do that? Okay, we'll go like this, and out, and up like this. Hold it there. Good. Out like this again. Don't let me pull you. Don't let me push you. Once your hands go down, don't let me pull them. Nice and strong. And up. Don't let me pull them. Spread your fingers out nice and wide. Can you do this like that? Okay. Can you tap your hands on your back and forth as fast as you can? Okay, very good. I want you to touch your right shoulder with your left pointer finger. Okay, good. I want you to touch my finger with your pointer finger. Now touch your nose and do it everywhere it goes. Just testing some input. Touch your nose, back to your nose, back to my finger, back to your nose. Very good. Can you do it with the other hand? Perfect. Any up like this? Any pain or tingling in the wrists when you do that? Can you get the wrist together? There you go. I'm going to tap on here. Any pain? All right. I'm going to feel the, go ahead and relax for me. Relax for me. I'm just going to feel the joints. Checking the skin here as well. Do you see you have some tattoos? They seem healed very nicely. If you ever have any redness or open wounds on these, obviously you should go get that checked out. Any pain in the fingers?
No.
Okay, no arthritis or aches, things like that. Can you flip your hands over for me? Just checking the nails. And you can go like that for me. I'm just looking for any clubbing. Can you do it with each finger? Okay, no problems there. That looks great. All right. And just relax for me. And the last thing we're going to do is just finish out that sensation on these arms. And again, same exact thing as we've been doing. So just close your eyes and say yes when you feel it.
Yes. 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 Yes.
Okay. I've got something cold here. Feel how that's cold? Just say cold or warm.
Cold. Warm. Cold. Cold.
Sharp or dull? Same thing as before. And just put your hands out for me like this. Just lay them on you.
Dull. Dull. Sharp. Sharp. Dull. Dull. Dull.
Right, very good. No problems with the arms. I've got this little tweezer here. I'm going to put 1 point or 2 points on your hands. So up here it's 1 point versus 2 points. Do you feel the difference? Okay, just say 1 or 2.
Okay. 2. 1. 2. 1. 2.
Very good. And the same thing on the other side.
2. 1. 1. 1. 2.
Wonderful. I'm going to take your hand at the knuckle, that's down. This is up.
Okay.
So close your eyes and tell me down or up.
Down, down, up,
Okay, same thing on the other side.
up, down, down, down.
Okay. All your neurological sensation in your arms is completely intact. No issues there, so that's wonderful. So I am going to sanitize my hands here, and I'm going to start out with your vital signs. Any feeling of feverishness today?
No.
Okay. So let's take the temperature, so just look that way for me. I'm going to run this across your forehead and behind the ear. Same thing on this side. Okay, 98.2, so that's perfect. I'm just going to test the temperature in your hands as well. Flip them over for me. Just sometimes get cooler hands or feet. But the hands feel nice and warm, so that's good. Have you ever had your blood pressure taken before?
Mm-hmm.
Okay. And have you had any high or low blood pressure in the past?
It tends to be lower.
Tends to be lower. Okay, so we'll check it out. I know this injury here. Is that going to be okay if we use this arm?
Yeah, I think so.
Okay. So I'm just going to scoot that up just a little. That's fine. Perfect. Okay, and relax right there for me. So you will feel the cuff tighten a little. Just gonna do that one more time. There we go. All right, so it is a little bit low, 102 over 62. So I am going to make a note of that just to watch. Do you ever feel any lightheadedness when you stand up, anything like that?
Yeah,
You do?
sometimes.
Okay, so that's a common problem for you. Again, not really in the hypotension range that we would be worried about, but you can definitely experience those symptoms of feeling a little lightheaded or maybe the vision darkening when you get up too quickly. I'm going to apply some gloves and look through the hair. Just stare straight ahead for me, please. I'm just going to look through the scalp. And the hair is really nice and even, good color. Does look like you have a little bit of color in the hair, is that correct?
Mhm.
But it looks really healthy. It's not brittle or anything. Just looking through a comb here. I'm going to see if anything comes out. We're just looking for any critters, any excessive flaking.
There is dry shampoo in there.
Some dry shampoo, yeah, no problem. That's a very different look than anything that would be lurking. Looks really nice and healthy to me. Nice and clean. Okay, I am going to press on the head now. I want you to tell me if you're experiencing any pain. Any of that painful?
Mm-mm.
Okay, moving down to the back. Feeling for lumps and bumps. That's all okay?
Yes.
Okay. So while I'm here, I'm going to have you make some movements of the neck. So I just want you to tilt down as far as possible. Any pain or discomfort with that?
No.
Okay, can you come back as far as possible? Good range of motion, that's no pain there?
No.
Okay, can you tilt to the shoulder here? Okay, just a little bit of cracking, and on this side, good range of motion. I'm going to gently place my hand here, and I want you to turn against it that way. Good, nice and strong, and this way. And push forward for me, and back for me. Okay, so that's good neck movements there. Did that shoot any pain into the shoulder?
Just a little.
A little bit, okay. And no pain on this side though,
No.
right? So it definitely is because of that injury. Okay, just checking for any bruising, especially because you did fall. You're checking the skin as well. Any history of skin cancers or moles, removals, anything like that?
I've had a few removed.
Okay.
It runs in my family, so I get them checked, but they were all benign.
All benign. Great, great. Just checking the ears again while I have my light out. You do have several piercings. They all look very healthy. Any pain on the ear there?
No.
On this side?
No.
Okay. I'm just going to check the face. Again, just keep looking straight ahead here. Looking at the skin. Skin is really clear. There's a little bit of, looks like rouging on, but it looks like the skin is very clear. Very little oil production on the skin. Very lucky to have nice, beautiful skin. Okay, and the eyebrows look very evenly distributed. I'm going to just press on the sinuses here. Any pain there?
No.
What about there?
No.
Okay. I'm going to be performing a blink test. So I'm just going to take a little bit of a cotton stick here. I want you to stare straight ahead, and I'm going to look for a reflex in the eyes here. Good. Very good. So the blink reflex is intact. While I have this, I'll test sensory function of the face. So I'll show you on your arm. It's just sort of soft, right?
Mm-hmm.
So I just want you to tell me yes when you feel it. So close your eyes for me.
Yes. 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 Yes.
Okay. Does this feel the same as that?
Yes.
Here.
Yes.
Here. Same both sides?
Yes.
Okay. Any difference when I go up the side of the face? Everything feels pretty similar. Okay,
Mhm.
right? And here?
Mm-hmm.
Good. two tools here. One is sort of a sharp roller, and the other is a very soft pop. So you really should be able to differentiate if it's sharp or soft. Again, I'll show you on your arm here. So this is quite sharp, but it's not going to break the skin. Feel that? And then like that is very soft and light. So again, keep your eyes closed, and I'm just going to run it over the skin, and I want you to tell me sharp or dull.
Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Okay. And does this feel as sharp here and here?
Yes.
Here and here?
Yes.
Here and here.
Yes.
So all the sensory function in the face is intact. Let me make a couple of faces for me. So I'm just going to have you smile for me. And can you frown and lift your eyebrows up and keep them there? Good. And puff your cheeks out. Don't let me push them in. Okay. So facial symmetry is good and nice and strong. We'll just check with the calipers side to side as well, just to make sure. So just right in the middle there. Perfect. And we're not looking for perfect symmetry. We're just looking for any obvious deformity or swelling, anything that can indicate that you may have hit your head unknowingly. It looks fine so far. Just do the same thing with the top here. Now just looking at the ratio of the face. Again, there's no right or wrong answer. It's just about seeing the difference between the sections of the face. And they look to be all within normal range. I'm going to measure around the cranium here. 55. So we'll just keep an eye on that if there's any changes. And then I'm just going to get around the neck. I'm going to go very gently. So I know this can be a little uncomfortable, but if there's any changes in the thyroid or swelling in that area, we'll be able to track it. Okay, all done. So again, I'm just going to feel the throat here, feeling the lymph nodes. Shrug your shoulders for me if it's not too painful on this side. Shrug them up.
Keep them up.
Yep, thank you. Okay, relax this one. I know it's painful. Okay. Just checking the post-auricular here. Okay. Are you able to swallow for me? Good. No problems that I noted there. So I'll move on to your eyes now. And you do wear corrective contacts, and you have them in now, and you're able to see, correct?
Yes.
So we will be testing based on your current prescription, and I'm going to start out with just this chart right here. Do you see this right here?
Yes.
Okay. I am going to, first with both eyes open, just point to a couple letters. Can you tell me what that letter is?
F.
And what about this letter?
D.
Good.
L.
Okay, read this whole line for me, please.
L. E. F. O. D. P, C, T.
Okay, go ahead and cover one eye up. Choose which one. Let your eyes adjust, and then I want you to read this line backwards for me.
T, C, P, D, O, F, E, L.
Okay, and can you switch eyes for me? And can you read this line forwards?
F, D, P, L, T, C, E, O.
Great. So it looks like your prescription is correct. You're able to see. We can do a couple of color tests here. So, any issues with color blindness in the past? Okay. So I just have a book here, and I'm going to show you a couple of pages, and I want you to tell me what number you see there.
29.
Very good.
Five.
Yep, that's perfect. They're not easy.
3.
Good.
I can't tell.
Okay, that's fine. About this one.
45.
Good. Okay, try this one again because you were able to see the previous color palette, maybe a little further away.
13.
Okay, it is 6, so that. But you were able to see the 45, and then what about this one?
5.
Okay. So I would say for the most part, your color spectrum is fairly clear. I'm not too concerned missing just one. But if you do find that you're having trouble with the green, orange spectrum, that could be something that could warrant for further testing. Okay.
Okay.
I'm going to look into the eyes now, starting out just with my pen light here, actually. And again, just stare straight over there for me.
Okay.
And I want you to just look. You see the lamp in the corner?
Mm-hmm.
Just stare at that lamp and ignore me. I'm going to be shining a light in the eye. It's going to be quite bright. Good. Just watching the pupils react. They're perfect, reactive. Keep staring over there. Ignore this pen. Now look at the pen and back at the wall. Very good. Can you see this clear here? No double vision?
Mm-hmm.
All right, follow it everywhere it goes, just with your eyes. Don't move your head. Good movements of the eye. Any dizziness with that?
No.
All right, very good. Checking the pupil size. It's about A4, but it's quite low light in here, so that makes sense. Take a look into the back of the eye. I'm going to get quite close for this, so I do apologize. Again, just look straight ahead for me. Okay, coming around to this side. There we go. Okay. That is all fine. Just do one more test here of your peripheral vision. So can you see me all right?
Mm-hmm.
I want you to stare right at my nose,
Okay.
and I'm going to be wiggling my fingers. And I want you to just tell me when you see them come into your peripheral.
No.
Good.
No.
Keep staring straight at my nose.
No. No. No.
Okay, cover one eye up for me. I'll do the same. Same thing. Keep staring at my nose.
No. No. No.
Good. Another eye, please.
No. No. No.
Okay. Both eyes covered. Looking at my nose. How many fingers am I holding up?
2.
This side.
3.
Okay. Let's take a look into the ears now. We'll do a bit of a hearing test. You said no issues with hearing, right?
Not that I know of.
Okay. So I already looked at the outside of the ear, so I'm just going to take a peek in. Just a little bit of redness. Do you ever wear earbuds in the ear itself?
Sometimes I wear earplugs at night.
Okay, yeah, that could do it. It just looks a little bit irritated. This side is not as bad. So let's do some hearing test. I'm gonna make a little noise next to your ear. Close your eyes. Just, do you hear that?
Mm-hmm.
Tell me when it goes away.
No.
Okay, on this side, you hear that?
Mm-hmm. No.
Okay, I'm gonna plug this one up. I'm gonna whisper something on this side. Just wanna make sure I'm not gonna be hurting you by doing that. Is that okay?
Mm-hmm.
Just tell me what you hear.
4LR.
Very good. And on this side?
BB6.
All right. So hearing is intact. You're not experiencing any other symptoms there, so I don't think we need to do any further testing. Now I want to move on to the mouth. I'm just going to take a quick peek inside. You said no taste changes in your taste or anything like that, so just open up and say ah for me.
Ah.
Okay, everything looks good in there. Usually rises. I'm just going to have you push your tongue into my hand here, testing the strength of the tongue. There. Okay, and can you stick it out and move it side to side? Nice and symmetrical. So that's essentially your head done. I do want to move down now to the shoulder, especially because you're having issues. So I am going to feel it very gently here, okay?
Okay.
So just tell me when the pain starts. Is it painful up here at all?
Just a little.
Just a little. And when does it start to get worse?
Down there.
Right down here.
Mm-hmm.
How about in front here?
Yes.
Back?
Yes, that lower spot.
Lower right here.
Mhm.
Okay, so it's like across the front. Any pain into the arm?
Just a little.
Okay. Just feeling for swelling here. There's definitely a little bit of edema right back here. I'm going to tap. Any shooting pains with this?
No, but it's like
Does
a
it create
dull-
that throbbing pain?
Not throbbing.
Just the dull?
No.
Okay, but nothing shooting down the arm, right?
No.
Okay, I'm going to have you make some movements, and I'm just going to feel while you do that. First, let me sort of do it for you. Does that make the pain worse?
Mm-hmm.
What about this way?
It feels better.
That's not as bad as going up.
Right.
Okay, going back.
It's okay.
It's okay. So the worst is the up.
The up.
Okay, I'm not going to do that anymore. So I do think there is some swelling here. I'm wondering if you actually have, we won't know until we get an x-ray, if you actually have a slight fracture of this collarbone here, or if it's just a, a bruise, a pulled muscle. I'm gonna, do you mind if I just look inside really
that's
quickly?
fine.
Okay. Just like this. And I do see some bruising in there actually. Move down the arm here. I'm just seeing if there's any swelling or draining down the arm. Any pain here?
No.
Tell me when it starts to feel painful.
Right there.
Right here. Okay, so it's really down the whole arm.
Mm-hmm.
Okay, so just relax. So because it is so far down, and it's not like a shooting pain, right? It's just sort of a dull ache.
Yeah.
I'm thinking it's probably not a fracture because that would cause a lot of pain up in this area that would then radiate down the arm, but rather the muscle. There's two muscles that run here. There's one that runs across the chest, and there's one that runs behind over the shoulder blade.
Mm-hmm.
And my guess is you just bruised that muscle. And a bruised muscle can be very painful and it can take a long time to heal, but there's not that much you can do besides ibuprofen and ice like you're already doing, as well as stretching.
Okay.
So that any of that swelling and scar tissue that's building up there, you can kind of break down to the point of your comfort level. Let's continue the exam to see if there's anything else that stands out that you might have happened when you fell. But yeah, that's my initial diagnosis. I will send you for an x-ray though, to be sure.
Okay.
So I'll continue down the arms. I'm just going to remove my gloves so I can feel the temperature here. You doing okay so far, Alex? Okay. I know this one can be very thorough, but since it's our first time seeing you, it's really important. Okay, so forgive my slightly damp, sanitized hands here. Just want to feel the temperature. And the nails are painted, but I just want to check the cap refill on the bottom. It's nice and brisk. Okay, the skin looks good, warm and dry to touch. Check the other side here. You do have a tattoo, but that looks pretty healed up.
Mm-hmm.
How long have you had that?
Probably like 7 years.
Okay, quite a long time. No problems, right? No bleeding or...
No.
Okay, great. I'm going to have you make some movements with the arms as best as you can with that shoulder. If it's too painful, please stop. But I'm just going to have you go up and down like this.
Like that?
Exactly. And I'm going to test your strength, so keep doing that against my resistance. Okay, does that cause more discomfort here?
Yeah, a little on this side.
Flip the arms over and try and just with the hands up and down. Exactly. Okay, and against my resistance, just hold your hand there. And on the side, just hold the hand there. Okay, and down. Don't let me pull it out. Very good. Very good. Can you make a little okay sign just like that? Don't let me pull it through. Okay. And then just for range of motion, can you do that? Good. Any pain in the thumbs or anything? Up like this. And again, I know that's painful in your shoulder, but any tingling on the inside?
No.
Reverse it for me, please. Same thing. Just hold it there, push against each other. Any issues?
No.
All right, relax for me, just for that shoulder. Touch each one of your fingers just like that, testing a neurological function. Very good. And back and forth. Very good. I'll do that same sensory testing right on the arm. So again, just say yes when you feel it, but close your eyes for me.
Yes. 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 Yes.
Can you flip the hand? Good.
Yes. 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 Yes.
Okay. I've got that sharp tool again. I just want you to tell me sharp or dull.
Dull. Dull. Sharp. Sharp. Sharp.
Good. I'm going to do the same thing on the other side. Say yes when you feel it.
Yes. 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 Yes.
Okay. And what does that feel like?
Dull. Sharp. Sharp. Dull.
All right. So sensory is intact. I'm going to be moving your finger up or down here. I want you to tell me which way it feels. So that's down and that's up, okay?
Close my eyes.
Yep, close your eyes. What is that?
Down. Up. Up.
Okay, on this finger.
Down. Down. Down.
Good. Try the other side.
Down.
Good.
Up. Up. Down. Down. Down.
Very good. I'm going to give you something to hold, keeping your eyes closed, and I want you to just tell me what it is without opening your eyes. So what does this feel like? Use both hands.
A book.
Okay, very good. And I'll just give you one more thing. Okay, I'm going to hand you something. What does that feel like?
A feather.
Feather, very good. Okay, so that's all fine. Let's move on to the reflexes of the arm. So I'm going to try and do this one really gently. So give me all your weight. Just completely go loose. There we go. Again, just relax completely. Let me have the weight of the arm. There we go. I'm going to scrape that. I want you to just look straight ahead. Don't pay attention. Okay, let your jaw hang for me. Okay, same thing on the other side. I'm just going to come around. And this one, give me all the weight of the elbow here. Not as reactive on this side. There we go. There we go. And again, I'm going to scrape this one here. Okay. So while I have this out, I'll move down to your legs. So if you'll just uncross and scooch back as far as you can. Right, so just relax as much as you can. If you just put your leg out like that, exactly. So it's almost like hanging. There we go. And this side. There we go. Drop the ankles. Okay. Can you feel this all the way down the leg?
Yes.
Same thing here. Feel that all the way down.
Yes.
Got just those couple of tools here. Feel that?
Mm-hmm.
Say yes when you feel it.
Yes. 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 Yes.
Okay. And what does this feel like to you?
Sharp. 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 Sharp.
Okay. I'm going to have you move your legs a little, so I just want you to lift this leg up and hold it there. Okay, lift this leg up and hold it. Can you push this one out against me and pull it back? Very good. Push this out and pull it back. I'm going to have you stand up. And can you just stand up on one foot? So lift this one up for a second. Okay, and the other side. All right, and can you just do a little hop? I just want to see you lift off the ground. Perfect. All right, feel free to have a seat. All right, before we conclude the assessment, I do just want to take a listen to your chest because you mentioned that little bit of fluttering. So, any of the activities that we did today cause you that fluttering? Any
No.
issues from exercise, things like that?
No.
Okay. So I'm just going to start out with the heart. So breathe normally for me. That all sounds normal. Will you take a deep breath for me? And out. One more. Okay, I'm going to listen to the back. Just one breath in and out. I don't hear any crackling. Expansion seems good. You can take one more deep breath and let it out. I'm going to be placing my hands on your back. I want you to say 99.
99. 99. 99.
Okay, that's fine. Just going to tap here, listening for some resonance. I'm not hearing any denseness, any water in the lungs, anything like that. Okay, so feeling the spine as long as I'm back here. Any pain down the back spine?
No.
Okay, can you lean forward for me? And sort of tilt your head down all the way. Very good. All right, and come back up slowly. All right. So essentially what I'm going to do is just do a full overview exam here, just get a baseline. We won't go too in depth in anything unless we find there's an issue. So we may want to spend a little more time on those eyes since you already have told me you're nearsighted. And we'll sort of work our way from the top to the bottom, starting out in the chair, and then I'll have you move over to the bed, okay? And just stop me if anything's uncomfortable at any point. So let's get started. I'm just going to take a look at your scalp, and I want you to just tell me if there's any pain when I touch you here. Any pain with palpation?
No pain.
Okay, take a look inside the scalp. And your hair looks really healthy, clean, clear. Any issues with itching or hair loss?
No.
It's really healthy, really thick hair. Just taking a look at that. Is this where you part your hair generally?
Yes.
Okay. And are you wearing hats or sun protection?
I'm not.
So just be careful with that just general exposure. The rest of your hair is pretty thick and protective. What about on your face? Do you wear sunscreen on your face?
Yes.
Good. Any pain when I touch there?
No.
What about that?
No.
Feel the lymph nodes as long as I'm here. You shrug your shoulders for me. Okay, relax. Feeling the glands. Can you swallow for me? Very good. I'm going to have you put your head down as far as it'll go. Any pain with that?
No pain.
And go all the way back. Okay, and can you turn your head to the left and to the right? Any pain with that?
No pain.
Okay, I'm going to have you do the same thing against resistance. So just go forward against my hand. Good. And back against my hand. Turn to the left and to the right. Very good. Can you shrug your shoulders for me? Okay. I'm going to have you make some faces. So can you smile for me? And can you puff your cheeks out? And don't let me push them. Good. And raise your eyebrows up. Don't let me push them down. Good. Nice and symmetrical. Open your mouth. And don't let me push it. Closed. Okay. You open and close your mouth and your jaw. A little bit of clicking there. One more time, just clench the teeth. Just checking that strength there. Okay, that's all fine and good. Moving on to the ears. Any pain when I touch that?
No.
What about on this side? No pain. I'm going to take a look inside the ear. Good. Nice and clear. Any problems with ear infections or pain?
No.
Looks good. I'm going to make a couple of soft noises, and I just want you to close your eyes and tell me left, right, or both.
Okay. Left. Right. Both. Left. Both. Left. Right.
All right, I'm going to close up this ear right here. I'm going to whisper on the other side. I just want you to repeat after me.
4, 5, 6.
Okay, same thing over here.
A-R-Y.
Very good. So your hearing seems pretty good. We'll just do one more test. I'm going to hit this. It's going to go right on the top of your head here. I want you to tell me if you hear it equal on both sides or more in the right or the left, okay?
In the right.
Okay. How about now?
Symmetrical.
Perfect. Can you hear that back there?
Yes.
Tell me when it goes away.
It's gone.
Can you still hear it there?
Mm-hmm.
Perfect. Air burst is better than bone conduction. Same thing on this side. Tell me when it goes away.
It's gone.
Can you still hear that?
Mm-hmm.
Very good. So let's do a couple sensory tests while I have this out. Say yes when you feel me touch you. Close your eyes for me.
Yes. Yes.
And does that feel the same side to side? Does it feel like that?
It does.
Okay.
Yes. Yes.
Feels the same?
Mm-hmm. Feels the same.
Feels the same. Okay. Does this feel sharp to you?
Mm-hmm.
Okay, tell me sharp or dull.
Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Sharp.
And does this feel cold to you?
Yes.
Does it feel the same on both sides?
Yes.
And here?
Yes.
And what does this feel like?
Cold.
Try that again. Sorry. What does that feel like?
Cold vibration.
Very good. So the sensory in the face is intact. And take a look at your eyes. So I want you to just stare straight ahead for me, and I'm going to shine something in your eyes, so I apologize. It's going to be bright.
Okay.
Good. want you to take a look at the pen. Do you see it's blurry here? Is that close enough for you?
It's close enough.
Okay,
Yes.
any double vision here?
Mm-mm.
Okay, follow my pen, just moving your eyes, not your head. Very good. Any double vision with that?
Mm-mm.
Okay, follow my pen. Does it get blurry at all out here?
No.
Okay, so your issues with seeing in the distance are a little bit further out than that. Okay, that's good. And coming closer, just follow it for me. Very good. Pupil sizes are great. Just going to do a couple of vision tests here. I'm going to give you something to read. Just this little chart here. I'm going to hold it about there.
Okay.
Okay, can you just, I'll hold it for you. Just read this line for me.
LTFPH.
And can you cover one eye? And read that same line backwards for me.
HPFTL.
Okay, uncover and cover the other eye and read it forwards.
LTFPH.
Okay, good. So yeah, that near sight and vision is intact.
Mm-hmm.
Go ahead and cover one of your eyes with this. And I want you to stare straight at my nose.
Mm-hmm.
Okay, and tell me when you see my fingers wiggling.
I see them wiggling.
Okay,
I can see them wiggling.
good.
Yes.
Okay, switch eyes for me, please.
I can see them.
Good.
I can see them. Yes.
All right, so that's all fine.
Awesome.
And any issues with color, seeing color?
Not that I'm aware of.
Okay, let's do a little test here. What does that look like to you?
Blue.
All right, and what about this one?
Maroon red.
Perfect. All right, so no issues there. We will take a look into the nose now, and you said no issues with smelling or anything like that.
Mm-mm.
Okay, can you breathe in for me? Nice and clear. Breathe in. Okay, relax. I'm just going to tilt your head back. Very clear. I'm going to give you something to smell. Keep your eyes closed and just tell me generally what this smells like. Take a breath.
Citrus.
Mm-hmm. That's lemon. And one more.
Lavender.
That's right. Okay. So nose is fine. I'm just going to take a look at the mouth now. You can just open for me and say ah. Okay. Any pain around the mouth?
No.
Any sores? Can you push your tongue into my hand here? Good. Strength. And this side. Good. Stick it out for me. Just gonna take a look. And can you move it side to side symmetrically? Okay, very good. No drooping or anything there. So all that looks fine. I'm going to move down to the chest now and just take a listen, all right? I'll start with your heart, and then I'm going to have you breathe for me, but I'll let you know.
Okay.
Just breathe normal for me. Okay, that sounds fine. And just take a deep breath when I touch you with my stethoscope. Okay, in and out. In and out. Good, one more time. Okay, lungs sound clear. And have you say 99 when I touch you, okay?
99. 99. 99.
That's all fine. I'm just going to tap here just a little bit. Just lift your arm for me, please. Thank you. That's fine. This side. All right. All that sounds totally normal. Just take a look at your arms. Just first looking at the skin. Any pain in that joint there?
Mm-mm.
Okay, and the wrist. Same thing on this side. You have a couple of freckles, and you do have the tattoo there, but that looks well healed. How long have you had that?
Maybe 4 years.
Okay, another one here on the finger, but no problems, right?
No problem.
Any pain with that?
No.
There. All right, I want you to test some strength here, so I want you to put your arms up like this. push me away, pull me towards you. Okay, same thing with the wrist, down like this, push me away, and pull me, and push down. Good. Put your fingers out like this, don't let me close them, keep them strong, very good, very strong. I'm gonna put this piece of paper right in between your fingers like that, don't let me pull it out. Okay, next one, don't let me pull it out, good. Same thing on this side, and the next one. Do the same thing with sensation. I just want you to tell me yes if you feel it and if it's the same side to side, okay?
Okay.
So you feel that
Yes.
and that,
Yes.
same side to side?
Mm-hmm.
Okay. Close your eyes, tell me when you feel it.
Yes. Yes.
Same?
Mm-hmm. Yes. The same. Yes.
And in here?
Mm-hmm.
Feel that?
Same.
Same? Okay. Is this the same sharpness all the way down the arm? Does that feel the same all the way down? Like this? Feel different at any point? Numbness at any point?
No, feels
Okay.
the same.
Same thing here. Anything else different? Same all the way down?
Feels the same.
Does this feel cold here
Mm-hmm.
and here?
Yes.
Here and here.
Mm-hmm.
All right, stick out your hand for me, please. I'm going to poke you here with either 2 points or 1 point. Do you feel the difference?
Mhm.
All right, close your eyes and say 2 or 1.
2. 1. 1. 1. 2.
Okay, I'm going to draw something in this hand. It's going to be a number. I want you to tell me what that number is.
3.
Okay, one more time.
7.
And if you add those together, what do you get?
10.
Perfect. I'm going to move the finger joint here, down or up. Feel that?
Mm-hmm.
Tell me up or down.
Down. Down. Up.
Okay.
Down.
Okay, so perfect. I'm going to do the same thing on this hand, 2 to 1. Just tell me what you feel.
2. 1. 2. 2.
Okay, and this is going to be a letter.
A.
Okay,
L.
perfect. Up or down?
Down. Up. Up. Down. Down. Up. Down.
Okay, so all your sensory is good in your hands. You're able to feel everything. I'm just going to have you move to the table and we'll finish up with the lower half of your body. All right, so since we're down here, I'm going to feel the joints. Do some movements. So can you pull this leg up to your chest and back? Very good. Any pain with that?
No.
Okay, and this leg up and back. Okay, ankles go backwards and forwards. Can you sort of twist them around? A little bit of cracking there. Not normal for you?
Mm-hmm.
Okay. I'm going to do the same thing with the strength. I just want you to kick out against my hand. Kick me away, yep, and pull me towards you. Very good, very strong. Put your leg out straight. Can you lift up here and down? Good. Same thing on this side. Push me away. Pull me towards you. Good. Leg straight out. Up against my hand and down against my hand. Feet back against my hands and down on the gas pedal. Very good. Okay, so your strength's all there. I'm going to do some reflexes down here. So I just want you to do the best you can to give me all your weight. Just relax into my hand. Perfect. Okay, same thing here. I'm just going to bend your leg here. Just relax. So bend your leg a little bit more. There you go. Perfect. And again, just give me all the weight. Just completely relax. There you go. Perfect. Same thing on this side. Okay. Let's scrape the bottom of your foot. It's going to feel a little uncomfortable. Very good. Okay. So that's all fine. I'm just going to slide these up, do a little bit of that sensation again. So just say yes when you feel it.
Yes. 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 Yes.
Does it feel the same side to side?
It does.
Okay. And what does this feel like?
A scratch.
Okay, and does it feel the same all the way down?
Yes.
What about like this?
Yes.
Okay, I'm going to use a very sharp tool down here. And I just want you to tell me if it feels sharp all the way down, okay? Does this feel same sharpness all the way down?
Yes.
Okay, and here?
Yes.
Okay, I'm going to do the bottom of your foot. Feel that?
Yes.
That's okay.
Mm-hmm.
There's some pulses here. Just feeling the temperature as well. It's a little cool, so I just want to make sure circulation's good. Okay, that's fine. You might just have slightly cooler extremities. Do you ever have tingling in your feet? Anything like that?
I don't think so, no.
Just some coolness.
Mm-hmm. Very
Okay.
cold.
Yeah, it's cold in here as well, so. All right. I'm gonna take.
I'm a cold person.
You run cold often. Okay. Let's take a quick listen to your stomach, and then I think you'll be all set. So, yep, that's fine, just like that. I just want to listen to all 4 quadrants here because you say you've been having some stomach issues, and is that all your life pretty much, or?
Yeah, pretty much.
Okay. And does anything make it worse? Have you tried doing any exclusionary diets?
I've thought about it, but I've never done it. I've kind of just figured out what makes it worse or not.
Okay. Well, it sounds okay. There's definitely is activity in every quadrant, which is what we're looking for. I'm just going to feel, see if there's anything. I'm going to go a little deeper, okay?
Mm-hmm.
Any pain with this?
No.
Same tapping. Okay. All right, go ahead and sit up for me. And we'll just take some notes and finish out the exam. Just sanitizing my hands here. And let's start with the head. And let me know if there's any pain or tenderness while I check through here. Is there pain when I squeeze you at all?
No.
That doesn't cause any headaches, issues? You said you had a couple headaches.
No.
Where in your head are you feeling those headaches generally?
Usually the front.
Like here?
Mm-hmm.
Okay. I could be more sinus related actually. Just gonna look through with a comb really quickly. Look at the scalp itself. Any tingling on your scalp when I do this?
No, not really.
Excellent. Hair looks healthy, thick, evenly distributed. You haven't noticed any hair loss, have you?
No.
Not too oily, not too dry and brittle. Perfect. Looking at the eyebrows, I'm going to press right here. Any pain when I do that?
No.
What about right here?
No.
Okay. Can you close your eyes for me? Is there tear glands here? Any issues?
Mm-mm.
And gently palpating on top of the eye. Okay. I'm going to keep continuing to palpate. Can you open and close? Open, close. Little clicking there. Is that normal for you?
Yeah, it
You've
is.
noticed that before?
Mhm.
Does that radiate pain anywhere?
No.
Okay. If that gets worse, we may want to do a little bit of TMJ work. Just going to feel for some lymph nodes. Just relax. Feeling for any swelling here. Mind if I just move this down just a little? Perfect. Can you shrug for me? Shrug your shoulders for me. Good. And I'm down. And then up like this to like that. Yeah, perfect. Okay, relax. Maybe a couple of small swelling in the neck here. Nothing to to be concerned about? Do you ever have allergies or hay fever or anything like that?
I'm a little bit of allergies.
Yeah, okay. Could also be contributing to those headaches as well. All right, let's go ahead and do a couple of cranial nerves. So if you could open your eyes for me, I'm going to just be checking the symmetry of your face. Upon inspection, looks very symmetrical, as symmetrical as any of our human faces are. Can you raise your eyebrows for me nice and tall? Okay, good. And smile for me. And then can you make a frown? And can you puff those cheeks out and just hold them for me? Don't let me push them in. Good, nice and strong. And close your eyes really tight. Scrunch them up and don't let me open them. Good. I'll do some sensation next. So it's going to be this really light cotton wisp. Give me your hand. Do you feel that? So close your eyes. I'm just going to have you say yes when I touch your face, okay?
Okay. Yes. Yes.
And did that feel same side to side?
Yes, it did.
Good.
Yes. 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 Yes.
Okay, everything felt equal and the same.
It did.
Excellent. I'm going to do the same thing with something sharp, and I just want you to tell me if it feels sharp. So just say sharp when you feel it.
Sharp. Sharp.
And that felt same sharpness?
It did. Sharp. Sharp.
Good.
Sharp. Sharp.
And just as sharp at the top as it was at the bottom?
Yes.
Awesome. Let's go ahead and look into these eyes. So before we get your glasses, I'm just going to look into the eye itself. So go ahead and look straight ahead over my shoulder for me. I'm going to shine a light in it. It might be a little bright. I apologize. Good. Okay. Very good. Can you look up for me? And look down for me. Okay. And straight ahead again. Just checking for the reflex. Perfect. And just look right over that shoulder again. I'm going to get super close. Very good. And on the other side. Okay. All right, so do you have your glasses with you, Jeremy?
I do, yeah.
Can you just put those on? I'm gonna have you do this eye chart here.
Okay.
And just go ahead and read this line right here for me.
EPTZO.
Good, and can you read the one below that?
CFDHJ.
Perfect. Can you cover one eye for me, please? And read this line backwards.
OZTPE.
Okay, cover the other eye for me. And read this line forwards.
Same line? EPTZO.
Good. Can you tell me what this color is right here?
Red.
What about right here?
Green.
Good. So no issues with color then. So keep those glasses on. I'm going to have you hold this in front of one of your eyes. Good. I want you to look at me, straight in my eye. Tell me when you see my fingers wiggling.
See it wiggling?
Good.
Wiggling?
Good. Keep looking at me.
Wiggling?
Good. Go ahead, switch eyes for me.
See it. See it.
Perfect.
See it.
Okay, great. No problems there. And move on to those ears. Just going to touch them first. Could you remove those glasses for me now? Thank you. Any pain in your ears?
No.
Okay, let me take a look. A little bit of wax buildup, but no redness. Could just be also those allergies. That side looks a little clearer actually. I'm going to do some hearing tests. I'm going to hit this fork, put it here. Tell me if you hear it on the right, the left, or both equally.
Okay. Equal.
Perfect. Same thing, I'm going to hit it, I'm going to put it here. Tell me when it stops making a sound.
Stop.
Can you hear it here?
Mm-hmm.
Great. Same thing on the other side. Tell me when it goes away.
Stopped. I can hear it.
Perfect. I'm just going to use this little puff of air, and I want you to close your eyes and tell me left or right side.
Left. Right. Right. Left. Left.
Very good. Same thing, left, right, or both.
Left. Both. Right.
And I'm going to whisper something behind your ear. I want you to, I'm going to cover this ear and tell me what I'm saying. 1, 2, 3.
1, 2, 3.
Okay.
X, Y, Z.
Great. So no issues with your hearing. That's excellent. Move on to your nose now. Just going to gently take a look. Can you breathe in for me here? A little bit of occlusion. Breathe in for me there. It's pretty clear on that side. Is that common for you? Have a little bit of a stuffiness?
Yeah.
Okay. Does it bother you greatly?
No.
Close your eyes for me. I'm going to give you 2 scents to smell. Just tell me what they are.
Lemon?
Yep, that's perfect. And this one?
Peppermint?
Very good. Okay, so far no problems. Last thing, I just want to peek into your mouth. Can you say "ah" for me? Okay. I'm going to put on a glove. I'm just going to very gently feel inside of your mouth, okay? Any pain here?
No.
Okay. Can you push with your tongue into my hand? Good. And here? Excellent. All right, Jeremy, I'm going to move down to your chest.
Okay.
I'm going to listen to your heart to start with. And can I just check your pulse here? Just relax it. And breathe normally. Okay. I want to hear your breathing as well. So just take a deep breath in for me. Same thing here, little breath. 2 more. Good, nice and clear. I'm going to go ahead and just do a little bit of tapping. Good. And can you say 99 for me?
99.
One more time.
99.
Can you just go ahead and twist for me and take a look at the back? And same thing, just a nice deep breath in. One more. On this side. Okay. Same thing, tapping on the back, just relax. And say 99.
99. 99.
Take a nice deep breath in for me. And let it out. Okay. Any pain here?
No.
How about here?
No.
Great. I'm going to go ahead and have you just lay back here and take a look at your stomach.
Okay.
All right, Jeremy. Taking a look at the stomach. Any issues with the stomach?
No.
Just going to press a couple of places. Tell me if there's pain. I want you to breathe in and push out all the way for me. Just going to feel for the spleen. Good. Can't feel it. Okay. Take a listen for your bowel movements. No problems there. And just checking your vein here while you're laying down. Okay. No issues. I'm going to do some range of motions with your legs while you're laying down, okay? So I want you to bend your leg up. And you said you're having a problem with that knee, right?
Mm-hmm.
Does that hurt to bend like this?
Not really.
Okay, I felt a little popping there. You feel that?
Mm-hmm.
Okay, so it might be a little bit of arthritis there. Lost a little bit of the lubricant in that knee. Try this side. Hear that crack there as well? Okay. You may want to consider some exercises that strengthen this band here along the side. It's going to help the knee really hold in place. Definitely feeling some crepitus there. A little bit of swelling as well. Feel the ankles. Any issues with that?
Just a little bit of tenderness.
A little tenderness. Can you pull them back as far as they can go? And don't let me pull them. Okay, good. And push them against my hand. Okay, good. And I'm going to move your toe up and down. I want you to tell me what's up and what's down, okay?
Okay. Up. Down.
Okay, on this side.
Down. Down. Up.
Perfect. I want you to tell me if you feel the vibration.
Feel the vibration.
Tell me when it stops.
Stop.
Feel it?
Mm-hmm.
Tell me when it stops.
Stop.
Perfect. Okay. All right, Jeremy, go ahead and sit up. I'm going to just finish up with the strength and range of motion in your arms, okay?
Okay.
Jeremy, now that you're sitting up, I'm going to have you do some range of motion for me. So can you go ahead and lift your arms up like that? Any pain in the shoulders?
Just a little.
A little?
Mhm.
Okay. And can you go back like this? Okay. And how far up can you get your hands? Okay, good. I'm going to do some strength too. So put your arms up like this. Try and push me away. And try and pull me closer. Okay. And then same thing just with your hands like that. Push with your fingers. Good. And pull back. Very good. All right. Do a couple more neuro tests here. I want you to tell me if you're feeling 1 point or 2 points.
1, 2. 1,
Okay.
2, 1, 1, 2.
Good. And same hand, I'm going to draw a number facing you. And I want you to tell me what it is.
3.
Okay, and now I'm going to do a letter. Try it again.
8.
Good. And this side, same thing, starting with a number.
1.
Okay, and then a letter.
C.
Yep, perfect. You're going to move that finger up and down just like I did on your toes. Tell me up or down.
Up. Down. 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 Up. Up.
Okay, good. And just a couple of sensation things here. I've got a cold and a hot. And just tell me cold or hot when you feel it, okay?
Okay. Cold. Cold. Hot. Cold. Hot. Hot.
Good. All right, I'm just going to do reflexes and then we're done. So I'm going to start out with your arms. Go loose. Relax into my hand. Very good. Okay. And then look straight ahead and don't look down. Okay. Same thing on the other side. Okay. I know it's a little uncomfortable. Okay, look straight ahead, don't look at me. Okay. Okay. Not as much of a reflex on that side. Okay, and this is going to feel uncomfortable. Good. All right, all your reflexes are intact. So we start out on your scalp here in a few key places. Looking especially for any dryness, irritation. Any itching or pain on the scalp?
No.
Looks really healthy. The hair is nice and thick. Any pain when I touch you here?
No, I'm good.
Okay. Just gonna go in the back here. Tell me if anything hurts. That all okay?
Yeah, that's okay.
Okay. Just gonna take a look at the other side. Again, just palpating the skull here. All right, I think that looks fine. Using my magnifying lens, I'm just going to be looking at the skin itself. I'll start out in the face. Just close your eyes for me because there is a bright light here. I do see that you have some makeup on, but otherwise the skin is really clear. A couple couple of freckles, but I believe we noted them from last time. Close look. You really don't have any problem with acne or blemishes, correct?
No, a little here and there, nothing major.
That's lucky. Okay. Then no excessive hair, no bruising, just feeling for any swelling of the face. Does anything hurt here?
No.
I press a little bit harder right here. Any pain in the sinuses?
No.
Okay, so those allergies are under control right now.
Yeah.
Okay, I'm just gonna be feeling the jaw. Could you open and close for me? Close, and one more time. Little clicking there, is that normal for you?
Yeah, I think so.
Okay, can you clench your teeth? One more time. Good, relax. Feel the lymph nodes. Coming around the front here. Swallow for me. Good, no enlargement there. So continuing the skin exam, I'm just going to be looking at the body. There's just one freckle, maybe 1 centimeter, not even. There's no change in that though, right?
No, I don't think so.
Okay. It's nice and flat. Everything else I would categorize as minuscule. Okay. Just take this arm out here. Good hair distribution, nice and even. There's a scar right there. Is that
Cat
recent?
related.
Cat related?
Yeah, it's been a few years though.
Okay. Well, that was a very naughty kitty. And the nails look good. You do have some polish on, so I'm just going to test cat refill down below here. Okay. Really brisk. Look at the other side. Just relax. Okay. Also, brisk on that side, checking the skin turgor here. And it returns right away, so you're well hydrated, which is good.
Okay.
Just going to be palpating the arms here. Just feeling for muscle tone, so let me make some movements for you. Just go relax completely, don't assist me. There you go. Feeling the shoulder joint. Any joint pain, clicking, discomfort? Good. Just going to remove this. Let me make some motions for me. So I want you to go like this and hold it there. Don't. Good. And pull. Okay. Up like this. Hold it there. Just checking the shoulder strength. Very good. Just your hand now. Just relax the arm. Just the hand. Can you go?
Oh wait.
Yeah, exactly. And push me away with just the hand. There you go. And pull me towards you with just the hand. Good, nice strength. Open the fingers wide here. Keep them open. Okay. I'm gonna have you go side to side and against my resistance. Checking reflexes in this arm. Again, completely relax. Give me all your weight. All of it. Yeah. Yep. Reflexes are great. We'll do the same thing on the other side. I'm just going to be checking. You can actually stay right there. I'll come around. Okay, perfect. Again, just feeling for any pain, tenderness. I'm going to make some motions. Just relax. Feeling for any crepitus, but there's no clicking or popping, so that's really good. All right, again, make those motions for me up like this. Strong. Pull back. Very good. Up the shoulder up. good. The hand now, just the hand. Pull back. There you go. Fingers open, nice and wide. So hand strength, I would say, is more of a 4 out of 5 versus 5 out of 5. But other than that, that could just be that if you didn't play piano as a child, maybe you don't have a lot of finger strength. But right. One back here, I'm just gonna feel the shoulder. Just a couple of lymph nodes as well that I'll check on the other side too. Give me all your weight. Clench your teeth. 1, 2, 3, clench. A little bit. There you go. All right, I'm going to remove my gloves now because I did do a relatively thorough check and there's no open wounds or anything there on the skin that could be a problem. And I want to check for temperature. I can do that better with my bare hands. Okay. Right, so I'm feeling for consistency and temperature. It is warm and dry to touch. The hands are nice and warm. There's not excessive cooling. Any problems with tingling in the hands at all? No? Quickly just do this for me. Does that cause you any pain?
No.
What if I tap like that?
No.
Okay. Inverse. Same thing, no tingling pain. Okay, relax. And feeling the temperature on this side. And again, same, warm, dry to touch. Hands feel warm, so circulation doesn't seem to be an issue. I'm going to take some measurements.
Okay.
So primarily of the head and face.
Okay.
Just have you close your eyes so I don't accidentally poke you with the measuring tape. We're just looking for the general circumference. Keep a track of any swelling or changes in the head. Could indicate something more serious, but I'm pretty sure that there's nothing going on. Okay. Just go around. And this is looking at the different sections of the arm and just the comparison of the sections for symmetry. Again, nothing, doesn't matter how long the arm is, as long as it's the same perspective as the rest of the body. And I think that looks normal to me. So I'm going to move on to your eyes now, do some of the cranial nerves. So if you just look straight ahead for me, right over there.
Okay.
I'm going to shine a light, and it's going to be quite bright, so I do apologize. I want to check for the pupillary reactions. Blink back into normalcy. Shine that right in the middle there. Getting that reflex in the same place. Checking the pupil size now. Size 2 to 3, which is perfect for the amount of light in the room. Can you see this clearly right here?
Mm-hmm.
Any double vision?
No.
Okay. Without moving your head, just your eyes, I want you to follow it everywhere it goes.
Okay.
I want you to tell me if it goes blurry or double vision or disappears at all. No? It's okay?
No, I don't think so.
Okay, good. Again, stare back at that wall for me. Ignore my pen. Now look at the pen. Good. And back at the wall. Good. So the pupils respond normally to that as well. So I just have my otoscope here, and I want to take a look at the back of the eye. Okay, so again, look straight ahead and ignore me. I'm going to come in from the side. And do you see that red reflex? Same thing over here. Good. The veins look great in the back of the eye. Do you wear corrective lenses at all? I can't remember. No, that's right. Very healthy.
Perfect vision.
Perfect. Oh, that's great. I'm also the same. But as we get older, we shouldn't talk too big, right?
Mm-hmm. Problem.
I'm going to take a look up into the nose. Any issues with smell or occlusion of the nostrils?
I don't think so.
Okay, can you just cover one for yourself and breathe in? And the other one? Breathe in. No problem, sir? Okay, just tilt back a little. Yeah, it looks nice and clear. It's got no redness or anything like that. Open the mouth and say ah. Uvula rises. Teeth look good. Going to the dentist every 6 months or so? Or so?
Close. Or so.
Okay.
Close enough, maybe.
Any major dental work in the past year that you've needed to do? Okay. You can push your tongue into my finger here. Good strength. And here. Lift your eyebrows up for me. And smile nice and big. And frown. Can you puff your cheeks out? Good. Hold them there. All right. Good symmetry, good strength of the face. So that's all normal. You tilt your head into my hand here with the neck. Yeah, there you go. And to the side. To the other side. Okay. And shrug your shoulders. Nice and strong. Good. So that's all fine as far as the cranial nerves of the face. I just want to do a bit of a hearing test. And you said no changes to your taste as well, right?
No.
Okay, so we won't bother testing that today since it's always been normal for you. So with the ears, let me take a look first. And we'll do a little bit of a hearing test.
Okay.
So just turn that way for me, please. You do have a few piercings here.
Mhm.
Any pain there?
Mm-mm.
They're well healed.
Yeah, they're very old.
Any pain here?
No.
Okay. Ears are very clear. Do you use Q-tips ever?
Maybe.
Yeah, it's a little red on the inside. There's no wax buildup, which is, nice to see, but at the same time, if it's at the expense of using ear Q-tips, just make sure you're not pushing them in too far. If it starts to hurt or if you're irritated, take a break, okay?
Okay.
Checking the other side. Right there. Same thing on this side again, just a little bit of redness, no buildup. So if you're not having any problems, I can't advise you to use Q-tips, but I understand that it can feel good. Close your eyes. Tell me, do you hear this sound?
Yes.
Tell me when it goes away.
It's gone.
Okay, same thing on this side. Do you hear this sound?
Mm-hmm.
Tell me when it goes away.
It's gone.
I've got a little puff of air.
Mm-hmm.
I'm just going to tell me which side you hear it on, okay?
Okay. Right. Left. Left. Right. Right. Left. Right. Is it above my head?
Mm-hmm.
Okay.
Perfect.
Right. Right. Left.
Okay, hearing is very good. Yeah, this pruning fork, I'm just going to place it on the back of your ear here.
Okay.
Tell me, do you hear that?
I do.
Tell me when it goes away.
It's gone?
Okay, you still hear it there?
Yeah.
Good. So hair is better than bone. This side. Tell me when it goes away.
It's gone?
Hear it still?
Mm-hmm.
Okay, so same thing on that side. As long as I have this, we'll do a little bit of sensation. You've never had any issues with sensory or drooping of the face or tingling, anything like that? Okay. Okay, so close your eyes. Tell me when you feel something touch you.
Feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Okay, move down to the...
Feel it. 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 Feel it.
Lay your hands out for me, please.
Feel it. Feel it. Feel it.
Does this feel the same
That's
as
sharper.
this?
That was the right one was
Right
sharper.
one sharper? What about this and this? Does that feel the same?
They feel the same.
Okay. This one and this one.
Yes.
Feels the same here and here?
Yes.
About here and here.
This right one was sharper.
Right one more sharper. Okay. What about here and here?
The right one was sharper.
Okay, so
And
that's intact as well. You can open your eyes. I'm going to move down to do a few more neurological tests. So can you just make some motions with your hands like that? You can go as fast as you can. Very good. And smacking on the legs. Go a little faster. All right, very good. I want you to touch your nose with your index finger and then touch my finger and follow it everywhere it goes. Okay, and the other side. Good, good perception there. It's okay to miss it a little. You're able to follow it pretty generally. Close your eyes and do the same thing, just touching your own nose. Okay, that's very good. Keep your eyes closed, put your arms up like this. Okay, keep them there, flip them over. Close your eyes. Just keep them steady even when I touch you. Okay, and relax. I'm going to be placing an object in your hand. So again, close your eyes and I want you to tell me what it is. So this hand, please. Tell me what you feel. Feel around for it. Give me a general sense of what it is.
A little brush.
Little comb. Yep, that's perfect. You're able to feel the bristles, everything like that. Keeping the eyes closed, tell me what general object this feels like, just with this hand.
A pen?
Mm-hmm. Okay. So I'm going to be drawing a number in your hand.
Okay.
Tell me what you feel.
Okay. 3.
Okay, and what about this one?
Could you do that one more time?
Mm-hmm.
1.
Mm-hmm. Add those together for me.
4.
Okay. On this hand, I'm going to be drawing a letter,
Okay.
and it's going to spell out a word. So one letter at a time.
Okay.
What letter is that?
C. Do that again?
Mm-hmm.
A.
And final letter.
T.
And what does that spell?
Cat.
Okay, and is this a cat?
This is a cat. This is a cat.
Perfect. So neurologically, you're very sound of mind. Not only can you recognize letters and the meaning of those letters, but you can recognize the object as well that it represents. So thank you to Eamon for helping out with the neurological exam today. I'm going to finish up just by testing the lower body now, okay?
Okay.
So I will have you lay down for this.
Okay.
So while you're laying down, I'm going to be palpating the stomach and taking a listen to it as well. So I'll first start with a listen. So I've got my stethoscope here. Any issues with the stomach lately? Anything new?
No.
Okay. Okay. And tap just a little here. I'm just listening for the sound. I'm feeling a little deeper now. If there's any discomfort, please let me know.
Okay.
Any of that painful?
Mm-mm.
Would you lift this arm up for me? I'm just going to feel a kidney underneath here. Okay, and down. Okay. Any pain there?
No.
Listen to the heart while I'm here as well. So just breathe normally for me. Okay, now I want you to take 2 deep breaths. One here and out, and one here and out One more, in and out. Okay, that sounds clear to me. No problems with breathing along the shoes. All right, I'm going to move down to your lower body now, and I just want to be feeling the legs and for any issues. Any pain in the knees? Okay, uncross your legs for me. Can you push up with this one, nice and strong? Good, and this side. Okay, just looking at the skin on the legs. And nice and even. Good. Okay. It's fine. You really have no blemishes on the legs as well. Can you put your legs up like this? Yeah, exactly. And push me away. Yep, and pull me towards you. Relax this one. Push me away. Pull me towards you. Good strength. Keep that up there. I'm going to do a reflex. So I'm just going to have it tilt to the side here and relax. Good. I'm going to scrape the bottom of the foot. Perfect. Relax that. Just to the side. Okay, scraping the bottom of the foot. Give me all your weight. Completely collapse on me. There we go. Same thing on this side. There we go. All right. Go ahead and sit up and we'll just finish off with your vitals today. Do you have an arm preference for your... Okay. So I'll just put the blood pressure cuff on this side then. And you will feel the cuff get a little bit tight. If it's too unbearable, let me know. Otherwise, I'll just be listening for the pressure. Blood pressure is on the lower side. Is that typical for you? It's about 108/62?
Yeah.
Okay. Very healthy blood pressure. Just if you're used to having high blood pressure, it could be indication of something problematic. If that's normal for you, that's very healthy. Take your temperature. Okay, 98.6. Perfect. Bang on the dot. And then I'm just going to feel the pulses. Okay, so first in the neck, just breathe normally. The arms. Okay. Just behind the knees as well. Thank you. All right. Let's grab the light and I'm just going to look at the scalp itself. It's really healthy. The hair is nice and thick, no thinning issues, right?
That's correct.
Good. Just gonna check the back. Okay, that's fine. So those are all normal findings and no pain in the head, which is good. Any pain when I press here?
No.
What about right here?
No.
Okay. Just gonna feel the pulses. look at the face. Close your eyes for me, please. Looking at the skin. Looks really healthy and smooth. A little bit of freckling, but nothing concerning to me. Your eyebrows are nice and symmetrical. Can you lift your eyes up for me, please? And keep them up there. Don't let me close them. Okay. And puff your cheeks out for me. Okay. And smile nice and big. Very good. And can you just frown for me? Just looking for symmetry. That's perfect. So no drooping of the face. Some great facial movement there. Okay, let's take a look into the eyes themselves. So if you just push your hair back for me, perfect. So I'm just going to start by looking into the eye itself, just because you're already having some of that discomfort. So you're going to see a bit of a bright light, and I am going to need you to keep your eyes open, so I do apologize for any discomfort this might cause. So just stare straight out into the distance for me, please. I'm just going to come in from the side. Okay. Blink for me. Just, I know that's a little intense. And this side. The back of the eye looks good. I'm going to have you look at this thing. Does that have any double vision there?
A little bit.
A little bit. So how's it about here?
It's coming together.
Coming together.
Mm-hmm.
Tell me when you can see it in one piece.
A little more. Yeah, I can see it there.
Okay. I want you to follow it just with your eyes. Don't move your head. I'm just going to watch the movement of your eyes. Any pain with this?
No.
Okay. Look out into the distance again. Ignore me here. And now look. And ignore. Okay. So there was a slight irregularity there. Just a little bit of mild nystagmus in the right eye especially. And the double vision did occur a little bit further out than we normally see. So that does show me that there is some abnormalities with the eye itself. Just going to look at the pupil size here. And that's appropriate for the room. Okay. I am going to shine another light in your eye now, and it's going to be bright, so I do apologize. But again, just stare straight ahead. Just try and be quick. Good. And right to the middle there, just stay out of the way. All of that is fine. Normal change of the pupils. Do a couple of vision tests. You said the contacts you have in are okay for you, right?
Right.
Now I know reading is bothering you, and I want you to tell me if that blurriness is occurring or if it's too uncomfortable for you, okay?
Okay.
All right, so can you see this about here?
I can.
Okay. Can you read this line for me, please?
FPH.
Very good. What about the one below it?
It's a little blurry, but
A little blurry? How about here?
okay. OLCF.
Okay. So that is very good, but that is about 20/40. So if it was already getting blurry, I would say perhaps your prescription is not quite up to date. Let's do a couple more tests. Hold this over one of your eyes, just whatever one you choose, perfect. And just look straight at my nose. Ignore my fingers, but tell me when you can see them in your peripheral wiggling into.
I can see them.
Good.
Yes. Yes. Yes.
Okay, switch eyes for me, please.
Yes. 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 Yes.
Peripheral is perfect. No problems there. You ever had any trouble with color blindness? Has anyone ever
Not to
mentioned
my
that?
knowledge.
Right. I'll show you a picture. I want you to tell me what number you see here.
73.
Very good. Let's do a couple other. What number is that?
7.
Okay.
6.
And then I'm going to give you something to trace. Just find it here. So with your finger, what I want you to do is start here on that pink one. You see that there?
Yes.
And trace it all the way around to the X to the other side. Okay. So there's no issues with color blindness. Peripheral's intact. But we did sense that a couple of abnormalities in the nearsighted reading, as well as with the follow test there of my finger. What I'm unsure about is if it's simply that your prescription's a little out of date, it's causing some eye strain, which could trigger an ocular migraine. And one of the most common symptoms of ocular migraines are blurry vision. So what I don't know if it is that or if it's more of a neurological issue that's coming from the cranial nerves. So let's do a few more tests here, see if there are any other neurological signs. If there are not, I'm going to say that you probably need to go back to the optometrist for an updated prescription. Let's do a few tests here. So moving down to your nose, I'm just going to take a look first. So let me sanitize my thing here. Okay, so just tilt your head back for me, please. I'm just gonna take a quick look. Nice and clear. No drainage. Okay. No pain in the nose, you said?
None.
That feels okay.
Yes.
I'm gonna give you a couple of things to smell. And you said you're allergic to tree nuts, right?
Yes.
Okay, so let's avoid that one. So I've got 3 other scents here. I just want you to close your eyes, and I'm going to show you 2 or 3 of them, and I want you to just take a big whiff. First, closing one nostril. So close one of them, choose one, and take a big smell of that. What does that smell like to you?
Like coffee or chocolate?
Yep, coffee is exactly
Mhm.
correct. And this one's a little bit trickier, so cover the other side there. Take a big smell of that one.
Is that ginger?
That's correct. And our last one here, I'll just do with both open. So
Is that garlic?
that's garlic, very good. So no issues with the nose. As long as I have this out, I'm just going to give you something to taste. I want you to tell me what it tastes like. So open your mouth for me. I'm just going to put that on your tongue. What does that taste like to you?
Lemon?
Yes. So both of those sensories are intact. Just make a note. And you said no change in smell or taste anyway, so
No.
so that's good because that rules out something more in the for the eyes, something more in the of a cold or a sinus infection that could affect other parts of the face. Okay. Let's take a look into the mouth as long as I have this out. Can you say "ah" for me, please? Okay. And that's fine. Can you push your tongue into my hand on the inside here? Very good. And over here. And stick it out for me. And move it side to side. Good symmetry. And strength as well. Just look at the ears. Very good. Do a couple of little hearing tests here. Just a little puff of air, just like that, okay? And I just want you to close your eyes and tell me left, right, which side you hear it on.
Left. Right. Right. Right.
Very good.
Left.
Okay. Do you hear this sound here?
Yes.
Okay, close your eyes. Tell me when it stops.
It stopped.
Okay,
Stopped.
very good. I'm going to hit this tuning fork. It's going to make a little bit of a sound and put it in the middle here. I want you to tell me which side you hear it on or if it's equal.
It's equal.
Perfect. Putting it behind here. Do you hear that?
Yes.
Tell me when it goes away.
It stopped.
You still hear that there?
Yes.
Much louder, right?
Yeah.
That's good. That's how it should be. Same thing here. Tell me when this stops.
It stopped.
Still hear it.
I hear it.
Okay. So hearing's intact. I don't think we need to do further testing there. I'm actually going to test the sensation of the face when you're laying down so you can be a little bit more relaxed. So I'll move on now to just taking a look at the neck. So I want to feel your neck now, specifically looking for the lymph nodes. Let me know if there's any pain with this. Shrug your shoulders for me. Good. And while you have them up, push against me. Okay. Can you swallow for me? Just want to look at the neck. Very good. I don't see any pulsations either. I'll look while you're laying down as well, but I'm just going to feel side to side the pulses here. Good, nice and strong. Okay. The last thing I want to do here is just listen to your heart and lungs on the front, and I'll have you swing around and take a listen to the back. So, you said no problems with any of that, right?
No.
So I'm just going to listen for now, so just relax. I'm going to listen a couple places. Okay, I want you to take a breath for me. Just a normal breath is fine. Just going to go underneath this arm here. And on this side. Okay. Lung sounds are clear. I'm going to do a little tapping in just a couple places. Just listening for the resonance. Okay, none of that was painful, right?
No.
Okay. You say 99 for me?
99.
And one more time down here.
99.
Good, I can't feel a thing. Okay, so no issues there. I will actually have you lay down first, and then I'll do your back at the end here. So lay back for me, please. I haven't found anything else of concern, but let's continue to investigate. All right, Kate, so continuing while you're laying flat here, I am just going to look at that neck one more time. So just turn that way slightly for me, please. Looks great. And while I have this out, I'll take a look at the arms. There's quite a bit of freckling. Are you seeing a dermatologist regularly to get those checked?
Twice a year.
Twice a year. And any issues so far?
I've only had one.
Okay. So, but as long as you're checking them regularly,
I am.
that's all that matters. Okay. I'm just going to feel for the temperature here as well. Good, nice and warm. Come around and check the other side. So you just put this here. And checking for temperature. Consistent. All right, so let's do a little bit of sensation, starting out with the face itself. And I'm just going to be touching the face very gently with this little piece of cotton. It feels kind of like that. You feel that?
Mm-hmm.
Just say yes when you feel it, keeping the eyes closed.
Yes.
Yes. Yes. Yes. Yes. Yes.
Okay, and does that feel the same side to side?
Yes, it does.
Same.
Yes.
Okay. Now, a little bit of a sharp and dull. I'm just checking those two sensations. Do you feel the difference on those?
Yes.
Okay, just say what you feel.
Sharp. Dull. Sharp.
Good.
Dull. 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 Sharp. Sharp.
Okay, all facial sensations intact. What temperature does that feel like to you?
Cold.
What about that one?
Warm.
Good. Do you feel this buzzing here?
Yes.
What about now?
No.
Okay. Do all that again. I'm just going to make my way down your arms.
Okay.
So again, just say yes when you feel it.
Yes. 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 Yes.
Can you flip your arm for me?
Yes. Yes.
Okay, very good. Do the same thing on the other side. Just bring your arm up for me, please, so I can grab it. And tell me when you feel this.
Yes. 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 Yes.
Flip the arm.
Yes. Yes.
Okay, relax. Same thing, sharp or dull.
Sharp. Dull. Dull. Sharp. Sharp.
Okay, on this side.
Dull. Sharp. Dull.
Okay. What does that feel like?
Cold. Warm. Warm.
Put your other arm on your stomach for me, please.
Cold. Warm. Cold.
Okay. What do you feel right there?
It's vibrating.
What about now?
It's vibrating. It's just touching me.
Okay. I've got a very sharp tool here. I'm just going to run it very lightly down your arm. And I just want you to tell me if the sensation changes at all, if it gets less or more sharp at all down the arm. How does that feel?
The same.
Good. Same thing on this side.
The same.
Okay. Great, so all that looks fine. I want to test a little bit of strength in the arms now, so I'm going to have you push up against me. Good. Can you go like this and push me away here and pull me? Okay, and can you push up on this side as well with just this arm? Flatten it out like that. Yes, and push up. There you go. And push forward with your head here and turn to the side and to the side. Any pain in the neck with that? There?
No.
Okay. Take a listen to your stomach now. Same thing, a little bit of tapping. Any pain with that?
No pain.
I'm just going to feel a little deeper now. No pain with that.
None.
So that all sounds fine. I'm just going to feel for the kidneys right in the back here. Okay. What's your diet like generally?
Well, I'm a vegetarian, so
Okay.
I eat lots of fruits and vegetables, but I also do eat a lot of cheese.
Cheese is delicious. Sounds like you're balancing that out with fruit and vegetables. Protein-wise, are you getting enough? I know you can't eat tree nuts, but other sorts of eggs. Okay, so not vegan, just vegetarian. Eggs are great. Other types of beans are great.
Yes.
Lentils, things like that. I'm sure you know as a vegetarian. So I'm going to just move down to your legs now and do a little bit of that sensation right at the bottom as well as the strength. So while I'm here, you can just pull your leg, this leg back up to your chest, good, and keep it there. And push me down here with the whole leg. Good. Same thing on the other side, come back and pull me down. Any pain in the hips with that?
None.
All right, I'm going to come around to the other side and just perform a little bit of sensation. So start out by just taking a look, again, feeling the temperature of the skin, checking for any swelling, edema. Feels great. Can you put the feet up like that? Yeah, back like that, perfect. And forward. Any pain there in the joints? Okay, just relax for me. Do you mind if I just inch these up about a couple of right there? That's perfect. And good, just like that. So again, say yes when you feel.
Yes. 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 Yes.
Good.
Yes. 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 Yes.
Okay, sharp or dull?
Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp.
Good. Which is colder, 1 or 2? Keep the eyes closed.
2.
Good.
1.
Okay. Tell me what you feel here.
Vibration. It's still. Still. Still.
Okay. What about now?
Vibration.
Okay. And the last thing, this same kind of sharp tool here, and just tell me if there's any sensation changes as I go down. All the same?
All the same. All the same.
Very good. So what I'll have you do now, Kate, is just sit up, but with your legs this way so I can look at your back, okay? So I'm just going to move your hair to the side here. I'm going to feel down the spine. Any history of scoliosis?
No.
Okay. Can you just tip your head forward as if you're going to dive into a pool and go all the way forward and then slowly come up 1 vertebrae at a time? Very good. Just going to feel the muscles now. Okay, I'm going to tap on the back, same as before. Any pain here?
No pain.
Okay, we'll listen to the back. I want you to take a breath every time you feel me touch you. One more. Good. Can you say 99 for me, please?
99. 99. 99.
Okay, and take a deep breath in and out. All right. So just swing it all back around. That all looks fine, and we'll just do some vitals, okay? All right, so let me get your blood pressure here. So this is going to go on the inside of your left arm here. And what's going to happen is I'll start here, and you'll just go up like that and relax. Okay. And relax for me, please. And 108 over 80, which is good. And pulse is 69, oxygen 98. And the temperature was normal as well. It was at 98.8. asking you a few questions. So can you tell me where we are right now?
We're at the doctor's office.
Okay, and about what time of day is it?
It's about 2 o'clock.
Okay, perfect. What is the weather like outside?
It's sunny.
And what about the temperature? Is it cold, warm?
Warm.
Okay, so you know exactly where you are, what time of day it is. Do you remember my name?
Dr. B.
Perfect. And what about what did you have for breakfast this morning?
I had eggs.
Eggs. Okay, so your short-term memory is pretty good. What was your favorite subject in school growing up?
Theater.
All right, so your long-term memory is there as well. I'm going to give you 3 words to remember. I'm going to do a couple of other tests and then ask you again. So I'll go ahead and point to just a few things in the room, so it'll be easy to remember. Table, okay, shirt, and painting, okay? Can you repeat those words?
Table, shirt, painting.
Okay, good. And I liked that you also looked for those visual markers because that shows that you're using that brain functioning to reason that out. I'm going to have you do a little bit of math now. So if you have 100, can you minus 7 from that?
93.
Okay, minus 5 from that.
88.
Perfect. And 6 from that.
82.
Okay, very good. If I say the phrase, save your money for a rainy day, what does that mean to you?
Saving your money for an emergency.
Okay, very good. What were those 3 words I asked you to remember?
Table, shirt, painting.
Perfect. So all of the neurological functioning in that sense is intact, and I'll go ahead and start the physical examination now. So I want to start out with your eyes. I'm going to shine a bit of a light in them. And I'm just checking functionality, so just stare straight right over there for me, please. And you're going to have a bright light. It's going to be a little uncomfortable. I'm sorry. Good. Checking the consensual light now. And that does react perfectly good. I want you to stare right at this light here and just follow it. First of all, can you see this clearly? No double vision?
Mm-hmm.
I follow it everywhere it goes, just moving your eyes, not your head. Any double vision?
Mm-mm.
Good. No jumping of the eyes. I want you to follow it out and then back in. Okay, very good. I'm going to be making a couple of wiggles with my fingers. I want you to stare right at me and just look at my nose and tell me when you see my fingers wiggling into your point of view.
No. No.
Good.
No. No.
Okay. I'm going to give you something to cover up one of your eyes. So I just want you to cover one of your eyes with that. I'm going to cover the same one. And again, stare straight at my nose and just tell me when you see my fingers wiggling.
No. 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 No.
Okay, and the other side.
No. 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 No.
Okay, how many fingers do I have up here?
2.
Okay, switch eyes.
3.
Okay. So peripheral is very good, actually, a very strong peripheral. You can hand that back to me. Actually, hold on to it. Let's go ahead and do the Snellen chart. So I just have a Snellen chart right here. I'm going to hold it a couple feet away from you. Can you see this at all?
Mm-hmm.
All right, I'm going to point to a couple letters, and I want you to just read it for me, okay?
L. P. E. D.
Okay, cover one eye. And can you read this line for me?
P. E. C. F. D.
Okay, cover the other eye and read it backwards.
D. F. C. E. P.
Okay, with both eyes uncovered, go ahead and let them blink back. I want you to try this line right here.
D. E. F. P. O. T. E. C.
Very good. And stepping back just a little bit further here, can you tell me what this number is?
10.
Great. So that's all fine. I'm going to do a little color test. So first I'll show you several colors and I want you to just tell me what they are. So what color does that look like to you?
Blue. Pink. Orange. Yellow.
Okay. And now I've got a book here. I want you to tell me what number you see there.
5. 7.
Okay. And then I'm going to have you trace with your finger. And where's that pointer? So I just want you to hold this. I want you to point to a bright green dot. Very good. How about a brown dot? Okay, how about a red dot? And a sort of yellow mustardy color dot. All right, so you're able to differentiate all those different colors. Do you see a number here?
I do not.
Okay, very good. You shouldn't. And then what do you see here?
42.
All right, thank you so much. So the eyes look really good. I'm just going to take a really close look. So again, stare straight into the distance. I am going to get close to you here. Okay, red reflex is intact. Same thing on this side. Okay, and that all looks fine and normal to me. I'm going to have you take your finger, touch your nose, okay, and touch my finger. Everywhere it goes. Very good. Just watching the eye movements as well. Good. That's fine. You're very quick at that, which is wonderful. I'm going to have you lift your eyes nice and wide and look that way. Look this way. Up. Down. Just going to look. Open them for me, please. Good. Can you puff your cheeks out for me and hold them? Push your chin against my hand. Push back to the right, to the left, and just turn your head like that. There you go. This side. Okay. And push forward. Shrug your shoulders for me. Just doing a little bit of strength while we're at it. Next, I'm going to take a look at your nose. So I'm going to just have you. You said no changes in smell or anything, right? Mm-hmm. Let me tilt back slightly here. And that looks fine, nice and clear, no deviation of the septum. I'm going to give you a few things to smell. I just have a few different smells here, so close your eyes for me. I'm going to open them up. And just take a big smell of this one with both open. And it could be like a sort of what it generally reminds you of.
Lavender.
That's exactly right. So go ahead and close one nostril, breathe in and out from the other one. Checking for occlusion. And then keep that covered and tell me, what do you smell here?
Citrus.
Yep, lemon. Perfect. Do the same thing on the other side. Close that other nose, breathe in and out. And I'm going to give you one last scent here.
I'm not sure what that one is.
What does it remind you of?
One more time.
Yep.
Oh, peppermint.
That's exactly right. Yeah, sometimes it can just take a second to jog our memories. All right. So if we open up and say ah, you can open your eyes. Checking for the uvula, and it rises. Just gonna feel around the jaw here. Can you open and close for me? Again. Okay, That's all fine. No changes in your taste, correct? Okay. I'm going to have you swallow for me. Good. And just checking the neck. I'm going to feel the lymph nodes now, so you're going to feel me working my way around here. Any pain when I do this? Okay, coming around the back. Shrug your shoulders for me a little. Okay, and relax. I'm just going to get the ones here. Test a reflex in your jaw. Just let it hang for me, please. Good. All right, lastly is your ears. I'm just going to take a peek in here. Those look really clear. Just a little bit of earwax, which is very normal. No redness, no discharge. Any pain here? Okay, what about on this side?
No.
Okay. I'm going to be whispering something in your ear. I just want you to close your other one. So close that ear. I'm going to whisper over here. Have you repeat after me, okay? CRT.
CRT.
CRT, very good. And same thing on this side. Close your other ear. BLA.
BLA.
Okay. So you're able to hear that just fine. I'm going to hit this tuning fork, place it right in the middle of your head. Tell me if you hear me left, right, or equally.
I feel like I feel it a little more on the left side.
On the left side, okay. Try it one more time. How about now?
More equal now.
More equal, okay. So a little bit more sensitivity on the left side than the right. That could also be if there is some swelling from that injury. There could just be a little swelling around the ear as well. So let's try it individually. So I'm going to hit this, place it on the back of your ear. Tell me when it goes away. You hear that?
Mm-hmm.
Do you still hear that right there?
Yes, yeah.
All right, so that's functioning normally. Same thing on this side. Tell me when it goes away.
No.
Can you still hear that right there?
Yes.
Okay. So that also is not too concerning. There's a little bit of a hearing deficit. Let me just close your eyes. You hear this? Tell me when it goes away.
No.
Okay, how about this side?
No.
Okay, definitely a little more acuity on that left side. So could be some swelling blocking the ear there. I didn't see anything in the ear itself, so I'm almost wondering if it's just because you have a little bit of a headache on that side. While I have these out, I'm going to test some sensation. Starting out with just a really light touch. So close your eyes and just say yes when you feel it.
Yes. 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 Yes.
Okay, does that feel the same all the way around?
Yes.
Here and here,
Yeah.
here and there.
Maybe slightly more sensitive on this side.
You can feel it better on this
A
side?
little bit, but
Okay.
it's mostly-
Mildly, okay. I'm going to do the same thing with a sharper tool. This is quite sharp, but I'm not going to be breaking the skin. But I want you to tell me if it feels the same sharpness side to side. So does that feel the same as that?
Yes.
Okay, good. This and that.
Yes.
Yeah. Does it feel as sharp all the way down the face?
Yeah.
Here, here, and here.
Yes.
Here, here, and here.
Yeah.
Okay. So that's fine, I think, sensory-wise. What does that feel like to you?
Cold.
There too? Same?
Yes. Yeah. Yeah.
All the same?
Yes. And all cold.
And do you feel this here?
Mm-hmm.
Tell me when it goes away.
Now.
Okay. Try that again. Just tell me when the vibration stops.
Now.
Very good. How about right here? feel that?
Mm,
Not as much?
not as much. Yes, I feel that. And it's done.
All right, so a couple of disparities there in the sensory exam. I would say if don't feel better in a couple of weeks, we can do a really thorough sensory exam. But for the most part, you were able to feel everything, differentiate between sharp and dull and that kind of thing. So I'm not too concerned. I'm gonna move down to do some strength testing now. So I want you to put your arms up like this and down like that. And then just don't let me push me back here, and up like that, and push me away. Put your wrists out and clock them up. Don't let me pull them down. So
Oh,
keep
got it.
them up like that. And that way, and down. And don't let me pull them up. Can you go side to side for me? Just with it like this, not like that. Yeah.
Yeah.
Any weakness or numbness? Okay. I want you to just put your fingers out like that. Don't let me push them in. Nice and strong. Very good. You can relax. I'm going to do that same bit of sensory just down the arms and just be testing a few of the parts of the arm here that have different nerve relations. So say yes when you feel it. Keep those eyes closed.
Yes. 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 Yes.
Okay. What does this feel like to you?
Sharp.
Okay. And how about here?
Yes. Also sharp.
What does that feel like?
Soft. Sharp. Soft. Sharp. 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 Soft.
Okay. Does this feel as sharp all the way down
Yes.
from here?
Yes.
Okay. What does that feel like?
Cold.
Cold, same thing?
Cold.
Same thing?
Cold.
Okay. I'm going to take your hand. I'm going to be lifting the finger joint up and down like that, okay? Just tell me if you feel it down or up.
Down. Down. Up.
Okay, try this one.
Down. Up. Down.
Okay, so the other hand.
Down. Down. Down.
Good.
Up. Down. Down.
All right. I'm going to put something in your hand, so keep your eyes closed, and I want you to tell me what it feels like. Okay. What does this feel like? Open the hand, feel around.
Feels like a spray bottle.
Very good. And on the other side, I'm going to give you something else to hold. What does that feel like?
Cotton pad.
All right, good. So you're able to differentiate. I'm going to be drawing something in your hand now. So I'll start with this side, and it's going to just be a number. So tell me what number this is.
1.
Okay, and what about this?
7.
Add those together for me.
8.
Okay, and I'll do this side now.
3. 3.
Good. And what are those together?
6.
Awesome. So really all your neurological functions are intact. I want to finalize with just some reflexes and some, just to do your vital signs, okay? So I'm going to take your arm here. Just try and relax as much as possible. Just give me all the weight of your arm. There you go. There you go. Very good. And look away. Don't pay attention. Keep your eyes open, but stare ahead.
Oh, okay.
Okay. And don't pay attention. All right. Same thing on this side. Reflexes here. Up like that again. Give me all your weight. There you go. Very good. Very brisk. And stare straight ahead again for me. Okay. And I'll just have you make sure that your legs are nice and relaxed. I'm going to do the patella. And just relax. There you go. So I know you mentioned in your chart that you had pretty brisk reflexes. I'm going to do the ankles too. And just like that. There you go. Okay. So no problem with the reflexes. Let's just take your temperature. And I'm going to feel some pulses and we'll be all set. 98.4. That's normal. Feeling a couple pulses here on the neck. Good. The arms. All right, so let's go ahead and do a check. So I know you might be in a little bit of pain from that foot. On a scale from 1 to 10, I want you to tell me 1 being no pain, 10 being the most pain you've ever felt, what you're feeling right now.
Right now I'm not feeling anything, but if I do wiggle my toe, I do feel about a 5.
5. Okay, so if your foot's stationary, you're feeling okay,
Yes.
and then otherwise no other aches and pains at the moment.
Correct.
Okay, wonderful. All right, let's take some vital signs. I'm just going to start off getting your temperature. I'm just going to check a couple of spots here. Okay, I'm just going to get on your chest and behind your ear. Side. Okay, temperature is normal, so that's good. No major signs of infection. Let's go ahead and get your blood pressure. Do you have an arm preference?
That's fine.
Is that okay?
Yes.
Okay, just settle down, just relax. I'm gonna set this here. Okay, you're gonna feel a little bit of tightening here. So just again, keep your arm totally relaxed and let me know if it gets too painful.
Okay.
Right. Blood pressure is pretty good, slightly elevated, but it's a little bit, nerve-wracking here and nothing to be concerned about. I want to just get your oxygen and your heart rate. So this, point your finger, please. In there, just relax it. And while I do that, I'm just going to take one of your pulses, okay? Pulse is nice and strong. Okay. And it looks like you are at 99 for oxygenation, so that's perfect. All right, Kat, any questions before we begin, Katharina?
I do not have any other questions.
Okay, if you have any pain or discomfort during the course of the exam, please stop me right away.
Thank you.
So I'm going to methodically make my way from your head down to your toes. I'll save the injured foot for last. While I'm getting these on, I'm going to ask you a couple of questions. You already told me your name. Can you tell me where you are right now?
Yes, I'm at the clinic.
Okay. And about what time of day is it?
It's about 6 p.m.
Perfect. And what day of the week is it?
It's Sunday.
Very good. Can you tell me what you had for breakfast this morning?
I had eggs and toast.
Okay. And what about your favorite subject in school growing up?
Math.
Perfect. So your long-term and short-term memory seems intact. Any issues with thinking, memory, anything?
No.
Okay, we'll do a couple more neurological things later as we go, but that looks good for now. I'm going to start just taking a general look at your head. Did you hit your head at all when you got injured?
No, I did not.
Okay. Any pain when I do this?
No pain.
Okay, I'm just going to check this side. Just going to comb through looking for any critters or signs of injury. Hair looks nice and healthy. I'm going to touch you in a couple of spots of your head. And I just want you to tell me if you feel it, okay? It's not going to be too sharp. It's about, feels like that, right? So close your eyes and just tell me if you feel this.
I do. Yes. 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 Yes.
Very good. So sensation of the scalp's intact. I'm just going to blow a little bit on your scalp. I want you to tell me if there's any tingling or any nerve pain that shoots down, okay? Any pain there?
No.
Feel okay?
Yes, it's comfortable.
Good. No discomfort, right?
None.
Okay. Just going to lastly just check the, if you tilt your head down for me, just checking the part here. Is this where you normally part your hair?
Yes.
Okay. Just looking for any lesions or freckles. The sun often sees this spot the most, so we want to make sure we're not missing any cancerous beginnings there. Okay. And that looks great. That is all fine. I'm going to move down to your face now. So I'm just going to push this out of the way. And just get this nice and clear. Don't see any bumps or scrapes. Very slightly for me. Very good. Any pain when I press on your sinuses
None.
there? How about here?
No.
To your ducts there? Okay.
No.
All right, I'm just going to palpate everything. Okay, eyebrows are nice and symmetrical too. Good. Take a look into your eyes. Starting out with testing your pupillary reactions here. So just like straight ahead for me, right out there. And it feels a little bit bright, so I apologize for any discomfort here. Okay, good. I'm going to shine light right in the middle. Okay. I want you to take a look at my pen. Any double vision here?
No.
Okay, follow it everywhere it goes, just with your eyes, not moving your head. Any double vision while I do this?
No.
Good, no nystagmus. Go ahead and look way out there for me and ignore this. And now look at it and look back and look at the pen. Follow it out and follow it in. Good. Now it's a little cross-eyedness, but that's totally normal. All right, I'm going to take a little closer look into your eyes. I'm just going to get a little close to you, so stare straight over there, and I'm going to come in close and looking into the eye. Okay, very good. The same thing on this side. And just keep looking over there. Very good. I'm going to test you with the Snellen chart. So can you, do you have any issues with vision? Do you wear glasses or contacts?
No.
Okay. Can you read with both eyes this line for me, please?
EPTZO.
Okay. And cover one eye for me. And can you read the same line backwards?
OZTPE.
Okay. And cover the other eye. And read this line forwards.
CFDHJ.
Okay. Very good. Just checking the pupils. You got all those correct. I'll give you a card here. I just want you to cover one of your eyes. You can choose. And stare right at me, right at my nose. And you just turn towards me a little bit. You just stare right at my nose. And just tell me when you see my fingers wiggling.
I see them wiggling.
And you just say now when you see it.
I see them.
Okay.
I see them.
Keep looking at my nose. Try that one again.
I see them.
Perfect.
I see them.
Switch eyes for me. Same thing. Stare at my nose.
I see them.
Good.
I see them. No. No.
Okay, very good. I'll take that from you. Do one last peripheral test here. Again, stare at my nose and just tell me if it's right or left wiggling.
Left. Both. Right. Left.
Good.
Both. Left. Both.
Perfect. I'm going to ask you to tell me what some of these colors are. I'm going to check your ability to differentiate colors. So just about the color, so it doesn't have to be a perfect shade or anything. About what color is this?
Purple.
Okay, great. And this color?
Yellow.
And this color?
Orange.
Very good. So it seems like you can differentiate colors along the spectrum there, which is wonderful. Just make sure there's not anything else I want to do with the vision. I think that's okay. You said no problems with vision, right? No, is any issue seeing at night?
Actually, I do have static at night.
You do, okay. And is that something you're able to still function with?
Yes.
Okay. I would definitely recommend going to the eye doctor at least once a year to just make sure that that's not getting worse. And of course, be careful operating heavy machinery in the evenings.
Thank you.
Let's take a look at your nose. So first I'll just look inside of it. Can you tilt your head back for me, please? Any issues with smelling or breathing out of your nose?
No.
Looks nice and clear. Tilt down. I'm going to have you cover one nose and breathe in for me. Okay, and the other side, breathe in for me. Okay, a little bit of occlusion, but is that normal for you this time of year?
Allergies.
Yeah, it's definitely allergy season, so no problem. I'm going to give you a couple of things to smell. If you just put out your top of your hand for me, I'm just going to roll it right here and have a smell of that for me.
Lavender.
Perfect. And the other hand, please. Go ahead and smell that for me.
Chocolate.
Perfect. Smelling is intact, nose is intact, no worries there. Take a look into your ears. So just looking at the outside first. Do you have one piercing? Backs look good. Any pain when I press there
No.
or there?
No.
You ever have any issues with the piercing? How long have you had that?
I had them for a couple months. I was allergic and then realized I could only handle titanium.
Okay. And
Other
that's,
than that, no problem.
since switching to that titanium, you haven't had any bubbling of the skin or irritation?
No.
Okay, perfect. Checking this side. Okay. Let's take a look inside of them. Nice and clear, not red. Looks like you're in really good shape so far. Do some hearing tests. Starting out with a tuning fork. I'm going to hit this, put it on the top of your head, and I want you to tell me if you hear it more left, right, or both. Left, right, or both?
Both.
Equally.
Ish.
Let's try one more time. Left, right, or both equally. That's my mistake.
Both equally.
Perfect. Can you hear this in the back here?
A little, yes.
Tell me when it goes away completely.
No.
Can you hear it there?
I can.
Great. Same thing on this side. Tell me when it goes away completely.
Now.
Can you hear it there?
I can.
And make some really soft sounds now next to your ears. And just tell me left, right, or both.
Left. Right. Left.
Mm-hmm.
Right. Both.
Okay, perfect. I'm going to whisper something in your ear. I'm just going to close this one and tell me what I say. Green.
Green.
Lemon.
Lemon.
Apple. Apple. Okay. And this side. Purple.
Purple.
Banana.
Banana.
Door.
Door.
Okay, wonderful. So it sounds like your hearing's good. No issues, right?
Right.
All right. Let's move on to your mouth here. And how often are you going to the dentist?
I just had a cleaning last week.
Okay. And they didn't see any problems in there?
I had a few fillings, so I got them filled.
Okay. And fillings are settling in okay? No bite issues with them?
Everything is great.
Okay, wonderful. So I just want to look into the back of your throat then. So I'm going to have you open up and say ah. Very good. I'm just taking a look at your teeth. And those fillings look great. Very good. Okay, you can relax. I'm going to give you something really small to taste here, and I just want you to put out your tongue a little. Okay, and what do you taste?
Cherry.
Cherry's perfect. Definitely in the berry family somewhere there at least. So that's great. So you can differentiate sweets from sours and salties. Can you use the tongue on the inside of your mouth to just push into my hand? Okay. And this side. Can you stick your tongue out and move it side to side? Good. Good symmetry there. No drooping. As long as I'm having you make some funny faces, can you puff your cheeks out for me and hold them? Okay, and smile for me. Perfect. Raise your eyebrows and close your eyes really tight. Don't let me open them. Good. I'm going to have you open and close your jaw for me. Okay, good. No clicking. One more time. Good. Just feeling those muscles there. Any pain or discomfort with opening the mouth?
Just a little tender, but it's fine.
Tender, okay. Tender when I touch or when you do it?
When I do it.
Okay. Has that gotten worse over time, or do you clench your jaw at night, do you know?
I clench my jaw at night.
Do you wear a retainer?
I don't.
Maybe next time you go to the dentist, ask them about that, or you can buy it over the counter and mold it yourself. Just get them offline. That will really help with at least the impact on your teeth, because over time, teeth will grind down and fracture a little bit with that grinding, okay?
Oh, thank you for letting me know.
So I just feel here, I'm going to feel for the lymph nodes. Shrug your shoulders for me, please. Okay. While you have them up, I'm going to push down. Don't let me push down. Okay, and relax. Turn your head against my hand. Don't let me push you. Good. And this side. Push against. Perfect. Push against my hand forward. Good. And pull back. All right, so the neck muscles are all really strong. Do you ever have issues with tension in the shoulders?
I do.
Yeah, they feel very tight. Definitely yoga, stretching, chiropractic, that type of thing, massage. So that looks good in the face. I'm just going to move down to the body now. Feel your joints here and just relax. Just feeling for any crepitus, any popping, clicking. Side. I'm going to have you make a couple of motions for me. I want you to lift your arms up from the side. Any pain with that?
No.
Can you turn them in and clap them up? Any discomfort there?
No.
Okay. Down, back, behind you like that?
No.
Okay. And then up and down here. Very good. I want to test a couple of those things with your strength. You have good range of motion though. So arms up again, and don't let me pull you. Don't let me push. Okay, up like this, and test the shoulders. Don't let me push you down. Don't let me pull you up. And with the hands, can you put them back? Don't let me pull. Push against me. And then just the fingers, the thumbs up there. Strong, strong. Feet, hands out like this. Don't let me close them. Okay, and hands nice and tight, closed, and don't let me open. Very good. Okay, you can go ahead and relax. I'm going to do a bit of upper body sensation. So like I did on your head, if you can feel it, but I'm going to do it with a really light cotton wisp like that. So I'm going to do your face and your arms, and I want you to just say yes when you feel it, and keep those eyes closed so you can't tell when I'm touching you.
Yes. 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 Yes.
Did that feel the same side to side?
It did.
This and this? same?
Yes.
Okay. Maybe down to the arms. Say yes when you feel it.
Yes. 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 Yes.
Turn the hands over for me. Perfect.
Yes. 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 Yes.
Good. And on the other side.
Yes. 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 Yes.
Okay, great. And that felt equal side to side like that?
It did.
All right, I'm going to do a bit of a rough point versus the soft point. Do you feel the difference between that and that?
I do.
Okay, so close your eyes and just say sharp or dull.
Sharp,
Good.
dull, sharp, 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 dull, dull, sharp,
Mm-hmm.
sharp,
Good.
dull, sharp, sharp, dull, sharp, dull,
Good.
dull.
Good. Now I just want to make sure that the sharpness sensation is the same all the way down. So I have a little bit more of a sharp edge here. So I want to just show you really lightly on your chest. And I want you to just let me know if it's same sharpness all the way down your arms, okay? Does that feel just as sharp all the way down?
It does.
Okay. Same thing on this side. Just as sharp the whole way.
It does.
Do it really lightly on your face as well, but I want to do it hard enough that you actually do feel the sharpness. Any
Yes, I do
sensation
feel
loss?
that.
Okay. No sensation loss on the way down. It feels the same the whole way.
Yes.
Okay, very good. I'm going to hit that same tuning fork, and you're either going to feel just this pressure or the vibration. Do you feel the difference?
I do.
Okay, so close your eyes. Pressure or vibration, depending on what you feel.
Vibration. Vibration. Pressure.
Okay,
Pressure.
good.
Vibration. Pressure. Vibration. Vibration. Pressure.
Okay. Next one's going to be with your hands. I have just a tweezer right here, and I have 2 points or 1 point like that. And just say 1 or 2 in a couple of spots here.
2,
Good.
2, 1, 1,
Very good. Same thing on the other side.
2, 2, 1, 1.
Very good. While I have this hand, I'm going to move your finger up or down like this. This is down, this is up. Close your eyes and tell me up or down.
Up, down, down, up,
Okay?
down, down, up, up.
Very good. I'm going to draw something in your hand. It's going to be a number. I want you to tell me what that number is. Close your eyes.
3,
Very good. And again.
3 again,
And add those two together. What do you get?
6,
Okay. And the other hand, I'm going to spell a word now.
C,
Another letter.
A,
Okay,
T,
perfect. What does that spell?
cat,
And what is a cat?
an animal.
Very good. So that not only tests your ability to feel with proprioception, but also your ability to think logically and put together letters and words and ideas. Let's test some of the reflexes in your upper body here. So just give me all the weight. There you go. Just relax. Okay, good. Side here. Over here, same thing. Just give me all the weight. There you go. open your eyes and look over there. I'm going to scrape your hand. Same thing, don't pay attention. Very good. Okay, put your arms out straight ahead of you and keep them there, and then close your eyes for me. And don't move them. And flip them over for me. And don't move them. With this finger, touch your nose. Okay, and now with this finger. Very good. I want you to open your eyes. You can put one arm down, whichever you prefer. You're going to take your pointer finger, touch your nose, and touch my finger. You can keep looking at it as it moves. Very good. And same thing with the other pointer finger. Touch my finger, touch your nose, and back. Good. I want you to, on your legs, you go back and forth as fast as you can. So all of your rapid alternating movements are intact. Let's take a listen to the heart. And just breathe normally for me, please. Lift this arm for me. Just up a little. There you go. Perfect. Thank you. Heart sounds good. Just want to quickly check the pulses here. Making sure they're symmetrical and even. They are. I'm going to listen to your lungs now, and I'm going to have you take just a regular sized breath every time I touch you. Okay. Sounds clear, no crackling. I'll be tapping here on the lungs. Please for me. Thank you. Okay, good. I'm going to put my hands like this on your chest. I want you to say 99 when you feel my hands.
99. 99. 99.
Great. For the next part of the exam, I'm going to have you swing around, and I'm going to take a look at your back. All right, Catherine, I'm just going to take a look at the back here and do the same thing with the lung sounds. So again, when you feel my stethoscope touch you, I just want you to take a normal breath. Okay, good. Do a little more tapping here. And say 99 when you feel my hands.
99. 99. 99.
Good. I want you to take a nice deep breath in. Good expansion and release. Very good. I'm just going to have you take a big breath in and hold it. And let it all out. And hold that. I'm just going to feel along your spine here. Any pain or tenderness along the spine?
No.
Yep. Checking the muscles on either side there. Again, pretty tight, the lower back and this upper back area. But other than leading to some, do you ever get headaches or anything like that?
I do. I think they're hormonal though.
Okay. All right, that seems fine. Can you turn to your right for me? Twist like this. Very good. And the other way. Good. And can you go down with your arm there? Yep, good. And on that side. And then just put your head forward, roll forward, bend the spine. Any pain or anything with that?
No.
Right, come on back up. Any tenderness on the kidneys there?
No.
And that looks fine to me. Doesn't look like there's any sort of curve in the spine, very straight. Okay, so go ahead and lay your head that way, your feet this way, and we'll continue with the lower body.
Thank you.
All right, now that I have you laying down, I'm just going to take a look at your legs. Just feeling the joints here in the hips. Any issues with exercise or pain or swelling?
No.
Okay. Checking the joints, checking for any edema. Just going to be careful around that foot. This one on this side here, or which one?
Yes.
The left side?
Right on top of the big toe.
Okay. Okay. I'm going to have you lift this leg up, straight up, and can you resist me? Any pain with that?
No.
And down. Good. And same thing on the other side. Lift leg up, resist me, and down. Okay. Can you bend this leg up towards your hip? There you go. I'm just going to move it a little bit for you. Does that sound feels okay?
Yes.
Right. Push against me. Push. Try to push out with the ankle. There you go. And pull in. Any pain?
No.
Okay. And on this side, again, I'm just going to move it, but just be gentle with it. I don't want you to hurt the foot. And is it too painful to put your foot like this?
No, it's fine.
Okay. And can you give me a push against me and pull against me? All right. Very good. You can relax that. So I'm just going to do that really sharp roller pinwheel down the legs. You should be able to feel it through the leggings, but let me know if you can't. Can you feel the sharpness there?
Yes, I can.
Okay, and just tell me if it feels the same sharpness all the way down. Does that feel the same all the way down?
Yes.
Onto the foot, the same?
Yes.
Okay, same thing on the side. Does it feel the same sharpness all the way down?
Yes.
Okay, good.
Yes.
And I'll just be careful of that foot there. Just want to feel the temperature here. It is a little hard to feel through the leggings, but any cold, super cold feet or tingling in the feet? Any sensation issues?
Just a little bit in the one that I had the cut in.
Okay. And that's only been since you injured it though, right?
That's correct.
I just want to take one last look at your belly here while you're laying down, and then I think you're all set. I'm just going to lift this up just for a second. I just want to look to see if there's nothing good. No moles or lesions I'm worried about. Nice and flat. And put that down. Let's just take a listen. Okay, good. Good. Bowel movements heard in all 4 quadrants. Same thing, I'm just going to do a couple light taps. I'm going to push just a little bit harder now. Let me know if there's any discomfort or pain. All that's okay?
Yes.
I'm just going to feel for your kidneys under here. Can't palpate. And so there's no swelling. That's good. All right, go ahead and sit up for me. I just want to get the reflexes in your knees and you'll be good to go. So, and I'm going to have you slightly open your mouth and put this under your tongue. You can just hold it there. While you do that, I'm just going to take your pulse. Okay, good. Okay, 97.6, very good. All right, I was also taking a look at your respirations there as we did that, and I would say that they're very normal, so we'll take a look after we do some physical activity and compare. Okay?
Okay.
I'm going to go ahead and get the blood pressure reading.
Mm-hmm.
Do you have an arm preference?
No.
Okay, go ahead and stick this arm out for me. Just gonna make that a touch tighter. Is that okay?
Yeah.
Okay, great. And just gently put your hand down there. Nice and relaxed. What we want to do is just get a baseline reading. That way we can see if you're actually having physiological symptoms in addition to that feeling of heart fluttering. So it's just going to get a little bit tight on your arm. Should feel uncomfortable, but it shouldn't hurt, so let me know. Okay. This is 128/65, so that's very good pressure. So I'm just going to start going head to toe now. I'm going to do a full assessment before we do the activities. That way, if anything else pops out, I'll make sure to pay attention and retest that thing after the activities, okay? All right. I'm just going to take a look at your skull. Just palpate. Is there any pain when I'm touching you here?
No.
Okay, feeling for any lumps, bumps. I'm going to do a quick check in a couple of places. Looking for any signs of trauma, in case you perhaps hit your head while you're running. If you fell and got a concussion, you may not always remember the incident, but that could affect how you're feeling. Everything looks good. Okay. Right, I'm just looking at distribution of your eyebrows. They're even, symmetrical. Your eyelashes are full. Can you look down for me? And up. And side to side. Any dizziness with that movement?
No.
Did you lose any vision or have any blurriness while you're doing that?
No, I didn't.
Okay. Go ahead and look at my finger here. I'm going to move it in a couple different directions. Follow it with just your eyes only.
Okay.
Okay. Any dizziness or double vision with that?
No.
Okay. Go ahead and look straight at my finger. And now look past me at the wall. And back at my finger. And follow it all the way in. Very good. Okay, I'm just going to take a look in your eyes with the light.
Yeah.
So look straight ahead. Just ignore me. I'm just going to check to see if your pupils are reacting. Very good. I'm just going to check for a red reflex. So just again look straight ahead. I'm going to check the other side. Good. And it reflects in the same place. Excellent. Okay. Just going to move on now to your sinuses. Any pain when I touch here?
No.
Anybody here?
No.
Okay, good. Look into your ears. Have you been having any trouble hearing?
No.
Okay. Good. I'm just going to make some soft noises next to your ears. Close your eyes for me, and then tell me where you hear it, right or left.
Right. Left. Left. Both.
Great. Okay, that sounds great. So your hearing seems to be totally intact. If you had more hearing loss, any hearing loss symptoms, you could just come in another time, let me know. but everything looks good. And take a look at your nose and you gently put the tip up. And when you run, are you breathing through your nose generally or through your mouth?
Usually through my mouth.
Okay. So do you find that it gets hard to breathe through your nose sometimes?
Sometimes, yeah.
Okay. Have you ever suffered do you run inside or outside?
Both.
Okay. Do you feel like it's worse outside or inside? Or does it seem the same?
Pretty much the same.
Okay. Go ahead and breathe in. And on this side. Okay, definitely a little occlusion on that side. So it could be that when you start running faster or having more aerobic behavior, that you're not actually taking in as much oxygen because one of your nostrils is occluded. But since you breathe through your mouth, that may not be the issue. So we'll just keep an eye on it.
For sure.
Clench your jaw for me. Good. Okay. One more time. Good. All right. I'm going to test some sensation in your face. Make sure you're feeling things symmetrically.
Okay.
So I'm going to touch you and have you say yes when you feel it, and then I'll ask if it's the same on both sides, okay?
Okay.
All right. So
Yes. Yes.
was that the same on both sides?
Yeah.
Okay.
Yes. Yes.
And the same there?
Yeah. Yes. Yes.
Same?
Mhm.
And you feel that on the tip of your nose?
Mhm.
Okay, excellent. So I'm just going to put some gloves on to look into your mouth. Okay. So open up for me. Can you say ah? Okay. Tongue looks good. Your uvula went up. And do you have any, go ahead and close. Have you had any issues feeling dryness in the back of your throat?
No, not really.
Okay. Didn't look red at all, but sometimes when we're taking in more air, we can irritate our throat as well if you're trying to get breath in. Okay. I'm just going to feel your lymph nodes for any swelling while I'm here. Can you shrug your shoulders for me? Okay, good. I'm going to check the ones under your arms as well. Okay. Didn't feel anything there. So that's good. Definitely seems to be like if you're having some trouble catching your breath. I'm not thinking it's coming from sinuses or from any sort of tonsil swelling or anything like that. Alright, so I'm just going to go ahead and move down to your chest, and that's going to involve me listening to your heart and your lungs, okay?
Okay.
I'm just going to start out with your chest on the front, so go ahead and take a deep breath for me. One more. Can you lift this arm for me? Take a deep breath there. And one more. Okay. Any pain or discomfort on that side?
No.
Okay. Go ahead and take a deep breath. Okay, good. Sounded a little bit less clear than I'd like, but nothing that would suggest that you had pneumonia or any sort of water in your lungs, but it definitely could be a little bit congested. So I definitely want to do some further tests as far as breathing goes, but we'll also recheck this after exercise. So now I'm just going to listen to your heart, and you can just go ahead and relax, and you don't need to breathe or anything special. You can breathe normally. That all sounded normal to me. So again, we'll recheck it, but it sounded okay for now. I'm gonna have you swing your legs to the side here. I'll move my things out of the way. I'm gonna get the back of your lungs. Just go ahead and swing your legs outwards. That's perfect, just like that. So again, just deep breath every time if you feel me touch you. Okay. Yep, same thing, just a little bit of cloudiness in the lungs, but nothing I would be super concerned about, but something I definitely want to check again. Okay. So I'm going to go ahead and check for lung capacity. So go ahead and breathe out all your air. Take a nice deep breath. And you can let it all out again when you hit it up. All right. Excellent lung expansion, equal and symmetrical on both sides. I'm gonna check for some tenderness here. Does that hurt at all?
No.
That hurt at all?
No.
Okay, that's good. His kidneys are probably fine. Okay, you can go back ahead and swing back around for me, please. Just going to check for your reflexes on the top half of your body before we move down to your lower.
Okay.
Alright, so go ahead, go nice and floppy, just let me take all your weight. Okay. Good. Good. And the same thing on this side. Give me all your weight. Okay. Go ahead. Just let me take your weight like this. Yep, exactly. Good. Good. Okay. Last thing I want to do is just some range of motion and some strength testing to make sure you're not experiencing weakness anywhere else in your body, okay? We're going to start with your hands. Go ahead and you flip them up like this. And can you go down? Can you go in and out? Okay, and I'm going to do that with some resistance, so hold your hands up like this. Don't let me push you. There we go, perfect. All right, now I'm going to have you go ahead and put your arms up like this. And can you go them down? Extend, okay. And I'm going to do the same thing with just some pressure. Resist me. Resist me. Good. And up like that. And down. And can you resist me? Very good. Okay. No pain or issues with that?
Not really.
Are you feeling any aerobic discomfort after that?
No.
Okay. It's probably not, threshold's probably not high enough to get your heart going.
Mm-hmm.
Okay. All right. And I'm just going to have you twist on the table if you can. Good. Any issues with your spine?
No.
Just look that way for me, please. I'm just going to take a look at your spine. Any pain when I touch here?
No.
Okay. All right. Looks good. Okay, last thing I want to do is just quickly check the sensation of your upper arms.
Mm-hmm.
So again, just say yes when you feel it and close your eyes.
Yes. 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 Yes.
Good. This side.
Yes. 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 Yes.
Good. Okay. Can you go ahead and do this with your hands, moving your... Good. Like this. Don't let me pull you open. Good. Okay. Go ahead and set that down. So I think that, we don't need to go into any more neurological exams because you seem to be intact. You're not having any memory loss with the fatigue. So let's go ahead and move down to your lower extremities, do some strength and range of motion, and then we'll go ahead and do the physical the physical test, okay?
Sounds.
If you can just go ahead and uncross your legs for me. I'm just going to start with reflexes. Good. Relax. Good. On the side, that's nice and loose. Just completely relaxed. Exactly. Good. Nice, relaxed. Okay, good. Not quite as strong of a reflex on that right side, but is that normal for you, or have you always had stronger reflexes?
I'm not really sure.
Okay, we'll keep an eye on it, just in case. Next thing I'm going to do is just the Babinski. So it's a little uncomfortable. I'm going to scrape this thing on the bottom. Just looking for your toes. Okay, good. Okay, they go in, so that's normal. So while I'm down here, I'm going to do some range of motion. Can you go ahead and lift this leg up towards me and put it back down? Any pain there? Do it a little against resistance. Push me. Pull me. Good. And on this side, up and down. Push me away. Pull me towards you. Good. Your thighs, can you lift them up against my hands? Good. Excellent. And can you push them out? And push them in. Good. Last thing I'm going to do with your toes, just scoot back for me. And can you push your foot down? And pull it back up. And again, resistance. Pull it back up. On this side. And back up. Okay. Excellent. Okay, you can go ahead and relax. And no discomfort there as well. Okay, last thing I'm going to do is just that same sensation. So just tell me yes when you feel it. And just uncross for me, please.
Yes. 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 Yes.
Okay.
Yes. 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 Yes.
Okay, excellent. All right, so everything seems to be doing okay. I'm a little bit concerned about that cloudiness in your lungs, so I do want to do the physical test, and it's just going to be involving you doing a few push-ups. If you did push-ups, how many would be normal for you?
Maybe like 20.
20? Okay. So I'll have you do 20 push-ups, just something that will get your heart rate going, challenging enough, but not so much that it might actually trigger some sort of issue. And then we'll go ahead and just retest those lungs, okay?
Okay.
Okay, great. Okay, Jeremy, so how are you feeling now? A little out of breath?
Yeah, a little.
Okay. I'm going to go ahead and feel your pulse rate while I watch your respirations. Okay. Yeah, your pulse is a little bit higher, but that's to be expected. I wouldn't say it's in abnormal range, but your respirations, it does seem like you're having a little bit more trouble breathing. I'm going to go ahead and listen to those lungs again. I know it might be a little difficult right now, but try and take a deep breath every time I touch you. Just gonna get underneath here. Okay, the other side. Good. Okay, I'm just going to check a couple of spaces in the back. Okay. So I want to go ahead and do one more test because I am still hearing a little bit of occlusion in those lungs, a little bit of wheezing when you breathe in. And it's going to involve you just breathing into a tube as hard as you can. I'm just going to measure the amount of air you're actually expelling out of your lungs, and then may refer you for tests after that if I'm not seeing a result I'm happy with. Okay.
Sounds good.
So I'm just going to clean this off. Okay, so go ahead, take a deep breath in, push all your air out, just clear out your lungs. Okay. I want you to hold this, take a deep breath in, and then blow out as hard as you can, okay? Okay. So that's going to log into the computer. I'm going to go ahead and look at the results really quickly, and I'll be right back.
Okay.
So I'm basically going to start from your head and work my way down to your toes. And if anything bothers you along the way, just let me know.
Yeah, okay.
Okay, so first thing I'm going to do is just palpate your head.
Yep.
Any pain or tenderness here?
No.
All right. I'm going to take a look with my light here. What I'm just looking for is any blemishes on the scalp.
Yeah.
Have you been in a wooded area at all recently where you may have gotten a tick bite?
I don't think so.
Okay. Sometimes the tick bite bullseyes like to hide in the hair.
Yeah.
Okay, yeah, the hair feels good, nice and thick and evenly distributed. Not too dry or brittle. Okay, I'm just going to use this to just check the hair in a couple of places.
Yep.
I'm just looking for any infestations or lice. Any itching in the scalp?
Yeah, a little.
A little? So is based on, do you feel like it comes and goes, or is it more like a dry skin?
I think it's more like a dry skin from all the shampoos that I use.
And how often are you washing your hair?
About 2 to 3 times a week, I would say, like after 3 days.
Okay, I would maybe consider a scalp conditioner. There is just a little bit of dryness, but
Yeah.
also not atypical this time of year. All right, that looks fine.
Might be even because I'm dyeing my hair.
Coloring your hair?
Yeah.
Okay, and do you do that yourself?
No, actually, my sister does.
Okay.
She's a hairdresser.
Okay, so you have a professional doing it. So I trust their judgment to know if when your hair does not feel healthy anymore.
Yeah.
To me, it doesn't seem too brittle or there's not a lot of breakage. So
Yeah,
I think
it
you're
always
okay.
takes just 1 or 2 days after it is like colored. So
Okay.
yeah.
Well, it looks good to me. I didn't notice. So
Yeah.
good job for your sister. I'm just gonna take a light and look now in your ears. And you said no problems hearing, right?
Just a little, I would say. I sometimes struggle to hear when people are talking in like restaurants.
Okay.
Yeah, like,
I'll take a look inside. Any pain when I press on here?
I wouldn't say so.
What about right here?
No.
Okay. Let me take a closer look here. I do see a little bit of buildup, but no blockages. I do see a clear line of sight
Okay.
to that inner ear. Check the other side. Again, any pain here?
Wouldn't say so.
Okay. And then here?
No.
And that side looks completely clear.
Okay.
No redness, no swelling.
Yep.
I'm wondering if you're having maybe just a little bit of allergies with the stuffiness. You said it's kind of constant, right?
Yep.
Okay. Any pain here then?
No.
What about here?
No.
You can press on your tear glands. Any discomfort?
No.
Okay. Taking a look at your face. Let's take a little closer look. Look straight ahead for me, please. I think that'd be perfect. Okay. And the pores look normal. Do see a couple of blemishes, but again, not uncommon for your age. Are they painful? Do they hurt?
Only when I'm trying to squeeze them.
Ah, okay, so
But
yes.
otherwise, no.
Okay, well, I definitely recommend just putting a little bit of topical treatment on them when
Yep.
you get breakouts and trying not to squeeze because that can definitely scar the skin.
Yeah, I know. I learned it the hard way.
And do you do any shaving of the baby hairs on the face or anything like that?
No.
Okay, because that can also be irritating sometimes. So it looks very good and very healthy. Just feel for temperature here. Even temperature. I'm just going to go all the way down here.
Okay.
Do you have any issues with hot flashes or feeling cold, circulation issues?
I don't think so.
Okay. Feels good to me. I'm going to take a look into your eyes now. So first thing I want you to do is just look straight ahead. I'm going to shine a bright light. I'm going to go right in the middle here. Good. Take a look at the tip of my pen
Okay.
and just follow it everywhere it goes. Any double vision right now?
No.
Okay, just follow it with your eyes. Any double vision throughout that?
I wouldn't say so.
Okay, perfect. I want you to look way off into the distance,
Mm-hmm.
and then I want you to look at my pen. Now back to the distance, and back to the pen, and follow it in. Great. Next thing I'm going to do is check your peripherals. So again, stare straight ahead,
Okay.
and I'm just going to come at you with my fingers here, and I want you to tell me when you see them wiggling.
Okay.
Just keep staring straight ahead.
Okay, now. Now.
Good.
Now.
I'm going to give you a card. I just want you to cover one of your eyes. Pick whichever one. With the card, sorry. Like that.
Yeah. Oh, like this.
Mhm.
Yeah.
I'm going to cover my eye, and I want you to do the same thing. Tell me when you see my fingers
Yeah.
wiggling.
Now.
Okay,
Now.
good.
Now.
Switch eyes for me, please.
Okay. Now.
Mhm.
Now.
Good.
Now.
Perfect. While I have this, I'm going to have you just read from about 24 inches away.
Okay.
And do you use any reading aids, glasses, contacts, things like that?
Yeah, I'm actually, I don't know if it's short-sighted or not, but basically I do not see well into the distance.
Okay, so that would make you nearsighted, yes.
Yeah, nearsighted.
So can you see this right here?
Yeah, I
I'm
would
gonna-
say so.
So I'm going to point at a couple letters, and just, can you read this line for me, starting with this letter?
C, F.
Perfect. I'm going to have you jump down to this line.
Okay, it's E, B, D, Z, O.
Okay, and cover one eye with your hand. I'm going to have you read this same line backwards. This one here.
Yeah, okay. O, Z, T, B, E.
Good. Cover the other eye. And read it forwards.
Okay, E, B, D, Z, O.
Perfect. So yeah, I would say you missed a couple in there, but very, like one. So no issues with the nearsightedness. Just check your pupil size here. And that's about normal, between 3 and 4. Okay, I've got some colors here. And check your color blindness. Can you tell me what color that is?
It is purple.
And what color this?
Yellow to green.
Yep. And if I put these two colors together, what do you see?
Green.
Okay. And what about this one alone?
That's blue.
Perfect. No issues with color then. Just going to look pretty deeply in your eyes now.
Yeah.
And just relax. That reflex intact on that side. Good. I don't see any visual issues with your eyes. Maybe a little dryness on the surface. You can try some over-the-counter eye drops
Yeah.
and see if those are helpful to you at all.
Yeah.
You said no issues with your smell, right?
No.
Okay, I'm just going to look gently up the nose. Okay. A little bit of swelling and redness in there. Can you breathe in for me? Okay, and on this side. Okay, a little more occlusion on that right side as well. And take a look into your mouth. So just open wide for me. And you say ah.
Ah.
Okay, uvula rises, teeth look even. You stick your tongue out.
Okay.
And move it side to side. Okay. I'm going to have you make some funny faces. So
Okay.
smile for me. And lift your eyebrows up. And can you hold them up there? Good. And close them really tight. And can you keep them closed? Good. Can you puff your cheeks out for me? And don't let me push them in. Excellent. So complete symmetry there as well. I'm not worried about any drooping or stroke-like symptoms. I wanted to do a little bit of a hearing test. I'm gonna hit the tuning fork, put it in the middle of your head. Let me hear it. Let me know if you hear it more left, right, or both.
Okay. I would say I probably hear it a little bit on the right side.
Okay. Let me try it one more time. Do the same thing, left, right, or both.
Again, right side.
Okay.
Like,
So,
I even feel it on the left side, but it's better on the right side.
so that's telling me there was a little bit more occlusion in this and swelling in this left ear as well. So I think that that could be playing a role in some of your uneven hearing.
Yep.
I'm gonna hit this, put it on the back of your head here. Tell me when you can't hear it anymore.
Okay.
Can you hear it there?
Yeah.
Great. Same thing on the other side. Okay. While I have this out, I'm going to do a bit of vibration sense. So I'm going to take your hand. I want you to close your eyes and tell me if you feel pressure like this or vibration. You feel the difference?
Yeah.
Okay, tell me pressure or vibration.
Yep.
Pressure or vibration.
Vibration.
Okay, pressure or vibration.
Vibration. Pressure.
Good. The other side, please.
Vibration. Little vibration. Pressure. Vibration.
Perfect. I want you to keep your eyes closed. I'm going to make a slight puff of air, and I want you to tell me left, right, or both.
Left. Left. Right. Left. Left. Left.
Good. Okay, so the hearing in the left ear is not too bad. It's just a little less than the right.
Yeah.
Okay. All right, I'm going to go ahead and feel some of your lymph nodes now. So just relax. Let me know if anything's tender. Can you shrug your shoulders for me? I'm just going to get in here. Okay. There's just a couple under here. All right, not feeling anything. Can you turn your head all the way that way, as far as it can go?
Yeah.
And don't let me pull it back.
Okay.
Keep it there. Good. And all the way this way, and don't let me pull it back. Good. Can you push your head forward, turn to the front,
Like this?
just like
Okay.
that, and push your head forward against
Okay.
mine,
Yeah.
and pull back against me here. All right. And can you shrug your shoulders against me?
Yeah.
Arms up like this. Don't let me pull. And push me away. Keep your arms back like this. Push me away.
Yeah.
Can you put your hands like this?
Yeah.
And don't let me pull. And then put your hands up like that. And don't let me pull. No issues with strength then. That seems pretty strong. Last one, just up like this. Keep there.
Yeah.
Keep there. Good. Can you put your arms out like this?
Yeah.
And close your eyes. I'm going to tap on your hands. Don't move your arms. Okay, you can open your eyes. I'm going to draw in your hand a letter, and I want you to tell me what that letter is.
Okay. Say
Perfect. And now it's going to be a number.
was 3.
Correct. Try the other side. I'm going to do another number here.
Okay, it was 1.
Okay, and when you add 3 with 1, what do you get?
4.
Okay, great. And last letter here.
C.
Perfect. I'm going to ask you a couple of logic questions.
Mm-hmm.
If you were walking along and you found a crying baby on the street, what would be the thing that you would do first?
I would, it would depend how small it is. Yeah, I would probably like count to it and ask where is their parents.
Perfect. And if I were to tell you that, if I were to say a sentence to you saying, save your money for a rainy day, what would that mean to you?
Oh, that I shouldn't spend all my money.
Perfect. All right, so logic is in place. You would make good decision making, everything like that. And can you tell me where we are right now?
And we are in office.
Okay.
Doctor's office.
And what did you have for breakfast this morning?
I think it was a cookie.
A cookie?
Yeah,
Okay.
Belgian milk cookie.
Well, that's maybe not the healthiest of breakfasts.
Yeah, I do not eat it often, but
it's special treat?
Yes.
Okay. Well, other than the fact that that's very high in sugar, it's good that you were able to remember that. What was your favorite subject in primary school?
Everything.
You liked a lot of school, like school when you were younger.
Yeah.
Okay. So
I
you're
was a nerd.
a nerd.
Yeah.
So your long-term memory is good as well. And can you tell me who the current Queen of England is? Do you know the first name?
Elizabeth.
Perfect. So you also have a good sense of history and retaining information. So I'm going to move on down to your arms now. I'm going to do some sensation touch. Actually, I'll do a little bit on your face as well.
Okay.
But I have a bit of a sharp and dull tool. So
Okay.
you feel the difference between that and that?
Yeah.
Okay, so I'm just going to press on your face in a couple of places, and then I'll move my way down your arms and just say sharp or dull.
Yeah.
Okay, close your eyes for me.
Dull.
Mm-hmm.
Sharp.
Perfect.
Sharp. Dull. Dull. Sharp. Sharp.
Just going to lift this up.
Dull.
Mm-hmm.
Dull. Sharp.
Perfect. On the other side.
Dull.
Mm-hmm.
Sharp. 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 Dull.
Great. So you're able to sense even slight variations really well, so no problem with sensation, correct?
Yeah.
And then does this feel the same on both sides?
Yeah.
And this feel the same?
Yeah.
And this?
Yeah.
Okay, so I'm not worried about any sort of neurological deficit in the sensation
Okay.
space.
Yeah.
All right, I'm going to take a listen to your heart and your lungs.
Yeah.
You can just relax and breathe normally. I'm going to get underneath here, okay?
Yeah.
Okay, heart sounds good. Take a deep breath for me. One more. Okay. I'm going to put my hands on your chest. When I touch you, I want you to say 99.
99. 99. 99. 99. 99. 99.
I was just listening for some tactile fragmentus there. Tapping on your chest really briefly. You said no problems with feeling short of breath or anything like that?
Yeah.
Okay, good. Yeah, that sounds okay. I'm going to have you turn around. I'm going to do a quick assessment on your back, all right? All right, now that I have you here, I'm going to do the same thing on the back. Tell me 99.
99. 99. 99. 99.
Okay, that sounds good. Taking a listen. Right. Sounds really clear. I think that any of that trouble breathing is really coming from your nose and your sinuses. All right, I'm going to do the same thing, tapping on the back. Just hitting my own finger. Okay. I'm going to press on the spine here. Any pain?
No.
You said maybe a little bit in the low back you had issues.
Yeah.
Any pain when I do this?
No.
Okay, so it's not the kidneys. Just feeling there's definitely a lot of tightness, these muscles right here,
Yeah.
especially down here. I'm gonna move you slightly. Any pain when I twist you like that?
No.
Okay, and come the other way. Any pain there?
No.
Okay. I think you've just got some real tight muscles down here. Stretching, massage, all will help.
Yeah.
But your posture looks good overall. And there's no pain on the spine itself, right?
No.
And can you, I'll just use my light here. Can you feel this all the way down?
Yeah, I can.
Okay. Just looking with my light here for any swelling I might have missed. I think think it looks okay. Can you bend your neck down
Mm-hmm.
as far as it can go? Any pain up here?
No,
Okay, there's really a lot of tightness right here
I just feel it in my elbow.
in your elbow.
Yeah,
Which one?
right one.
Okay, so that may mean that there's like a bit of a nerve out of alignment here, or a little pressure on the nerve that's sort of shooting down,
Yep.
connected. So go ahead and lift your head back up. Don't want you to be uncomfortable. Just feel here. Does it hurt at all when I press like this?
No.
Okay. So what's happening is all this tension and this little bit of swelling on the neck is putting pressure on a nerve here that's shooting down your ulnar into your elbow. So again, just releasing some of that tension and that pressure is going to help with that a lot. I think maybe a massage or rolling on a foam roll or something like that. All right, go ahead and return to the front. I'm going to just finish up with your reflexes.
Okay.
All right, Kavas, let's finish up with some of these reflexes. I want to especially pay attention to that shoulder. So put your arm up like this for me. Give me the weight. Go completely limp. A little bit of a reflex there.
Yeah.
Again, give me all your weight. I see just a little one there.
Yeah.
So you're not super reactive. Yeah, not have too much reaction in your reflexes. Is that typical for you?
I would say so.
Okay. Look straight ahead. Don't pay attention to me. Look straight ahead.
Yeah.
Okay, this side. Okay. You let your jaw hang for me. I'm just going to tap like that. Okay. And then just scooch back for me on the table here so your legs are dangling. Up the other way, so your legs
the
are
other way,
dangling.
yeah. Sure.
And just another one plus reflex there. Definitely don't have too much, but a slight reaction.
Yeah.
That's okay. All right, so I'm going to take a feel in your head. So just look forward for me. And I'm just going to do a general palpation. Any pain or tenderness when I do this?
No.
Okay. What about on this side here where you have those headaches?
Yeah, right there.
Is that painful to touch?
A little bit.
A little tender?
Yes.
Does it shoot anywhere else in your head? Any radiation?
No, pretty localized.
Localized, okay. Right here.
Yes.
Anything down here?
A little bit, just a tiny bit.
Just checking through that muscle there. There's definitely some tension in that muscle.
Yeah, right there.
Your hair is very thick. Sorry if I'm pulling it all.
That's okay.
And any issues with this right side?
No, that's pretty good.
Okay. I'm going to take a look there. Just make sure there's no visual bruising or anything I can see. Just turn your head towards me slightly. Perfect. So it starts right about here.
Yeah, right there.
I don't see any bruising or swelling or redness. While I have this, I'm just going to do an overall check of the scalp. Or have I itching or flaking the head?
During the winter time.
I'm not seeing anything right now. You're just tilting your head down for me, please. Thank you. Hair is nice and healthy and thick. And doesn't look like there's any color changing. Okay, go ahead and put your head up. Just going to take a look at split ends. I'll fix that for you. Got beautiful hair.
Thank you.
No major breakage. Are you using heat on your hair ever?
Sometimes as a straightener.
Okay. It's very thick and there's not too much breakage at the end, so I think as long as you're using some sort of hair mask or protectant after, or whatever
Yes.
you're doing is working fine.
Yes, I do use oil.
Okay. Oh, perfect. Now let's just take an overall look at your face. I didn't see any injury for that side of the head, so that's leading me to believe it's either some swelling or muscle tension. So we'll keep moving on with the exam, but I will keep an eye on that. So just look forward for me. I'm just going to look at the skin itself. Have you ever had any moles or freckles, lesions removed?
Yes, I've had a couple of moles on my body that were removed because they were not looking too
Okay,
good.
so you do have a history of that. And are you visiting
Yes.
a dermatologist?
Every 6 months, yes.
Perfect. Skin looks really clear. Just a couple of freckles on the face, but they all look small and flat. Nothing to be concerned about. Eyebrows look nice and symmetrical. Hair is even distributed. I'm going to have you make a couple of faces for me.
Sure.
Just want to check the symmetry in your face. Can you smile for me? And frown. And puff out your cheeks and don't let me push them in. Okay. And raise your eyebrows nice and fine. Good. And then close them nice and tight. Don't let me open them. Good. Strength is good there. I'm going to have you open and close your jaw for me. A little bit of clicking there. Is that normal for you?
Oh, yeah, usually.
Okay.
Unfortunately.
You said you're kind of a clicky person, right?
I click a lot, yes.
Well, everyone will hear you coming at least. Just feeling that muscle. Can you do it one more time for me? Just clench. Okay. Muscle's good. Okay, and eyelashes look good as well. Any problem with hair loss there?
My eyebrows, no.
No. Okay. Look into your eyes, so just look straight ahead for me. I'm just going to shine a light and just ignore it. Pupils react. Shine right in the middle here and come in. Okay. Go ahead and stare at the tip of my pen. Just, is it double vision at all right here?
No.
Okay, follow it everywhere it goes, just with your eyes. Don't move your head. Any double vision with this?
No.
Any blurriness?
No.
Okay. I want you to look at the pen and then look past me at the back wall. Ignore the pen, ignore it. And then look at it. Good. Okay. And look at the pen now and just follow it in. Good. Everything reacts perfectly with that. And look a little closer into the eye. So I'm going to get a little bit close here. So apologies. Just stare straight ahead though. Okay. Same thing on the other side. All right, that looks fine. Got a little eye chart for you here, and you said that you can see fine with the contacts, right?
Yes.
So both distance and up close, right?
Yeah.
Okay. So I'm going to have you read this line here with both eyes.
EPTZO.
Great. And can you cover one eye and read it backwards for me, please?
OZTPE.
Okay, cover the other eye. And try this line down here. See that one?
CFDHJ.
Perfect. Okay, no vision problems. Just check the pupils, and you're at about a 4. There's a little bit low light in here, so that's totally normal. I'll give you this card. I want you to cover one of your eyes. You can choose which one to start with. I'm going to cover that same eye, and I'm just going to have some fingers coming into view. Keep staring at me, and just tell me when you see it. Say yes when you see it.
Yes.
Okay.
Yes. Yes.
Switch eyes for me, please.
Yes. 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 Yes.
Okay, and now with both eyes, I'm going to do the same thing, but just stare at my nose and tell me which one's wiggling, left or right.
My left. Left. Both.
Mm-hmm.
Right. My left. Both.
Good, very good. Same thing, just tell me how many fingers I'm holding up.
2.
Okay,
2.
good.
1. 4 in total.
Perfect. Okay, so no problem there. And while I'm having you do some math, I'm going to ask you a couple of logic questions.
Okay.
So, can you tell me what you had for breakfast this morning?
Cream cheese and the toast.
Okay. And can you tell me who the first president of the U.S. was?
George Washington.
Perfect. What was your favorite subject in school?
Mathematics.
So your short-term memory, your long-term memory, and your information gathering seems to be totally intact. If you were to find a crying baby on the street, what would you do?
I would call 911.
Okay.
Call the police.
So your decision-making seems to be intact as well. I'm going to have you add up some numbers for me. So what's 5 plus 7?
12.
Okay, and plus 7 again?
19.
Perfect. Can you spell cat for me?
C-A-T.
Okay, and what is a cat?
An animal.
Great. So all of that seems to be intact. You're thinking, you're able to process that information correctly. I'm going to show you a couple of cards here, and I just want you to tell me the shape and the color. This is also going to test some color blindness here. So tell me the shape and the color.
It's a green heart.
Okay.
Purple triangle.
Very good.
Yellow star.
Excellent. Just do one more.
That is a black oval.
All right. So Luna, looks like your thinking is totally intact. Your vision and your color is intact. I'm just going to take a look into the nose. I'll put some gloves on for that. You said no trouble smelling, but a little bit of swelling and stuffiness, right?
Yeah, all the time.
Okay. Now have you breathe in for me? Okay, a little bit of occlusion there, definitely. So let me take a look into that nose. Just tilt your hat for me, please. There's a bright light. Definitely can see that swelling. The left side is worse than the right side. It down. There's no redness though. Doesn't look like you said, it's probably allergies. Doesn't look like there's any redness or chafing in that way. I would guess it is just a little bit of that histamine reaction. I'm going to give you something to smell. So just close your eyes for me, and I'm going to give you a scent.
Mm-hmm. It smells like lavender.
Mm-hmm. Same thing here, close your eyes for me.
Coffee.
Mm-hmm. Okay. That's great. Let me just palpate really quickly. Any pain up here?
No, no pain.
Just a little discomfort with the swelling there. Any pain in the sinuses here?
No.
What about right here?
No.
I'm just going to feel the face. Let's check the lymph nodes while I'm here. Can you shrug your shoulders for me? Okay. I don't feel any swollen lymph nodes again. Another good sign that it's probably allergies and not illness. Just take a quick look at the ears. Any pain when I touch the ears?
No.
But on that right here.
No.
Okay. Go ahead and take a look in them. Nice and clear. They look great. Yours look really clear. So whatever congestion you're having in your nose does that seem to be bothering your ears at all? Are you having any hearing loss, anything like that?
No.
Let's just do a couple of tests. I've got a tuning fork here. I'm going to hit it and put it on the top of your head. I want you to tell me if you hear it more left, right, or equally.
It's pretty equal.
Okay, perfect. I'm going to put it on the back of your ear here. Tell me when it goes away, when you can't hear it anymore.
No.
Can you still hear it there?
Yes.
Same thing on the other side. Can you hear that?
Yes.
Tell me when it goes away.
No.
Can you hear it up here?
Yes.
Right. So your bone conduction is a little less than the air, and that's perfect. Whenever you close your eyes, I'm going to make some soft sounds next to your ears. Tell me left, right, or both.
Right. Left. Right. Both. My right.
Mm-hmm.
My left.
Okay. Perfect. Perfect. Okay. I'm not worried about your ears or your hearing at all. They look great. So let's just take a look at the mouth, finish out the face. Can you open up and say ah for me? Okay, palate rises. I'm just going to quickly take a look at the teeth here. You said you go to the dentist often. They look great.
Yes.
And you checked out that jaw. I'm just going to give you something to taste. So I'm just going to give you a little bit of spray here. What do you taste?
That's like citrus, lemon.
Yes, perfect. So all of the senses are intact. I just want to check out your sensation now in the face. Just going to sanitize my hands. Great, so I've got a little bit of a soft touch there. Do you feel this on your chest? Does that feel soft to you?
Yes.
Okay. Close your eyes and just say yes when you feel it.
Yes. Yes.
Does that feel the same on this side and this side?
Yeah. Same sensation.
Mm-hmm. This side and this side feel the same?
Yes.
Okay.
Yes.
Feels the same. And you felt it on both sides?
Mm-hmm.
Okay. How about that? You feel
Yes.
that? Okay. I've got a slightly sharper side here. I'm going to do the same thing. Just tell me if it feels the same roughness on both sides. Does that feel as rough as that?
Yes. Yes.
And that feels the same.
Yes.
I'm just going to do a little puff of air. Just want to make sure you can feel that.
Yes. Yes.
That's fine. Open your eyes for me. I'm just going to do a little bit of a reflex here. Yeah, good. Good blink. Good blink. All right, lastly, I just have this, it's much sharper, so just give me your hand. It's much sharper on that side and dull on that side, right?
Mm-hmm.
So I want you to just close your eyes and tell me sharp or dull.
Dull.
Mm-hmm.
Sharp.
Good.
Dull. Sharp.
Mm-hmm.
Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull.
Okay. And does this feel cold to you?
Yes.
Cold on that side?
Yes.
Same here. And here.
Yes.
And here. And here feels the same cold?
Yes. Same cold.
Okay, perfect. I'm going to move down to your neck now, Luna. So I felt a little bit of those lymph nodes before, but I'm just going to have you, can you swallow for me? Good. Swelling there. So there's some tension in your shoulders, right?
Yeah, usually.
You can feel the muscle tightness. I'll take a closer look at that on the back, but I just want to have you move your shoulders for me. Can you move them around, shrug them up for me? Can you push against my hands, resistance? Okay. This way, turn towards me. Turn your head towards my hand.
Okay.
Don't let me push. There you go. And this side, don't let me push. Push forward. Push back. Okay, good. And any tension in the neck when I did that?
A little bit, maybe. Not too much, no.
Not too much. More just the muscle tension and not like a sharp shooting pain down the spine.
No sharp shooting pain, no.
I feel the joints here. Got some. You're cracky in the elbows too, you said?
I'm clicky everywhere,
Okay.
yes.
No swelling though, so that's good. And the wrists. Can you make some motions for me? Can you go up and down? Can you do that against resistance? Good. Good. Up like this and down. Same thing, do it against resistance. Up and down. Oh, you're really strong. Arms all the way up. Any pain in the shoulders when you do that?
No.
Okay. And can you bring them back behind you like this?
Yes.
Okay. Any pain with that?
Maybe a little bit of a tightness, but not
Yes,
pain.
okay. You can relax for me. I'm going to have you do similar things with your hands. So lift your hands up for me and down. And don't let me pull you. And lift them up and don't let me push you. Okay. Can you go in and out with your wrists? Like this. Okay. On this side. Very good. Check your cap refill while we're here. That looks fine. Just checking the skin on your arms. You said you had a few things removed. Anything from the arms?
No, from my legs and my tummy.
Okay, these all look fine to me. There's just a little one on the inside there, but again, all flat, all around.
Oh yeah, I had one removed from somewhere here.
Okay. Looks like it's healed up pretty well, if that's the case. Your arm for me. Nice and clear on the inside. Give some pulses here. The pulse is a little bit deep. Is that normal for you to have a little bit of a weak pulse?
Usually I get heart palpitation sometimes.
Interesting. Those aren't quite as deep, but I do want to take your blood pressure just to make sure that you've got, you mentioned those sort of anxiety
Sometimes, yeah.
palpitations.
Thank you.
Do you have an arm preference?
No, I can do this one.
And slip that through. Sorry, tangled up here. Go ahead and relax your arm for me, please. And just breathe normally. This one's gonna just relax. All right, and just hold that for me for just a second here. Thank you. Okay, I'm just gonna set this right here with you.
Can hold it down.
And this arm just relaxes right on the, yep. Make it a little tight there. Is that okay?
Yes.
Okay. Blood pressure is 118/72, which is really good. So that's good. I just wanted to check that.
Thank you for that.
So as far as the pulses go, I'll continue to check as we move down. Just make sure that there's circulation. But do you ever get cold hands and feet? Tingling in the hands and feet? Okay. So that is not surprising to me with the pulse being a little bit weaker. And that's also not an indication of a connection to if you have a faster pace heart because of anxiety or something like that. It's not necessarily going to make the blood pump better to the extremities. So things that can help with that are just making sure your vitamins are all in check. So we might want to do some blood work as well as some, yoga, making sure your body is open and circulating properly. So I'm going to do the same sensation test, but on your arms.
Okay.
So again, close your eyes and just say yes when you feel it.
Yes. 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 Yes.
Can you flip this palm over for me, please?
Yes. Yes.
Good. Same thing on this side.
Yes. 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 Yes.
And flip the hand over.
Yes. Yes. Yes.
Perfect. And side to side, does that feel the same?
The same sensation, yeah.
Same sensation side to side?
Yes.
Here and there.
Yes.
And you didn't feel any less in the fingers there?
Same sensation.
Same. Okay. So that's good. All right, let me grab the other tool here and we're going to do sharp or dull. So again, this sharp sensation here, you feel that versus that?
Yes, very different.
Okay, so just tell me sharp or dull.
Sharp. Dull. Dull. Sharp.
Good.
Sharp.
Okay.
Sharp. Dull. Dull.
Good.
Dull. Sharp. Sharp. Sharp.
And flip the hand for me, please.
Dull. Sharp. Dull. Dull.
Very good. And just look straight ahead for me and don't pay attention to what I'm doing. Okay. As long as I have this out, same thing. Does this feel cold like that? Same
Yes.
temperature?
Same temperature.
Same temperature here?
Yes.
Same temperature there.
Yes.
I'm going to draw something in your hand. It's going to be a letter. I want you to tell me what that letter is.
A.
Okay, and now it's going to be a number.
1.
And on this side, same thing. This one's going to be a number now, too.
3.
Okay, and then a letter.
T.
Perfect. Using the hands, I'm just going to move a joint up or down. Do you feel the difference there?
Yes.
Okay. Go ahead and keep your eyes closed and just tell me up or down.
Up. Down. Down. Up.
Very good. Same thing on the other side.
Down. Up. Up. Up.
Awesome. So proprioception's intact. I'm going to give you an object to hold. Just want you to tell me what this object is. Keep your eyes closed.
Oh.
Let's try that again.
Tricky.
No problem. I'm going to give you an object to hold. Just tell me what this object is.
It's a feather.
Perfect. It's a feather pen, but close enough. All right, you can open your eyes now. I'm going to move down to your chest. For now, I'm just going to observe the heart. So you can just breathe normally. When you have those palpitations, do you get any shortness of breath or do you feel pounding in your chest?
I always feel the pounding, and sometimes I get shortness of breath, but not too bad.
Not too bad. And how long does that normally last?
A couple of minutes.
Okay. Okay, now I'm going to have you take a deep breath every time I touch you with my stethoscope, okay? Okay. Good. Okay, lungs sound clear so far. I'm going to tap here. It all sounds normal. I'm going to have you say 99.
99.
Okay, one more time.
99.
And again.
99.
Okay, take a deep breath in for me. And out. Good expansion. Let me go ahead and have a listen on the back. So flip around for me, please.
Yes.
So again, I'm just going to have a listen. And I'll just have you take a breath every time you feel me touch you. And last one. Okay. Any pain when I hit you here?
No.
About here?
No.
Take a deep breath in. And exhale. Good expansion. Say 99.
99.
Again.
99.
One more time.
99.
Okay. I don't hear any chest issues. I think that is definitely could be an anxiety reaction for sure. Just feel the spine. Just palpating here. Any pain when I press on here?
No.
I got the muscles on the other side here.
No.
You said there was some tightness in the shoulders.
Yeah. Around my shoulder blade.
Up here.
Yes.
Okay. Yeah, I can feel actually quite a big knot right there. You feel that right there?
Yeah, right there.
Yep.
That's the spot.
But there's good symmetry to your back. The spine is straight. That feels like muscle tension. You may want to see if your insurance covers massage. Well, many of them do. I think some massage therapy could be good for those tight muscles. There's some tight muscles right here as well. Okay, can you just tip to your right side? Okay, and to your left. And curl the head forward for me. And you can come back up. And just twist, yeah, like that. Any pain there?
No.
Twist to the other side. Does that feel okay?
Yeah.
All right. So, Luna, you can go ahead and lay your legs out long. I'm going to move down to the lower half of your body now.
Okay.
Okay, Luna, now that I have you down here, I'm going to take a look at your stomach. And you said no pain or discomfort in your stomach at this time?
That's correct, yes.
Okay. I'm going to just briefly, do you mind if I just lift this up for 1 second? I just want to take a look. Okay. Good. No bumps or swelling. I'm going to feel the stomach here a little. I'm just going to go really light. Let me know if there's any pain. Any pain with this?
No pain, no.
Go a little bit deeper. Again, just take a deep breath in and then breathe out. Any pain with deeper palpation?
No pain.
Okay. Just going to check some pulses here. Okay. And feel for a couple things here. That feels normal. I'm going to have a listen. Sounds good. I'm just going to tap here. Okay. Just checking the neck here really quickly while we're laying down. That's fine. Let's move on to your legs. Just going to feel the joints. Hip joint. Knee joint. Okay. Have you make some motions for me? Can you lift this leg off the table and put it down? Can you bend your knee and pull it up to your chest? Any pain with that?
No.
Okay, put it down. Same thing on this side. Leg up and in. Okay. I'm going to make a couple motions myself. Just relax. Is that tender or painful at all on the hip?
No.
That feels okay? Yes. Okay, can you push up against my hand? Good, and down. This side. And down. And put your knees upwards, your feet on the table. Yep, just like that. And resist me. Kick out. Good, same thing here. Any tension in the knees there when I do that? Pain? Okay. And you put your legs back out again. And just ankles up and down against resistance. Down, down, up. Push back on me. There you go. Like that. And then can you turn your foot side to side while holding that ankle there? Perfect. Okay. Did hear a little bit of cracking like you said, but nothing major. And I'm going to try and get your pulses really fast actually. Again, yeah, a little weaker in the toes, feet area. You said you had some coldness down here too?
Yes, all the time.
All the time, okay. I'm going to just touch you with the same cotton. You feel that over the leggings there?
Yes.
Okay. And just tell me yes when you feel it.
Yes. 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 Yes.
Okay. With the sharp or dull, are you able to feel the difference between that and that on the leggings?
Oh yes, definitely.
Okay, so tell me sharp or dull.
Sharp. Sharp. Dull. 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 Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp.
Good.
Dull.
Okay.
Sharp. 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 Dull.
Very good. I'm going to stroke the bottom of your foot here. I'm just testing for a reflex. Just relax. Okay. Okay. Check a few other reflexes just while you're down here. So just bend your leg for me just a little, just sort of like that. Perfect. Okay, good. And on the other one, very good reflexes. Good. Okay, relax. Pretty brisk there, so that's a good sign, since you have some of that coldness down there. We'll do your knees when you're sitting up again. Actually, I'll just try it again. Give me the full weight of your leg. There you go. Now clench your teeth on the count of 3. 1, 2, 3, clench. You feel a little funny, right? Give me the full weight of your leg. And clench your teeth. 1, 2, 3, clench. Good. Look at your arms when you sit back up. And then, lastly, do you feel comfortable with me taking off your socks?
Yeah, of course.
Just want to check in between the toes there. No history of diabetes in the family. Just check right here. And the cap refill. Okay, that's fine. Same thing on this side. All right, yeah, definitely feeling that coolness, temperature in the foot there. Right, Lena, go ahead and sit up for me. And just finish off with a couple of reflexes in the arms. Just give me the arm here and just completely relax. Give me all your weight. There you go. Good. Good. Again, relax. There you go. There, perfect. All right, the reflexes are all intact. They look great. Just look at my notes here, just make sure I didn't miss anything. Take that blood pressure. So do you have an arm preference?
My right or left arm.
Okay. So I'm just going to have you place this right on the inside like that. I'm going to press start and I want you to fold it up to the shoulder here, okay? Okay, wonderful. 126/91. And that is great because I know that we have had a little bit higher blood pressure readings in the past, so it looks like that's down. Thank you. I'm going to have you put this on your finger here and just rest that right on your leg. Meantime, I'm just going to be checking the pulse and watching your respirations for about 15 seconds. Okay. That's all normal and good, and you are fully oxygenated. Temperature, any fevers or hot cold lately, anything like
No.
that? All right, just get this here. Come down and across. And that is normal, 97.6. Same thing here. And a little higher, 98.1, but similar. No fever. So now that your vitals are all checked and everything looks good, we're going to start with the exam, starting out with some cognitive tests. So can you tell me where you are right now?
At the doctor's.
Okay, and about what time of day is it?
I'm about 11 a.m.
Okay, and what day of the week is it?
It's a Thursday.
Perfect, so you're oriented to time and place. Can you tell me what you had for breakfast today?
I had some eggs and toast today.
Okay, and tell me about what was your favorite subject in school growing up?
History.
Okay, so good short-term and long-term memory. Any issues bringing memories to the front of your mind or confusion?
No.
Okay, wonderful. I'm going to ask you to do some math for me. So if you have 100 and you subtract 8, what do you have?
92.
Okay, add 5 to that.
97.
And now minus 3.
94.
Okay, great. So you can do those calculations in your head. I'm going to have you repeat after me. No ifs, ands, or buts.
No ifs, ands, or buts.
Okay. Any issues with speaking or remembering words, being able to communicate, anything like that?
No.
Perfect. I'm going to give you this board here, and I'm going to ask you to just draw a shape for me. Any shape. Okay, and what would you call that?
A square.
And how many sides does a square have?
4 sides.
Okay. I want you to write a sentence for me. Any sentence can be just a few words long. Okay, the dog is orange. And can you describe what the word dog means to you?
A dog is an animal. It's a pet that we have.
Perfect. And what is the word orange mean?
It's a color.
It's a
It describes the dog.
Okay, very good. I'm going to just draw a shape here, and I want you to recreate it for me. It's a cube. Can you draw that shape for me? Perfect. All right, that looks great, Jeremy. Let's move on to the physical exam. I want to get some basic measurements, body measurements, before we begin. So I'm just going to get around the neck here. And around the cranium. If you lift your arms around, I'm just going to get around the waist. All of those are normal for your age and stature. All right, let's take a look first at your hair. I'm going to put some gloves on. I'm going to be touching you. Is that okay?
Mm-hmm.
All right, please tell me if there's any pain or sensitivity when I do that. Any pain there?
No.
That's all okay. And we'll look through the hair. Just close your eyes for me so I don't shine the light in by accident. And the hair looks nice and thick and shiny, clean. Any itching on the scalp?
No.
I don't see any flaking or anything. Really healthy looking. That's really good. I'm just going to check this side. I'm going to take a look at the face. Again, keep the eyes closed. Just looking at the skin, texture of the beard. You have any ingrown hair issues or anything lately?
No.
Just looking at all the skin, you're pretty fair. So we want to check for any lesions or moles. Turn your head for me, please. Any pain here?
No.
About right there.
No.
Okay. I feel some lymph nodes. Can you swallow for me? Good. And shrug your shoulders. I'm just going to check in here. Okay, relax for me. And the eyebrows and the eyes. Can you lift your eyebrows all the way up for me? Don't let me push it down. Okay, and open your jaw and don't let me push it up. Can you puff your cheeks out for me? Good. Turn against my hand here. Very good. The same thing on this side. And down, back. And I just want to see full range of motion there as well. So all the way down, tip your head. Okay, and tip it all the way back. Good. All the way that way to your left. And all the way to your right. And relax. Shrug your shoulders all the way up as far as you can go. Keep them there. Take a look into the eyes now. So I want you to just stare straight ahead right over there and ignore me. Ignore my pen. Good. You see my pen here?
Mm-hmm.
And does it look blurry or double vision at all to you?
No.
All right, just with your head only, or with your eyes only rather, follow it everywhere it goes. Good. No nystagmus. Any double vision with that?
No.
Can you follow it as I come in here? And out. Good constriction. All right. I'm just going to take a look at your pupils here. About between a 3 and a 4. That's normal for the level of light in the room. Any changes in your vision? I know you do wear glasses.
No changes.
And it's still the nearsightedness, so you just have trouble with long distance, right?
Mm-hmm.
Okay. Take a quick closer look. I'm going to have you read some things for me. So again, just stare straight over there and just relax. Okay, that looks great. Same thing on this side. Okay. I'm going to give you this little chart about here. Can you see the bottom line there?
Mm-hmm.
Okay, can you read that for me?
LTFFH.
Okay, cover one eye and read it backwards for me.
HPFTL.
All right, and same thing, cover the other eye and read it forwards again.
LTFPH.
All right, very good. I'm going to show you a few colors, and I want you to just tell me what you see.
Blue.
Okay,
Red.
very good.
Black or gray.
Mm-hmm. And what about this one?
Orange.
Great. So color, you seem to be able to identify. Have you noticed any trouble differentiating between colors, or if your definition of color is different than someone else's?
No, I haven't.
All right. Last thing with the eyes here, just cover one up for me with this. Okay, I'm going to do the same thing with my hand, and then I want you to just tell me, look straight into my eyes, and tell me when you see my finger wiggling.
See it.
Okay.
I see it. See it. See it.
Switch eyes for me, please. Same thing, look straight at me.
See it. See it.
Good.
See it. See it.
Moving on to the ears. Any issues with your ears, hearing problems, anything like that?
No.
Taking a look. Pretty clear. Do you hear this?
Mm-hmm.
Okay, close your eyes. Tell me left, right, or both.
Both. Left. Right. Right. Left. Both.
All right, very good. I'm going to whisper something in your ear. I'm going to close this side, and I just want you to repeat after me, okay? Chili is cute.
Chili is cute.
Okay, and same thing over here.
And a good boy.
All right. Let's do one more test just for fun. I'm going to hit this, put it on the top of your head. Remember how this goes. Tell me left, right, or same for where you hear it more.
Okay. Same.
Perfect. And tell me when it goes away.
It's gone.
Do you still hear that?
Mm-hmm.
All right, very good. Same thing here. Tell me when it goes away.
It's gone.
Okay, and how about now?
I hear it.
Perfect. While I have this, I'm going to do a little bit of vibration sense. So I'm going to strike it, and it's going to either vibrate like that,
Mm-hmm.
or feel just pressure, just that, like that. Does
Okay.
that feel different to you?
Mm-hmm.
All right, so tell me if you feel vibration or pressure, and again, really try and feel it and ignore the sound.
Okay. Vibration.
Okay,
Pressure. Vibration. Pressure. Pressure.
very good.
Vibration.
All right, and does this feel cold to you?
Mm-hmm.
Feel the same on that side?
Yeah.
Here and here?
Mm-hmm.
And this feels as cold as that.
Yeah.
All right, very good. I'm just going to test a little bit more of the sensation in the face as long as I'm on that. So I've got just a really soft touch here. I just want you to say yes when you feel it.
Yes. 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 Yes.
All right, same thing, except for I'm going to alternate between the sharper side and the softer side. So just say soft or sharp.
Okay. Soft. Soft. Sharp. 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 Soft. Sharp. Soft. Sharp. Soft. 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 Sharp. Sharp.
Very good. All right, no issues with sensation then. That all looks good to me. And let's go back down to your nose here and look really quick with my light. Any changes in your smell or your nose?
No.
I'll give you a couple things to smell. I just want you to tell me to the best of your ability what that smells like. So close your eyes. What does that smell like to you?
Citrus.
Yep. Lemon. And one more thing. Big breath.
Peppermint.
That's exactly right. Okay, moving on to the mouth. You just say ah for me, open up nice and wide. Okay. Any pain when you open and close your jaw here?
No.
A little bit of clicking. Is that normal for you?
Mm-hmm.
Okay, I think I remember that from last year. Not causing any additional pain or discomfort there, is it?
No.
Okay, clench for me one more time. Okay, and clench for me. Okay. You stick your tongue into this side here, nice and strong. This side here. You stick it out for me and move it side to side. Okay. Looks symmetrical, no dripping or anything like that. And no changes in your taste, right?
No.
All right. I think I want to move down to the lower, the upper half of your body now. So to do that, I'm going to have you lay back down, all right?
Okay.
Okay, Jeremy, I'm going to start on the chest wall here. I'm just going to listen. Again, I'm just taking a listen, so just relax for me. And take a deep breath for me, please. Another. Okay. I'm going to have you say 99 when I touch you.
99. 99. 99.
Right, now I'm just going to be patting on your chest here. Let me know if anything's painful, but I'm just listening for resonance here. sounds fine. Check your arms for a couple of freckles, but otherwise pretty clear. We'll probably just have you come in another time to do a full body skin check in about a few months. I know you were just here not too long ago for one. Do you mind if I just lift this up and look at your stomach real quick? Okay. I'm just going to have a listen. Same thing, you're going to feel me tapping. Press a little bit harder, just let me know if there's any pain. Do you still have your appendix?
Mm-hmm.
Okay. I'm going to go a little bit deeper now. Just going underneath here. The kidneys. Are you having any irregular bowel movements or urination problems?
No.
So that all looks fine. I'll take a look at your back when we get there. I want to look at your neck. Just looking for any pulsations here. While you're back. That's fine. I'm going to have you make a couple of arm movements for me, Jeremy. So can you go all the way overhead? Any pain with that?
No.
Okay. Come back down. I want you to just go to the side here, like that. And same thing on the other side. Any difficulty or pain with that?
No.
Elbows up and back. And wrists, can you roll that around? I want to test a little bit of strength, so keep your arms up like this, forwards, and push me away, and pull me towards you. Same thing with the wrists, just down. Push me here, push me down with the wrist itself, so down like that, like this. Yeah, perfect. Same thing on the side, back with the wrist, down with the wrist. Okay, can you go in and out, like side to side? Okay, a little bit of clicking there, but any pain with that clicking?
Slightly.
Just a little bit of discomfort? Okay, let's just take a look at the joint here. Just relax this arm. Let me make the movements here. Okay, I'm not feeling too much crepitus. It's moving really smoothly. Check on this side. And just let me make the movements. Any pain when I was doing it myself?
No.
Okay. So just keep an eye on that. Maybe do some wrist strengthening techniques. You can do yoga is really good for that. You know, downward dog, doing more planks, things that will give that wrist a little bit of stretching while also strengthening. Okay. If the problem continues, we can look closer at it.
Okay.
I'm going to do a few reflexes. So the first one's going to be right across your stomach. It's just going to be a little bit uncomfortable, okay? Just going to do it right on the skin here. Very good. Good reaction there. Next to the arm, just relax. Give me the full weight of the arm. Okay. I'm just going to place this right here. Good. Something on this side. Again, just let it loose. Very good. And last one here. I'm just going to draw something in your hand while you're laying down. I want you to tell me what number this is, okay?
1.
Okay, and how about this?
0.
That's very good. I'll do the same thing on the other side. I'm just going to draw 2 letters.
A.
One more time.
X.
Perfect. And this one?
O.
Okay. I'm going to give you something to hold in each of your hands. I want you to tell me what it is. So just keep those eyes closed. So what does this feel like to you?
A pencil, pen.
Yep, very good. Give you one more thing. I just want you to sort of feel around and tell me what this feels like with this hand.
A brush.
Very good. I do a bit of sensation on the arms as well. I'm just going to have you peel up your shirt there. Push up your shirt to your elbows for me, please. Put both arms on your stomach like that, separate, perfect. So keep them apart. I want you to just say yes when you feel it.
Yes. 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 Yes.
Same thing here.
Yes. 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 Yes.
Can you flip your hands over to the insides?
Yes. Yes.
Okay, relax again. Do this sharp and dull. So again, this is sharp, that's dull. You feel the difference?
Mm-hmm.
All right, tell me which is which.
Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. Sharp.
Okay, is this sharp all the way down the arm?
Mm-hmm.
Is this sharp all the way down?
Yeah.
You feel the difference between this and this?
Mm-hmm.
Feels cooler and warmer?
Yeah.
All right, tell me hot or cold?
Cold. Hot. Hot. Cold. 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 Hot. Cold.
When I hit it, it's going to make that vibration sound. Again, try and just feel the vibration. Vibration versus just pressure.
A vibration. Pressure. Pressure. Vibration. Vibration. Pressure.
Good.
Pressure. Vibration.
All right, so all that sensation looks intact. Just for fun, what does this feel like?
Water.
Okay.
Water.
Okay. And take your hand here. I've got either 2 points or 1 point. You feel that difference? Just tell me 2 or 1.
2. 1. 1. 2.
Okay, and could I see the other hand, please?
1. 2. 2. 2.
All right, excellent. Let's move on down to your legs. And we'll just continue the sensation down there as well. Mind if I pull these up a little? And pull your socks down a little as well. First, just checking the skin, as long as I'm here. So everything we just did on the arms, I'm going to do on the legs. Tell me when you feel it.
Okay. Feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Okay, is this sharp or dull?
Sharp.
How about this?
Sharp. Dull. Sharp.
Okay, does this feel sharp all the way down your leg? Same?
Yes, it is.
This one?
Mm-hmm.
Got cold or warm?
Cold. Warm. Cold. Cold.
Okay, same thing on this side.
Cold. Warm. Warm.
vibration versus pressure.
Vibration. Vibration. Pressure.
Good.
Pressure. Pressure. Vibration.
Very good. I'm going to do the same thing just on your toe here. What does that feel like?
Vibration.
Tell me when it goes away.
It's gone.
Okay, same thing here. Does that feel like vibration?
Mm-hmm.
Tell me when it stops.
Stop.
Remove the sock here. I just want to look in between the toes and at the bottom of the feet. Any history of diabetes in your family?
No.
Okay, good. Okay, can you push up against my hand? And push down? Right? And roll your ankles around. Okay. And have you put your legs up on the bed there? Yep, exactly. And I'm just gonna do it for you. Okay. A little bit of clicking in the knees as well. Do you have any knee problems?
A little bit, yeah.
Okay. Again, that yoga should help that. Any lack of strength, I want to test here with those knees. Push against me with this part of your leg. Yeah, exactly. And pull. No, strength is good. Same thing on this side. Push against me, pull me back. Very good. Out with the knees and in with the knees. Okay. Relax your legs down for me. Just gonna come check the hips here. Feeling those joints. Okay, can you lift this leg all the way up to your chest and open it for me? And inwards. Any pain with that?
No.
Okay, same thing on this side. Up, inwards, outwards. Good. All right, Jeremy, so that all looks fine. The last thing I want to do is just check the back of your lungs. So I'm going to have you just swing around here with your back facing me.
Okay.
Okay, perfect. Take a deep breath in for me. Just want to see that expansion. And out. Excellent. Okay, let's take a listen. So again, take a breath every time you feel me touch you. And just one more on each side here. Let's say 99 for me.
99. 99. 99.
I'm going to tap on the back. Any pain with this?
No.
It's all good. Let's check the spine. Any pain with that?
No.
About right on the other side here. That's good.
Mm-hmm.
Okay, can you lean forward for me? And then come up slowly, one vertebrae at a time. Slowly, slowly, keep coming. And all the way up. All right, maybe a slight curvature right in this upper region, but do you have any issues with scoliosis or back pain ever?
A little bit of back pain.
Okay, is it up in this upper back shoulder area?
Not always.
Not
no.
always. It could just be anywhere.
Mm.
Okay. Nothing. It's not something you would need fixed right away, but you may find that if you lack that strength at all in your back, you're going to get some pain just because there is a slight curvature there. All right. And last thing is just checking the skin here on the back. You do have a couple of freckles here. I'm just going to make a note of. One in the right upper quadrant, one in the bottom right quadrant as well, and the left to look clear. All right. Start out with the blood pressure. Do you have an arm preference?
Don't
Over
does
is
not
fine.
matter.
Normal. Just gonna sanitize my hands, and I'm gonna be touching your head and face. Is that all right? Okay. Just tell me if anything hurts. Okay. So you said you had some headaches.
Mm-hmm.
Any pain when I touch here? Those
No.
sinuses? What about right here?
No.
Okay, I'm gonna feel your hair,
Okay.
your head. Any lumps? Any pain or tingling when I do this?
No.
Back behind here, this is where you said you're having those
Mhm.
issues?
Yeah, it's a little bit
Little
a little bit more. Yep.
Right here?
Kind of like towards the back. Yeah.
These neck
Yep,
muscles here.
right there.
Okay.
Mhm.
Feeling for the lymph nodes back there. I don't feel any swelling. Is it tender when I touch it?
No, it's only when I have those weird headaches.
Okay.
When if I press down, I do get some, like it kind of hurts a little bit.
Yeah, I'm wondering if that's these. So these muscles back here can
Mhm.
get very tight.
Mhm.
I'm wondering when the sun comes in, if you're straining your eyes and it's putting
Mhm.
pressure on that muscle,
Yeah, I think so.
and that's then giving you some discomfort
Mhm.
back there. Just feel for the rest of your lymph nodes.
Mhm.
Can you shrug your shoulders up so I can get in here? All right, that all feels fine. Just taking a look at the face. Can you look that way for me, please? And don't let me pull you back. Okay, and that way for me, please. Don't let me push you. Shrug your shoulders for me. Don't let me push down. Close your eyes nice and tight and don't let me open them. Okay. I'm gonna have you make some faces for me.
Okay.
So smile and frown. Can you puff your cheeks out? And don't let me push them in. Okay. Nice and symmetrical there, so no drooping of the face. And your face is very symmetrical in general. Good hair distribution. Excellent. Take a look with my light. I'm going to start in your eyes and just look over my shoulder there.
Okay.
It's going to be a little bit of bright and discomfort here. Sorry about that. Good. Okay. I'm going to have you look at the tip of my pen and just follow it everywhere it goes. Just with your eyes. Any double vision here?
A little bit on the left.
The left side?
Yeah.
Okay.
Mhm.
So tell over here, you said?
Yeah.
Tell me where it goes double.
Right there.
Right up here?
Yes.
And is it single here?
Yes.
Does it go double down here?
No.
Okay. Look at the pen and follow it all the way in. This will cause some double vision. Cross-eyedness. Okay. Look far away. Ignore my pen. And now look at the pen. And look back. And back at the pen. Good. Any dizziness with that when that happened?
No.
No. Okay. And take a little bit of a closer look into those eyes. And I'm going to get a little bit close to you.
Okay.
Stare straight ahead. Good. Everything's normal there. Got this eye chart for you right here. And hold it about 14 inches from your face. And I just want you to read the last two lines for me, please.
C F D H J L T F P H.
Perfect. Do you have any issue? Do you wear glasses or corrective lenses at all? Okay, that was 20 out of 20. And I'm just going to give you some colors to look at. So what color is this?
Purple.
What color is this?
Yellow. Blue. Red.
All right. And if I put these two together, what color are you seeing?
Green.
Perfect. So looks like you have full color vision. Going to take a look with my light into your nose. I'm just going to tilt your head back just a little there. And it looks clear, no swelling, no redness. Can you breathe in for me? And on this side? Everything okay there? You can breathe in? Any issues? You said no issues with your smell, right?
No issues with my smell. I had really bad congestion last month for like a few weeks.
Okay. Is it better now? It seemed
It's
like you
better
had patency.
now. I think it was the influx of allergies coming in, and then I got over those few weeks, and now I'm feeling normal again.
Okay.
With the spring changes and everything.
Any itchy eyes or?
Yeah, like I just couldn't breathe through my nose, and I just had a lot of congestion for like a few weeks in my throat and nose. But I'm feeling a bit better now.
Okay. Were you taking a daily allergy pill, antihistamine?
I was only taking it if my symptoms were really bad and I was needing to like go to work or something. But I was trying not to overdo it with the medicine. So just when my symptoms were pretty bad.
Often a daily allergy pill can actually be the most effective when you take it regularly. So I would say if that happens again and it's harder to manage than just day-to-day symptoms, you can consider doing that. They are designed to be a 24-hour relief. But it seems if you can get through it, then that's up to you. But certainly not dangerous to do that daily allergy pill. Just make sure you're taking a daily one and not one that's designed like a Benadryl that's designed for more extreme reactions.
Okay.
Go ahead and open your mouth for me. Let me look at the back of the throat then. Say ah. Can you stick your tongue out for me? Just looking to see if there's that redness. Looks pretty clear to me. Okay. Take a look into your ears. So just tilt your head to that side for me. A little bit of a wax buildup, but no redness, swelling. Can you turn the other side, please? Same thing on that side. I'm going to do a couple of hearing tests on you. Have you ever had someone use a tuning fork on you?
No.
Okay. So what's going to happen is I'm going to hit this. It's going to make a sound, a ringing sound, and I'm going to put it in the center of your forehead. You tell me if you hear it left, right, or equally on both sides.
Okay. Right.
Here on the right side? Okay. Close your eyes. I'm going to do it again. Tell me right, left, or both.
Right.
Okay. I'm going to hit the tuning fork. I'm going to put it behind the ear on this side. And tell me when you can't hear it anymore.
Okay. Okay. Now.
Can you still hear it here? Perfect. Do it on the other side.
Okay.
Can you still hear it there?
Oh, yes.
So it does seem like you have just a little bit more hearing loss on your left side than you do on your right, but do you have any issues with that day to day?
No, I don't.
It's very mild.
Yeah.
I would say like 1 or 2 seconds longer you could hear it on one side. It's nothing I'd be concerned about at all. Close your eyes. I'm going to make some noises. I want you to tell me left, right, or both.
Okay. Left. Right. Both. Left. Left. Both.
Perfect. I'm going to whisper something behind your ear while I close this one off. Tell me what I say. B, F, G.
B, F, G.
Okay, and then this side. 1, 4, 6.
1, 4, 6.
Perfect. Test just a couple of reflexes in your face. I want you to let your jaw hang for me.
Okay.
Good. I'm going to tap your forehead and just look right there.
Okay.
Don't pay attention. Okay. While I have this out, I'm going to go ahead and do your arms as well.
Okay.
just relax fully in my hand. Okay. And again, stare straight ahead. Don't pay attention to me. All right, on the other side. Okay. Just give me your full weight. And stare right ahead. Great. Take a listen to your chest now. Just breathe normally. We're just going to be listening to your heart. Can you lift this arm for me? Okay. Take a look at your chest. Take a deep breath for me. Let it out. Say 99 when I touch you.
99. 99. 99.
Just going to tap on your chest a little. Nice and clear so far. Just going to listen to a couple places. Take a breath when you feel my thing. Okay. And last one. All right, nice and clear. I'm going to have you just swing around. I'm going to look at your back. And you mentioned on your right side, that's where you're having the pain, right here. Does it hurt to the touch?
Yes, slightly.
Slightly sore. Anything on this side?
No.
What about when I bang like this? Any pain? Okay. Take a deep breath in for me. And let it out. Good, and same thing. Say 99 when I touch you.
99. 99. 99. 99.
Okay, I'm just going to tap again. No pain when I did that. Have you take 4 more breaths for me. And press on your spine back here. You sort of tilt your head forward as if you're going to bend down and dive into a swimming pool. Yes, perfect. Just feeling those tight muscles down here. There's a lot of tightness right on this side.
Yeah, it hurts like right here.
Right here, down in the sacrum area.
Yeah.
Right here.
Mm-hmm. It's been there for over a year now.
Okay. Can you open your, you can face forward and open your leg to the right and back. Open, close. Maybe a little bit of crepitus there.
Mm-hmm.
It just feels like tight muscles to me. Does it feel good when I press on it or bad?
No, it feels good.
Okay, so
Yeah.
that to me seems like rolling or massage might be helpful
Yeah.
there. It seems like a really tight
Mhm.
muscles and not. I'm going to have you just lay back here and take a listen to your stomach. Swing your legs down. Perfect. And take a listen to your stomach. I'm going to feel just a little bit here. Let me know if anything hurts. Any pain? Okay, everything sounded great. While I have you laying down, I'm going to take a look at your legs. Alright, so I'm going to make some movements in your leg here, so just let me make him. A little bit of popping in that knee there. That was the one that was bothering you, right?
Mhm.
Yeah. Okay. Can you push up against my hand here? Good. And on this side? Good. And bend this knee. Perfect. And push out. And don't let me pull you. Good. Same thing here. Bend the knee. Push out against my hands. And don't let me pull you in. Okay. Definitely a little more weakness on this side as well, I can tell. So that would line up with if you're having more compensation on the right side because your left side is weaker. Mm-hmm. While I'm here, you can go ahead and push against my arm. Push. Like that. Yep. And on this side. Okay. I'm going to do some reflexes while I'm down here as well. So just relax. Okay. Alright, go ahead and swing around for me. Perfect. So Tori, I'm just going to do a couple of neurological things and we're done for the day, alright? So I'm going to take this pen and I'm just going to draw a number in your hand. Close your eyes for me and tell me what number.
3.
Okay, and the other hand for me. And this is going to be a letter.
B.
Yep. I'm going to touch you on a part of your body. I want you to point to where I'm touching you.
Okay.
Good. Does this feel the same on both sides?
Yes.
And here?
Yes.
And here.
Mm-hmm.
All right, very good. So put that under your tongue. There you go. You can hold that there. And while you do that, I'm just going to go ahead and check the pulses in your hand. Okay, excellent. Next up, I'm just going to go ahead and check some of your other vital signs, get your blood pressure. Do you have a preference of which arm you like to use?
No.
Okay. Go ahead and stick that arm out for me. So you should feel a little bit of pressure. If it gets to be too much, just let me know. Okay, excellent. Pressure is very good. Next, I'm just going to go ahead and start the head-to-toe assessment. Is it okay if I touch you?
Mm-hmm.
Okay, so I'm going to start by just looking at your head, looking at your hair. Do you have any pain when I do this? Touch your palpate?
No.
Okay. Hair looks clean. No pests or bugs. No dandruff. Okay, and I'm going to just check your lymph nodes here, so let me know if you have any pain. Down the back of your neck. Can you shrug your shoulders for me? That? Okay. Excellent. I don't feel anything there. And then I'm just going to go ahead and look into your eyes. So go ahead and just look right at my nose and ignore the light. Okay. Good. You follow my pen light with the tip of the pen light as it goes Don't move your head, just move your eyes. Okay, any double vision with that? Okay, go ahead and look at the tip of my pen and follow it as it goes in. Good. Pupils constrict and react to light and accommodation. I'm going to go ahead and look into your ears. So if you just turn that way. Okay, looks good. Any pain when I palpate the outside of your ear here?
No.
Okay, other side. Any pain there, like that?
No.
Do you have any issues with hearing or hearing loss?
No.
Okay, I'm going to go ahead and make some soft noises next to your ears. Can you close your eyes and tell me which side you hear it on?
Left. Right. Both. Left. Right.
Very good. Okay, so it doesn't seem like there's any issues there. I'm just going to take a quick look into your nose. It's going to involve me gently placing my hand on your nose. Let me know if it hurts in any way. Okay. Do you have any problems with smell or taste at all?
Not really.
Can you go ahead and breathe in that nostril and breathe in there? Okay. Any issues with blockages or
I might have slight allergies.
slight allergies? Okay.
Yeah.
Do you feel like it comes and goes, or does always one side?
Comes and goes.
Okay, that's pretty normal. I would say like most people will have some occlusion on one side or the other throughout the day. As long as you're not feeling like you can never breathe through one nair or the other, then it's not really cause for concern. I'm going to go ahead and look in your mouth now. Could you open up wide and say ah? Excellent. Do you have any problems with pain in your teeth or anything like that?
No.
And when was the last time you went to the dentist?
Several months ago.
Okay, good. So you go like every 6 months or
Yeah,
so.
I try to get my checkup.
Good, excellent. So that all looks good. I'm going to go ahead and check some of the nerves in your face now. Go ahead and can you smile for me? And frown. And lift your eyebrows up. And can you puff out your cheeks? And don't let me push them in. Good. Okay, I'm going to check some sensation as well. Just go ahead and close your eyes and tell me when you feel it.
Feel it. Feel it. Feel it. Feel it. Feel it.
Good. So cranial nerve is intact. And can you go ahead and clench your jaw for me? Sort of clench down. Do you ever have any problems with your TMJ? Any clicking? Any popping?
Occasionally.
Open and close for me. Okay. Yeah, I feel a little bit of clicking and popping. Does that bother you quite a lot, or
No.
No, it doesn't bother you too much. It's not too bad. It's not too pronounced. If it gets worse, go ahead and let me know. Okay. And then I'm just gonna do a couple other things. Can you go ahead and shrug your shoulders for me, and against my resistance? Good. And then try and turn your head against my hand. Good. And this side. Good. And push your tongue inside onto my fingers. And then over here. Good. Okay, so good strength all around. Your face looks symmetrical. Your eyebrows look good and healthy. The facial hair looks very healthy and doesn't have a lot of ingrown hairs or anything like that. And the lips look good, not too dry or chapped. So, and the lips look good, not too dry or chapped. So that all looks good. I'm just going to take a look at your neck now. I'm going to go ahead and just look for the pulses. Okay, I'm going to go ahead and feel now, one at a time. The other side. Good, nice, strong. I'm going to have a quick listen. You can breathe normally. Okay. Good. Okay, so no bruise, nothing loaded there. That all sounds good. So I'm going to go ahead and move on to your arms now. I'm just inspecting your arms for any lesions, bumps, lumps, rashes. The temperature is warm and consistent throughout the arm. Good. And down to your hands, cap refill, less than 2 seconds. Good, the other side. Warm to the touch, no blemishes. Cap refill is good. Do you have any problems with the musculature in your arms? Any pains? Anything like that? Okay. I'm just gonna go ahead and check the strength in your arms. So you can go ahead and put your arms up like this and prevent me from pulling. Prevent me from pulling. Prevent me from pushing. Pushing. Good. Now with your hands, can you go up like that? Prevent me from pulling. Prevent me from pushing. Good. And then just with your fingers alone, so like this. Open and close. Any pain there? You open your fingers wide. Don't let me push them in. You keep them closed. Don't let me pull them apart. Good. Good strength. So you can go ahead and put those down. That all looks fine. 5 out of 5 for strength. If you have any changes in one side or the other, if it wasn't symmetrical, we could look into it further, but you seem totally fine. I'm going to go ahead and check some sensation in your arms as well. So go ahead and close your eyes and tell me when you feel it.
Feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Good. So next I'm just going to do a quick sharp and dull. So I'm just going to move this, it's not sharp, but it's not soft, all the way up and down your arm, and just let me know if it feels differently at all. Feels the same sharp all the way up? All the way up? Okay. This side? Feels the same all the way up? Okay. Good. All right, I'm just going to move to your chest now. I'm going to go ahead and listen to your heart and your lungs. So for your heart, you can go ahead and breathe normally. Just going to listen in a couple of spots. Okay, great. Don't hear anything abnormal there. Consistent pattern. And do you have any, do you ever feel tired after you exercise for short periods of time? Anything that would be concern for your heart?
No.
Okay. I'd say that with good blood pressure means that there's really no concern there. So next I'm just going to go ahead and palpate the front of your lungs. So that's just going to involve me tapping on your chest and listening to the sound of it. So if you have any pain or tenderness, let me know. Otherwise, you can just breathe normally. Okay, that all sounds good. So now I'm just going to take a listen, and I am going to have you take a deep breath in every time I move my stethoscope. You can also pretend. And one more. Good. Okay, now I'm just gonna go ahead and do the same thing on the back. If you can go ahead and just shift your body. Again, I'm just gonna be palpating, so let me know if you feel any pain. Now I'm just gonna take a listen. Go ahead and take a deep breath in. One more. One on this side. And last one. Good. Can you take a big breath in for me? And let it out. Good. Symmetrical expansion on both sides. Okay, you can go ahead and sit back down. So I'm just going to listen to your stomach for any bowel sounds. That all sounds fine. And I'm just gonna palpate a little bit. If you have any pain, let me know. Any pain there?
No.
Just gonna feel for your spleen. You can take a deep breath in and let it all the way out. Good. Don't feel anything, so it means it's probably not enlarged. So I'm just going to go ahead and inspect your legs, palpating for any lumps, bumps, any pain when I touch. Any pain here? No. Okay. Go ahead and check for, I'm just going to go ahead and sip this. Just check for temperature. Feels warm and dry to touch. Yeah. Warm and dry. Okay, excellent. Can you go ahead and put your legs up? Yep, like that. And pull, keep me from pulling. And push. Good. And you can put your legs back out and put your feet up. Keep me from pulling. You can put them down. Just put your, yeah, like that. And then push down. Good strength on both sides. Okay, so I'm just going to check some of your reflexes down here. So go ahead and put the weight in my hand. Good. Good. And sort of bend your leg out like this. Yeah, exactly. Good. And the other side. Good. Okay. I'm just going to go ahead and check the Babinski reflex. Just going to run this little piece up the bottom of your foot. Might feel a little odd. Good. Good. So I want the toes to curl inward there, and they did. So no sign of a Babinski. Go ahead and sit back up. We're going to finish up with your reflexes and then do a neurological exam. So I'm going to go ahead and check the reflexes in your arm. Go ahead and give me all the weight of your arm. Just go completely loose. Just completely relax your arm. Yeah, perfect. Good. And here, again, completely relax. Good. And right here. Good. Okay, on the other side. Again, just completely relax. Give me all the weight. Good. Good. Okay, so I'm just going to finish up with a quick neurological exam. So can you go ahead and take your fingers and move them one after the other, just like that. Good. And can you take your foot and slide it down your shin like this? And on the other side. Good. Okay. And lastly, I'm just going to go ahead and put something in your hand. I want you to close your eyes and tell me what it is.
Pen?
Yep. And I'm going to draw a letter in your hand. I want you to, or a number in your hand, and tell me what number it is.
2.
Good. And the other side?
4.
Yep. Perfect. Okay. So overall, I would say that you look really good, really healthy. There's nothing that's given me cause for concern. So do you have any questions before we end our visit?
No, I think that's it.
Okay. Well, I'll see you in a year. And thank you so much for coming in.
Thank you very much.